गुरुर्देवो महेश्वरा गुरुर्साक्षात् परब्रह्मा तस्मै श्री गुरुवे नमः तस्मै श्री गुरुवे नमः तस्मै श्री गुरुवे नमः.
Good evening, everyone. It's my great pleasure to welcome all the participants to this important event, the Dharaka National Seminar Day 2. Your presence here today demonstrates a shared commitment to knowledge and collaborations, which makes this gathering even more special. I extend a warm welcome to our esteemed panel members. Your insights and expertise will undoubtedly enhance the depth of today's discussions, and we are truly grateful for your time and presence. Without further delay, let us begin the presentation and dive into the knowledge sharing sessions that await us. I hope this seminar provides you all with valuable insights and meaningful exchange. Thank you once again for joining us, and let's get started. First is a paper presentation. First, I would like to invite Dr. Kamal Sahu for the paper presentation. Dr. Kamal, please share the screen, doctor.
Good evening, respected teachers. Myself, Dr. Kamal Sahu, Datta Meghe Institute of Higher Education and Research, Mahatma Gandhi Ayurveda College Hospital and Research Center. My topic is management of Bahya Vidradhi abscess resulted in the complication of intramuscular injection by Kshar Tail, Achyranthes, aspera, and Adjuvant Drug, guided by Dr. Pooja Srivastava, ma'am, guide and associate professor, Department of Salyatantra. Introduction: an abscess is a pocket of pus enclosed within tissue filled with granulation tissue and surrounded by a membrane that produce pus. The incidence of abscess was 512 per 10,000 person per year in females and 387 per 10,000 person per year in male. Injection abscess is a condition where injection arises after an injection either in isolated incidents or in a cluster outbreak. This infection is typically caused by contaminated injection or lapses in sterilization process. In addition to infection like Pseudomonas, Klebsiella, E. coli, and S. aureus, less frequent organism like Mycobacteria, particularly the quickly proliferating non-tubercular variety, can also be caused. Incision and drainage is treatment of choice for abscess, but they often result in delayed healing, recurrent and painful. Char is indicated for abscess vidradhi by Acharya Susut. Achieving complete healing and reduced recurrence rate involve two stages: Vrand Ropan and Vrand Sodhan. using Kshar Tail, incision and drainage followed by packing with povidone iodine solution has several drawbacks such as recurrent and using discomfort, pain to patient, consequently effectively treating post insides and drainage abscess remain significant challenge for surgeon. There is a need to new formulation to take abscess and enhance healing, ensure proper drainage, promote mature healing and minimize patient discomfort. Patient information: a 32-year female patient, resident Vardha, come with chief complaint. Patient arrived with painful swelling over right gluteal region with spontaneous buzz gluteal abscess since 1 week. On examination, of wound side there was tenderness and redness present. Patient suffer from high grade fever that has been presented from 1 week. The persistent fever was accompanied by chills but no rigors. First, it first the pain was intense, then got worse. Within a week, mild itching also present around the wound. Past history: patient was apparently well before 1 month. She received intramuscular injection from general practitioner of village for fever. According to patient description, physician do not follow any aseptic precaution. C2 treatment from general practitioner but not got any relief. Hence, C come to our Salya OPD of Mahatma Gandhi Ayurvedic College Hospital and Research Center for further management. Clinical finding: physical examination. The patient had a thin build and normal vital sign, no other abnormality. Local examination, inspection and palpation. Size 2.5 into 2.5 into 5 centimeter in dimension. Number one, size frank pus discharge, discharge size, frank pus discharge margin regular floor, unhealthy, covered with edematous wall, pain, intense temperature, locally raised lymph node involvement nil. Diagnostic assessment are HB 10.9. TLC count is 15,900. Total RBC count for 4.2 million per cubic mm, and platelet count 1,71,000. ESR raised 92 per first hours. Montoux test negative, hepatitis B non-reactive, HIV non-reactive. Detail of treatment was performed. Char gel cleaning for wound irrigation twice daily for 28 days. Char tel packing quantity adequate twice daily for 28 days. Tablet Tiflagugul 500 mg twice daily. Normal water after meal for 28 days. Tablet Tribhuvan Kirti 125 mg crush tablet if needed SOS. Tablet Gandhak Rashayan 500 mg twice daily with normal water after meal for 28 days. Amlaki Churna 6 gram twice daily with normal water for 28 days. Assessment criteria: objective parameter pain, healing, renovation and discharge. Subjective parameter itching. Result pain was relieved completely in 14 days. First discharge completely stop in day 14. Granulation tissue appear in day 7. Healing completely in 28 days. Itching reduced significantly in day 14. Detail of outcome in ascending order: pain was relieved. Follow up after complete healing of wound, proper taken follow up of patient for 6 months. No evidence of recurrence was noted. Figure shows first figure first day of treatment, profuse first discharge. Second figure shows seventh day of treatment, granulation tissue appear. Third figure show 15 days of treatment, epithelial cell started proliferation. 18 figure fourth, 28 days of treatment, complete healed. Uh, discussion ingredient of Kshar Tail, मूलिक क्षार, यवक क्षार, सर्जिक क्षार, स्नेहक नमक, संचार क्षार, वीड नमक, समुद्र नमक, हींग, सजी सहजन, सोठ, देवदारू, बच, फूट, स्नूही, रसोद, पीपल, नागर मोथा, केले की जल, बिजोरा नींबू, मधु सुक्त, तिल तेल. Property of Kshar Tail. Kshar possesses property like stambhan, astringent property, pachan, and dahan, which induce hemostasis by quickly stopping bleeding. When char is applied, it burns and peels the mucosa, leading to cessation of bleeding. Char then exhibit autolytic debridement property by neutralizing acidic pus and assisting in tissue debridement. According to Acharya Susru, Char follows two critical stages of wound healing, burn sodhan and burn ropan, by facilitating effective wound cleaning and promoting wound healing. Indication of Char then administration it into the ear canal, cure all type of ear problems such as pus discharge, otorrhea, ear actinitis, deafness, and earworms. This oil also destroy facial disease. By applying a drop of this oil, the pubic hair fall off and does not grow again. This oil is also effective in a treatment genital hernia, leprosy, ringworm, and eczema. When char is applied to a wound, it enhances circulation, thereby promoting faster healing. In case of in case of wounds such as pilonidal sinus and fistula in their slump impedes healing, using char is the wound aids in desloughing this process, facilitates subsequent healing stages. Conclusion: the management of intramuscular injection abscess using Kshar Tail demonstrate promising outcome in this case study by following Ayurvedic principle of wound management, including effective wound cleaning and promoting healing. Kshar Tail effective resolve symptom within minimum recurrence and patient discomfort, suggesting its potential as an alternative treatment approach. Thank you.
Thank you, Dr. Kamal Sahu. Thank you for the wonderful presentation. Next is also a paper presentation related to the beauty and Ayurveda. I would like to invite Dr. Shilpa Vaibhav for the paper presentation. Dr. Shilpa.
Namaste everyone. Myself Dr. Shilpa Patil, PG Scholar, Department of Rachanashari, GSC Dharashri. My guide name is Dr. Manisha Davde, HOD and Professor, Rachanashari Department, GSC Dharashri. My topic is application of Ayurveda for enhancement of different aspects of beauty. Beauty is manifested through appearance and complexion of skin. So cosmetology is gaining utmost importance nowadays. Taking care of skin with Ayurveda is more safe compared to other chemical cosmetics. Cosmetology is the science of alteration of appearance and modification of beauty. According to Drug and Cosmetic Act 1940, cosmetics may be defined as any substance intended to be rubbed, poured, sprinkled, and applied to human being for cleansing, beautifying, to promoting the attractiveness. According to Ayurveda, tvacha, that is skin, is the mirror of individual's health. It is a Matrudhati Avya. It is known as Upadhatu of Rasadhatu. Sushruta has described its 7 layers. The effect of dhatus on skin. Rasadhatu supports all the body tissues for keeping the skin healthy. Raktadhatu, in association with liver function, it helps to detoxify the skin from toxins. Mausadhatu provides the firmness and tonicity to the skin. Thus, an effective Ayurvedic cosmetology should provide support to all these 3 areas. Aims and objectives are a review of anatomy of skin, study of different skin types according to dosha, and CTM regimen. Anatomy of skin. Skin is made up of multiple layers of epithelial tissue. Microscopically, they are named epidermis, dermis, and subcute tissue. According to Ayurveda, skin types and their general characteristics. Vata skin is dry, thin, delicate, cool to touch. It easily gets dehydrated. It ages faster, tends to dry, rough, and flaky. Pitta skin is usually fair, sensitive, more prone to moles, rashes, sunspot, and acne. And Kapha skin is oily, thick, pale, soft, and it struggles with dull complexion, enlarged pores, and excessive oil. Lepa Kalpana in Ayurveda. Lepa is the freshly collected wet drugs that are made into a fine paste form and used as an external application. Types of lepa according to Sharangara, Doshagna, Vishagna, and Varna. According to Sushruta, Pralep, Pradeha, and Alepa. Mode of action of lepa is lepa are usual. Applied against the hair follicle direction, that is in Pratilomagati, that facilitates the quicker absorption of drug through Romakut, Svedvahini, and serum of the Bhajak Pitta, said to be metabolize the substance of drug applied to the skin along with Samanvayu and Vanvayu. Ayurveda supports the theory of Srutamaya Purush that indicates so that when medication is applied to in the form of lepa or pradeha, the minute particles of the substance penetrate into tvacha owing to the gravitational pull and weight of drug. A transdermal drug application, according to modern science, depends upon the site of application, thickness and integrity of stratum corneum, size of molecule, state of skin hydration, pH of drug, drug metabolism by skin flora, and lipid solubility. CTM regimen, that is cleaning, toning, and moisturizing. Cleaning is the starting with washing face with cleanser, followed by exfoliating and staining to remove dirt and impurities. It is followed by toning, that is to recover the natural pH level of skin with masking, and then final step is the moisturizing the skin. CTM regimen for different skin types. For Vata skin type, cleansing with milk and rose water, exfoliating with rice or almond water, and staining with plain water. Toning with rose water, massaging with aloe vera gel. Mask is with avocado. Is great for Vata skin as it is creamy, smooth, and will hydrate the skin within no time. And moisturizing with almond oil. For Pitta skin, cleansing with the rose water, exfoliation with milk and sugar, steaming with neem leaves and water, toning with rose water, massaging with coconut oil or sandalwood oil, mask of crushed rose petals, milk, sandalwood powder. Certain these herbs help drawing out excess heat from skin and provides nourishment to the tissue of the skin. Moisturizing with neem oil or manjistha oil. CTM regimen for kapha skin is cleansing that contain citrus such as lemon, orange, etc. Exfoliation with sea salt plus honey, steaming with mint leaves, toning with rose water, massaging with aloe vera plus turmeric, mask of multani mitti, honey and rose water. These drugs helps in balancing the kapha dosha in skin as well by helping detoxification and moisturizing with almond oil useful as a kapha. It is useful because kapha tends to accumulate as the arm and ama gets built up easily. Finally, conclusion and discussion. Just as with one's diet and daily routine, knowledge of the dosha is the answer to your skin question. Naturally, the health and radiance of our skin depends as much on our general health as what material we use to wash and moisturize. Your skin is your protective barrier between inner world and outer world. The quality of skin reflects our inner vitality and health. Look after your skin so that you are protecting yourself as well as you protecting your world. No amount of bleaching, chemical creams, or application of makeup as you need through dexterity of skilled beautician. Ayurveda says what you eat, you apply on your skin. Thank you.
Thank you, Dr. Shilpa. Thank you for the wonderful presentation. Next is also a paper presentation. Next, I would like to invite Dr. Shidi Parmar for the paper presentation. It is a topic related to autism. Autism Ayurvedic management is explained by Dr. Shidi.
Myself Dr. Shiti Parmar, second year PG scholar, Department of Komar Prithya from Parul Institute of Ayurveda. Today I am presenting a case study wherein Ayurvedic approach in management of autism. What is autism? Autism is a spectrum disorder, is group of heterogeneous childhood onset neurodevelopment condition by social communication defects. Autism usually appears in the first 3 years of life, which affects the brain's normal development of social and communication skills. It is characterized by a trait of qualitative impairment in verbal and non-verbal communication, imaginative play, and also social interaction. Early signs of autism. So how we can decide that these are the signs of autism? First, delayed or lack of speech, repetitive movement of body parts such as arms, heads, impaired social skills, interest in activities or play, poor eye contact with others and also with family members, not responding to their name and not talking as much as other children. Symptoms: behavioral, inappropriate social interaction, they do not communicate with many people, also they has a poor eye contact, Also, compulsive behavior, impulsivity, and repetitive movements in developmental symptoms are seen such as learning disability or speech delay in a child. Psychologically, unwanted of others' emotions or depression. There can be also seen symptoms such as anxiety and does not show facial expressions such as happy, sad, angry, surprised, etc. by the months of 9 months of age. Concept in Ayurveda. So Ayurveda, there is a concept of Agni which working in every individual, and Agni is responsible for every digestive and metabolic activities. In such, in each and every person, if there is impairment in Agni, it causes impairment in the metabolism. And there is accumulation in metabolic waste in the system. The metabolic waste altering the brain functions. Here now we start with a case study details. A male 5 years old child represented with mother, informant with mother at Parol Ayurveda Hospital with a complaint of hyperactivity, no communication skill, poor eye contact, and lack of communication with other family members. Informant, as I said, with mother, noticed her child is unable to communicate with family members with herself. Concerned about his hyperactivity, she also reported that child is doing purposeless movements and does not sit at one place for minute. Mother reported about his sleeping patterns wherein child has awakes early in the morning around 4 o'clock daily, and after that he descends sleep for all day. History was antenatal history. Infection was not there, absent. Antenatal checkups were regular. Iron and folic acid supplements were taken, and maternal illness was absent. In natal history, type of delivery was LSES, full term was there. In postnatal history, birth weight was 3.5 kg, birth cry was immediate, breastfeeding initiated, newborn complications were absent, and also there was no NICU admission. Feeding history, mode of feeding was breastfeed, no other supplements were given. Also, associated problems with feeding was not seen, and weaning period was started after the completion of 6 months. On general examination, we noticed hyperactivity, inattentive, poor socialization and communication, facial dysmorphism. Vitally, patient was within normal limits. Motor development, gross motor and fine motor skills was achieved as per age. According to Ayurveda, Asthana Pariksha, Nadi, Vata, Pitta, Mutram, Prakrutam, Jivha was normal, Sparsham, Ardram, Akriti, Vata, Akriti, Vata Paitika, Shabdam, neither Guru nor Sputam, Drika, Jaladram, Malam, Pinditam, with Pandu, Sveta Varnam. Provisional diagnosis, the clinical condition was provisionally diagnosed as autism. According to the Ayurveda, it can be correlated with Udmadam. Treatment, Shirodhara in Panchkarma and on Ayurvedic intervention. Going with Panchkarma therapy, Shirodhara was done daily for 30 to 40 minutes up to 3 months. Also followed by Nasya, 2 drops in each nostril, morning and evening for 3 months. Abhyanga followed by Nasya was done with Bahya Tail, morning and evening. Basti was given, Matra Basti 30 ml. Also Ayurvedic intervention was done with Brahmi Vati, 1 BD after food. The result was such as symptomatically relief was marked after Panchkarma therapy and internal medications. Sleeping hours were increased, also sleep disturbances were markedly decreased. Hyperactivity was reduced. Also, child was relatively calm after 7 days of Panchkarma therapy. Eye contact was improvement, mild improvement can say was seen. Child started looking and listening to others when called by. Also communication started with parents with a few sentences. Thus I discuss with this that autism is a brain development condition. Autism manifests itself as difficulty in communication, socializing with others. The disorders can also include obsessive behavior. It's an spectrum disorder, as I said earlier. It affects in different ways. The core symptoms of autistic disorder include impairment, mainly in domains such as impairment in social communication and interaction, behavior activities such as a restrictive and repetitive pattern of behavior. Ayurveda has good potential to manage the psychological and behavioral disorders by plant origin medicines and also by major effect of a Panchkarma therapies. The primary goal of the treatment are to maximize the child's ultimate functional independence, that is quality of life, by minimizing the core features of the disorders. Thus, I conclude my whole discussion is that earlier identification and intervention of autism spectrum disorder is associated with better outcomes, as early implementation of therapies like Abhyanga, Nasya, Shirodhara can help in improving the child's quality of life, social and behavioral functions, along with language development in early phase of brain development. Delayed diagnosis can lead to poor outcome. In Ayurveda, Panchkarma procedures and medicines reduce the symptoms of autism without causing the adverse effect of growth of the body in growing stage. Thank you. I thus complete my presentation.
Thank you, Dr. Kshidi Parma, for the great presentation. Next is a paper presentation related to the anorectal disorders, Patya and lifestyle management. We go to the presentation. I would like to invite Dr. Ashish Kumar Ajay Kumar Mishra for the explanation.
Good evening, everyone. I'm Dr. Ashish Mishra. I'm pursuing my MS Shalitantra from late Kedar Ayurveda Bahya Vidradhi. Today, I'm presenting the topic role of Pathya and lifestyle management in the Gudagat Rogas. Uh, Introduction. In this present competitive world, so due to sedentary lifestyle, inappropriate and irregular diet, irregular disturbing the Ratri Charya, night shifts, prolonged sitting works, and psychological disturbance. So all these factor causes disturbing the digestive system, which leads to constipation and anorectal pathologies. So there are anorectal disorders, which includes hemorrhoids, internal and external hemorrhoids, anal fistulas, anal fissures, rectal prolapse, anal and perianal abscesses, and even rectal cancer. All these conditions causes distress and daily routine work hampered, and therefore this all these conditions should be taken under consideration, and we should treat this or change the lifestyle and pathyapathas which can be helpful to treat or treat or prevent or normal and behavior causes. Dietary causes: consumption of processed junk, baked, and dairy products, intake of highly spicy and oily foods, extra teas and coffees, consumption of extra non-vegetarian and weight reduction plans, lack of a fibrous food diet, lack of water intake, viruddha ahar, and irregular diet plan, which is adhyasan means quantity of food is both too much or too less, and excessive amount of taking meals earlier than the digestion process of a previous meal. Lifestyle causes: Pravahan means excessive straining or excessive toileting time. Utkata asan means the posture uh, produces stress at anal location. Then a poor hygiene and lack of cleanliness and unawareness of the perennial care. Suppression of natural urges of defecation and panvayu. Extra coitus or anal intercourses. Lack of sporting activities. Increasing stress or disturbed sleep. Addictions like smoking, alcohol intake, tobacco chewing, etc. Intake of food regime, hurry, curry, and worry manners. Different reasons. Ruksha Durbal Deha, roughness, loss of fats in the rectal fossa. Agni Mandita, if weak digestive system, and Ajirna, indigestion due to passing of harsh stools, constipation, and extra diarrhea. Iatrogenic causes damage at perianal region, perianal tear during delivery, and surgical fall. Samanya Samprapti, pathophysiology of the common anorectal disorders. So there are we have Trayo Upstamba, Ahar Vihar, Nidra and Brahmacharya. So Ahar Vihar, an improper sleep cycle, and Brahmacharya. According to Ayurveda, the root cause of all the disorders is directly or indirectly related to Agni. All these unhealthy habits causes vitiation of dosas, causing mandagni and vitiation of apanvayu, leading to accumulation of mala and vitiated dosas in the Godavari, which leads to manifestation of the Gudagot rogas. Then Ayurvedic control via safety measures. So following preventive measures can be used. So first is eating regime modification, lifestyle amendment, smooth domestic methods, and yogic or physical activities. So, what pathyas we should follow? Throughout the time of food consumption, we should pay attention to meal and eat slowly and proper chewing methods. Alter amount of frequency of food consumption as per need. Increase fiber intake in the food plan and water consumption as well. Food plan consists of cereals, wheat flours and chokers, pulses, and greeny leafy vegetables. Fruits, we should also eat fruits, papaya, pomegranate, apple, and all this. Probiotics, which is curd, takra sevan, vegetable salad consumption. Then makhana is also very useful in the constipation and digestive related problems. And we should also eat, drink liquor milk after dinner. Apathyas, which we should avoid to improve our digestive fire, Jathagni. Avoid junk food, highly spicy, oily foods, which disturbs our Agni. Loss of fibrous meal, we should avoid such meals. Abnormal and consumption of extra non-vegetarian diet. Ingestion of foreign bodies like Asti, Shalya, Creamy, and many others. Indigestion of Kashaya Rasa Ruksha Guna and Vat Prakopak diet. Viruddhahar, dietic incompatibilities, abnormal diet, amount of diet both too much or less, taking a meal earlier than the digestion of previous meal, and improper chewing of food. Lifestyle modifications. So first is Ushna Jal Avgah Sved, hot seeds bath. Almost a little quantity of spatika or tunkan is introduced in lukewarm water two times in a day and means at night time and in the morning after defecation. Matra basti 5 ml of Jatyadi Tel often in a day after defecation per rectal we can use. Yogic exercises which is mentioned by Acharya Shushruta and some of pelvic floor exercises with contraction and relaxation of anal opening, which is beneficial in anal prolapse and ano incontinence of the stool. Yogasans, Vajrasan, Virasan, Madhyasan, Paschimottanasana, Bhujangasan, Halasan, and Surya Namaskar. There are mudras, Ashwini mudras, which is closely related to pelvic floor exercise only. Mudrasan, then Bandh, Mool Bandha, Udyan Bandha, and Mahabandha. Pranayam, Anulom Vilom, Nadi Shodhan Pranayam. Then principal purpose of anorectal issue is the Mandagni due to Ahitkar Ahar and Vihar. So we should avoid Ahitkar Ahar Vihar. Suitable following of the Dincharya, Ratricharya, and Ritucharya is beneficial to controlling in a wrong way of life and unhealthy behavior of an individual. Dincharya and Ritucharya makes a person disciplined about each day's routine. Seasonal variation affects Agni of a person. So according to season, we should adopt ourselves. And due to global warming, the season and climates are changing in improper manner, causing Viruddha Ritucharya. But nevertheless, by meaning of analyzing the climate modification and digestive strength, the diet, way of life may be controlled. Consequently, the right functioning of the digestive system is useful in relieving constipation, which is similarly prevents perikartika or anorectal disorders. So these are
Thank you, Dr. Ashish Kumar. Next, we have a case study on management of Amlavitta with Padoladipat. This presentation will explore how this Ayurvedic formulation was effectively used to treat Amlapitta or hyperacidity, highlighting its potential in managing gastrointestinal issues. I would like to invite Dr. Ashwini Bhandarkar for the presentation.
Hello everyone, myself Vaidya Ashwini Bhandarkar, and I am going to present a case study on management of Amlapitta with Patoladi Vat. My guide is Vaidya Rajan Kulkarni sir and HOD is Vaidya Sanjeev Lokhande sir. Amlapitta is a disease with a lifestyle component that affects people all over the world. It is also a disorder brought on by environment and irregular food and psychological and physiological surveillance. Amlapitta is thus a widespread illness in the modern period. As the world becomes more urbanized, life moves much more quickly and standards are rising. When pitta is vitiated, it consumes foods and beverages that are incompatible, rotten, and accidentally sour, which might elevate the drava and amla gunas of pitta. Three doshas are thought to be involved in Amlapitta according to Acharya Kashyap. Whereas the primary dosha in this illness, according to Madhav Kara, is Pitta. Acharya Charak only listed Amlapitta as a symptom, not as a distinct illness. Agnimanda and formation of arm are the root cause of Amlapitta. So while treating the disease with Shaman Chikitsa, drugs having Ampachan and Agnidipan properties are mainly used. Katu and Tikta Rasatmak Dravyas mainly possess Ampachan and Agnidipan properties. Patoladi Kwat is combination of mainly Tikta Rasatmak Dravya which is useful in treatment of Amlapitta. Aims and objective to study an effect of Patoladi Kwat in management of Amlapitta. A 40 years male patient having chief complaints of Udar Urodaha, Amlodgar, Aruchi, Rillas, Chardi, Udarshul, Klama, and Brahma came to OPD at Ashwin Rural Ayurved Hospital, Manchihil. The patient was suffering with above symptoms since last 4 to 5 months. The patient was farmer by occupation and having habit of alcohol consumption 1 to 2 times per week since last 7 to 10 years. He had taken allopathic treatment for few months but has got only temporary relief. He had no history of hypertension, diabetes, or any major illness in past. No history of any surgery in past. Steps per minute and regular. Mutra Samyak, Mala Samyak, Jivva Sam, Shabda Spashta, Sparsha Ushna, Druka Samyak, Akriti Madhyam. Subjective criteria we have taken. First is Daha. 0 grade, no Daha in any area. First grade, Daha occurs in one of the area, that is Ura Udar Kukshi, for more than half an hour occasionally. Grade 2, Daha occurs in any two area, occurs daily for half an hour to 1 hour. Grade 3, Daha occurs in more than two area daily for 1 hour or more and relieves after vomiting and digestion of food. Grade 4, severe Daha occurs in whole body areas like hands, feet, and sarvanga and does not get relieved by any measure. Next parameter is Amlodgar. Grade 0, no Amlodgar. Grade 1, occasionally occurs during day or night time and lasts for less than half hour after each meal. Grade 2, Amlodgara occurs after intake of each meal or any food substances for period of half to 1 hour and get relieved by digestion of food or vomiting. Grade 3, Amlodgara occurs for more than 1 hour and not relieved by any measure. Grade 4, Amlodgara causing disturb to the patient, even small quantity of fluid regurgitate to patient's mouth. Next parameter is Chhardian Rallas. Grade 0, no vomiting at all. Grade 1, frequency of salivation every day. Grade 2, feel sense of nauseating and vomiting occasionally. Grade 3, frequency of vomiting is 2 to 3 times or more per week. Grade 4, daha or pain is aggravated. Next parameter is Udarshul. Grade 0, no pain at all. Grade 1, mild or occasional pain which need no medication. Grade 2, pain in abdomen for less than half an hour and relieves after intake of sweets, cold drinks, etc. Grade 3, severe unbearable pain which does not subside by any measure. Grade 4, unbearable pain associated with a frequent vomiting and hematemesis. Next parameter is Aruchi. Grade 0, willing for all edible food. Grade 1, unwilling for some specific diet but less than normal. Grade 2, unwilling for any specific rasa, that is Madhur, Katu, Amla food. Grade 3, unwilling towards dislike food but not to other. Grade 4, completely unwilling towards meal. Next parameter is clum. Grade 0, no clum at all. Grade 1, feeling of lassitude without shrama daily for sometimes. Grade 2, feeling of lassitude without shrama daily for long duration. Grade 3, always feels tired and have no enthusiasm. Contents of Patoladiquat are Patol, Shunti, Guduchi, and Katu. Tikta Rasapradhan Dravyas are mainly preferred in the treatment of amla pitta. In this case, Patoladiquat 15 ml in BID dose was given to the patient internally before 1 hour of each meal with lukewarm water for 15 days. Follow-up of patient was planned after 7 days for the assessment of symptoms. Patient was advised to take simple diet and avoid heavy, spicy, and oily food. He was also advised to avoid alcohol. Observation and result before treatment and after treatment. The assessment of patient was done before and after treatment on the basis of relief of symptoms in given table. After 15 days treatment, it was observed that patient has 98% relief in symptoms like Udar, Urodaha, Amlodgar, Rillas, Chardi, Udarshul, and Brahma. And in symptoms like Aruchi and Klama, the relief was 80% and 75% respectively. The overall percentage of relief was found to be 90%. Patoladiquat is very simple and cost-effective herbal formulation. Overall ingredient of the Patoladiquat are mostly Tikta and Katu, Rasapradhan, and shows Agni Mandahara effect, digest arm, pacify the Vidagdha Pitta, and helps in relieving symptoms of Amla Pitta. Conclusion is diet and lifestyle plays as important role in both pathogenesis and treatment of amla pitta. To treat the disease from its root cause, one must follow the patya described in Ayurveda. Both Shodhan and Shaman Chikitsa are given in Ayurveda classics for treatment of amla pitta. Patoladiquat contains four dravyas which are mostly tikta rasa pradhan, Pitta Shamak, and having Dipan Pachan Rochan properties, and hence it is useful in Amla Pitta.
Thank you, Dr. Ashini. Thank you for the presentation. Next, we will explore the effect of Rasaushadhi in Tokvigara. This presentation will focus on how Ayurvedic formulations, minerals-based medicines, Rasaushadhis, are used in the treatment of various skin disorders. I'd like to invite Dr. Anushree Beer for the presentation.
Namaste everyone, I'm Dr. Anushree from Government Ayurveda Medical College, Bengaluru. Currently, I'm pursuing my post-graduation in the Department of Rasashastra and Vaisheshya Kalpana. My topic of discussion is effect of Rasaushadhis in Vikaras. So today I'm going to explain about the two important formulations. They are Gandhaka Rasayana and Shishilekavati. So coming to the introduction, prevalence of skin disease in different geographical region of India varies from 7.9 to 60%. And the necessity of a treatment is high as it carries a cosmetic importance. There are many treatment modalities described based on the dosha avastha like Shamana Shodhana therapy. Rasaushadhis are one among them. All of you know Rasaushadhis in Alpa Matra, because of its Ashukari Guna, it acts fastly in a less dose. So the first formulation is Gandhaka Rasayana. So Gandhaka Rasayana is explained in various texts like Yoga Ratnakara, Yoga Ratnakara, Vaishya Ratnavali, etc. Here I'm taking a reference of Rasatarangini. The mainly Gandhaka Rasayana has a Gandhaka and other herbal drugs like cow's milk, Trijataka, etc. Here Shuddha Gandhaka was subject to a bhavana, the first with Godugdha, followed by trituration with Chaturdhataka, Kvata, and Guduchi Swarasa, Triphala Kvata, Shunti Kvata, Brahmaraja Swarasa, and Adjaka Swarasa for 8 times each. Then the Gandhaka is collected and mixed with the equal quantity of sugar and preserved in a airtight bottle. This compound is called as Gandhaka Rasayana. So Gandhaka, when we look into a Gandhaka is having a Katu Madura, Rasa, and Virya is Ushna Virya, Vipaka is Katu, and Doshagnata is Kapavatahara, Rogagnata is Gara Vishahara, Kshudra Kushta, Rogagnata, it can be given in Gara Visha, Kshudra Kushta, Dadru, Vali, Palitya, and it has act as Rasayana and Kandugna Karma. And the dose is 1 masha. As all you know, our body contains sulfur in it. It makes our DNA. And then it has an antibacterial property, antifungal property, and it also acts as a keratolytic agent. Moving on to the other ingredients, Triphala is Kapha Pittagni and Pushtagna, Chatujataka is Kapha Vatahara and its Varnya, Guduchi is Tridoshagnahara, Rasayana, Brungaraja is Kapha Vatahara and Rasayana, Adraka is Kapha Vatahara, Deepana, Godugdha is Rasayana and Vata Pittahara, Shita is Sita is Vata Pittahara. So dose is 1 masha for 1 month we can take. It can be used in other conditions like Brana and all kind of kushtas, and it acts as a rasayana. It can be given in Kalitya, Palitya, and apatyas like during Gandhaka Rasayana consumption, we need to avoid Kshara, Amla, Lavana, and Dvidala Shaka. All this increases the pitta. Even because of Gandhaka Rasayana, Ushna Guna, it increases pitta. To avoid excessive pitta dosha prakopa, we need to follow this. So then coming to some of the research articles, screening of antibacterial and antifungal activity of Gandhaka Rasayana. Coming to results, there was a significant zone of inhibition was noted in a bacteria Staphylococcus, fungus like Trichophytum rubrum and Aspergillus niger. This toxicity increases the global acceptance. So there is one toxicity study of Gandhaka Rasayana. Chronic toxicity study of Gandhaka Rasayana, a herbal mineral preparation used in the Ayurvedic practice. Gandhaka Rasayana at 0.54 gram per kg and 5.4 gram per kg showed a significant elevation in the serum SGPT level in the male rats. Histologically, examination revealed the mild pathological changes in organ like kidney, liver, spleen, and jejunum was seen, and data generated during a present study clearly showed that Gandhaka Rasayana is safer for a clinical use at a prescribed dose level. So it's safe. Then there is one clinical study, management of Dadru with Dadru Lepa and Gandhaka Rasayana, a case study. Gandhaka Rasayana 250 mg per TID was given along with a Dadru Hara Lepa. So here you can see the markable changes before and after treatment. The possible like side effect of Gandhaka Rasayana may be a bloating or a loose stools. It's maybe because of Ushna Gunatva. So decrease of Ushna Gunatva, we can give Kshira, which is Shita in Virya. So let's move on to our next formulation, that is Shashilekavati. Shashilekavati. It is explained in Yoga Ratnakara Kushta Roga Adhikara. The ingredients are Parada, Gandhaka, Tamra Bhasma, and Bhavana with Bakuji Kvata. So, moving on to ingredients, Kajjali is Tridoshahara, Yogavahi, Rasayana, and Sarva Amayahara. Tamra Bhasma, it is having Kashaya, Rasa, Madhura Vipaka, Ushnavirya, Lekana, Deepana, Krimihara, Karma, and it is Kushtahara. So, Coming to Barakuchi. Bhakuchi is best used in Shvitra. It is having Tikta Rasa, Ruksha, Lagu, Saraguna, Shita Vidya, Katu Vipaka, Vrana Ropana and Shopahara Karma. It is indicated in Kushta, Shvitra, Pandu. Coming to the role of copper in melanogenesis. So there is one compound called for production of melanin, there is a required of a copper. So there is one enzyme called tyrosine, which is converted into dihydroxyphenylalanine. So to convert this tyrosine into dopa, there is a need of triosinase. That is a copper enzyme. That is a copper enzyme. This dopa is again converted into dopaquinone with by the action of triosinase, that is a copper enzyme. So this dopaquinone is converted into idoloquinine, then polymerized into a melanin. So overall, for a production of melanin, there is a need of triosinase, that is a copper enzyme. So when the copper decreases in a body, there is a less melanin content, which may lead to a Shvitra condition. So it is exclusively indicated in Shvitra. The dose is 250 mg. Anupana is Bakuchi Taila and Madhu. Coming to a research article, the clinical evaluation of Shashirekavati is in the management of Shitra with special reference to vitiligo. The treatment given was Shashirekavati 125 mg TID for 49 days. It is observed that 30 patients in a group of drug, 19 patient has got a complete repigmentation, 17 patient there was 51 to 75% of repigmentation, 3 patient had 26 to 50% of repigmentation, and 1 patient had a minimal repigmentation. Coming to a result, patient who have, this is a conclusion, patient who have consulted in the early stage of the disease obtained a good result compared to the chronic patient. Coming to a toxicological study of Shashilekavati, the clinical parameter indicates the safety of Shashilekavati for a human dose group. The histological finding 10 times the human dose group showed a degenerative changes in the liver and the kidney. So it is safe to use because we will be using in 250 mg per day. So it is safe. Yeah, okay. Okay, thank you.
Thank you, Dr. Anushree. Next, we have Dr. Rajnandini Budara presenting on Hingula. This session will cover the properties, uses, and therapeutic applications of Hingula, a significant mineral used in Ayurvedic medicine. Please join me in welcoming Dr. Rajnandini Budara. Doctor, are you there?
Yeah, I'm here.
Good evening,
Actually,
doctor.
I have been some additional inputs into that. So shall I share my screen?
Sure, doctor.
Yeah, just a second, okay? All right, done. Is it visible?
Yes, doctor, visible. Please start the session, doctor.
So, good evening, everyone. I'm Dr. Rajnandini Ramnaran Bhutada. Okay, I'm studying in Rasayana and Bhaishya Kalpana in Yashwant Ayurveda College, Kodali. And my topic for a paper presentation today is Hingul. It's the basic introduction of Hingul, its properties, identification, Shodhan, etc. And I will also in detail discuss a bit about its antimicrobial activity. Okay. So Hingul, these are the this is Hingul actually, the different pictures. All right, and it's the seventh mineral of Sadharan Ras, identified as cinnabar, and it's a red sulfide of mercury, also called as HGS. So it has 86% of mercury and 13% of sulfur, generally found in massive granular or earthy form, and it's scarlet to brick red in color. So it has an adamantine luster, and it has been used for pigment and also as well as for extraction of mercury in the ancient times. Okay, and its occurrence is in Spain, Italy, Germany, France, America, Brazil, Russia, China, Greece, Afghanistan, Iran, and Japan. So it's not majorly found in India. It is artificially prepared in laboratories also. So now let's move towards the identification properties of hingul. So hingul, like we can see on the screen, it has cochineal red color, which goes towards brownish red also. It has prismatic cleavage and specific gravity of 8.1. Diaphanity transparent in thin pieces, fracture uneven to subcondyle, crystal system trigonal trapezohedral, habit rhombohedral to tabular, granular to massive and as incrustations. Hardness is 2 to 2.5, luster is adamantine. All right, and classified under it is classified under Maharas. There are 8 Maharas, and Hingul is classified as that according to Rasarnav, Rasaridaya Tantra, Rasa Kamadhenu. But as we follow Rasaratna Samuchaya more, and hence we study them the Hingul in Sadharan Rasa. On the 7th number it comes. So according to Rasaratna Samuchaya, it is in Sadharan Rasa. There are many names of Hingul, for example, Chayilyam, Hingulam, Hingul, in English, Cinnabar, and in Tamil, also called as it's also called as Lingam. Again, synonyms: Ingula, Raktha, Kapi Shirshak, Hamsapada, Chitranga, Rasodbhava, Ranjanam, Malecha, Suranga, Raktakaya, Darada, Churna Paradam, and Rasasthanam. Each name has its own specific what do you call own specific meaning for the same. All right, for example, churna paradam, like a parad is extracted from the same, hence it's called churna parada. All right, and next we are moving towards Hingul Swarupam. So Japa Kusuma Varnabha Peshane Sumanoharah Monojvalo Bharapurno Hingula Shrestha Uchyate. Japa Kusuma Varnabha. So like jasmandi flower it is. It resembles the same flower. Then when you rub Hingul, it looks beautiful. It shines. It has a bright shining after rubbing, and it is a bit heavy when you hold it. All right, and there are types of hingul. Hingula shukatundakyo hamsapada tathaparah. Prathamo alpaguna tatra charmarah sanigaddate. Shvetarekha pravalabo hansapada sa iratah. That means shukatunda and hansapada are main two types of hingul. Shukatunda is considered as heel ones, when Hansapada is considered as the Shrestha one, and it has white linings over it. And according to Ayurveda Prakash, there are 3 types: Charmara Rakta, Shukatunda, and Hansapada. Again, here also they have considered Hansapada as the best type because it's Japa Kusuma Samkasha. It looks like the jasmine flower. And according to Rastarangini, it has 2 types: Khanij and Krutrima. Like I said, artificial hingul. And hingul Shodhan, there are 3 methods majorly. First is uh, we have to make churna of hingul, and ardrak swaras. We have to give 7 bhavana of ardrak swaras, and in this way hingul shodhan is done. In the second method, we have to give 7 bhavana of lakucha swaras, and in the third method, first we will have to give 7 bhavana of mesha dugdha, and then in the second step, after that, we have to give 7 bhavana of amla varga dravya. Properties of Shuddha Hingul are Hingula Sarvadoshagno Deepano Ati Rasayana Sarva Rogahara Vrusho Jaranayatishasate Itha Madadhyatah Suto Jirnagandha Samo Gunehi. That is, it's Tikta Katu Kashaya Rasa, Ushna Virya it has, and Kapha Pitta Nashak. All right. That means, let's see, it has tikta katu kasharas. It means that it's mostly vata gun it has. Ushna virya, kapha pitta nashak, deepan rasayan netra rog rullas kushtha jwara kamla pliha amvat Vishrog Nashak, and Ruchi Medha Agni Dehakanti Bala is increased. It is also used in Parajjarana, and also it is used it is also used as Rasayana also. All right. And Ashuddha Hingul, those when consumed Ashuddha Hingul, it causes Moha, Chitta Vibram, Klama, Prameha, Andhya, Shainya. Hingul Maran, Shuddha Hingul put on a cotton cloth and then put into, just a second. Then put into hello. Then put into Nila Madan Fal, Indravaruni Fal, and Amlavetas Fal alternatively, and covered with mud dipped cloth, and 100 putters and 10 upals are given alternatively. Bhasmaguna, Jatharagni, and Kama Shakti are doubled. Acts on Kasa, Shwasa, Kshaya, Jwara, etc. Sorry. I'm not able to actually, just a second. Okay. Anybody able to see the screen? Everybody able to see the screen?
Now the screen is not visible, doctor.
Okay, now it is visible.
It isn't sharing, doctor. Now
Yeah.
visible, doctor. Now visible. Please continue, doctor.
Okay. And then we do Sattva Patana of Hingu also. There are the Patana Yantre Patitascha Jalashe Tat Sattvam Sutta Sankasha Jayate Natra Samshaya. Out of Patana, two methods of used. Urdhva Padan and Adha Tirak Patan is not used here. Required quantity of Hingul is taken in clean khalwa and subjected to bhavana with Ardhoksvaras 7 times. It is dried and taken into lower pot of clean Urdhva Patan or Vidyadhar Yantra. Another pot is kept over it. Sandhilipan is done, and condensation of mercury vapors is done by placing a wet cloth over the upper pot. Okay, so when mercury is collected in the upper pot, it is collected, washed, and used as Hingulutha Paran, and that is the Sattva Patan. That is how the Sattva Patan is done. Dose is half to 1 gunja. Amyuk Prayog Hingul with Jati Phala, Pipli plus Shunti plus Shuddha Gandhak, Shukrashritavat. Then Shingul with Pipli, Ativisha, Madhu, and Ardak Swaras used in Jwara. Hingul with Jati Phala, Lavanga, Indraeva, Karpura used in Amatisara with Urja. Hingul with Jati Phala, Ahifena, Musta, Karpura, Indraeva used in Amatisar. Hingul with Guduchi Sattva used in Amlapitta. And important yogas of Hingul are Amruta Manjari Ras, Kamagni Sandipan Ras, Jvaradhuma Ketu Ras, Sri Siddha Dardamrutam, Hinguliya Manikya Ras, Dardamruta Malahar, Hinguladya Malahar, Anand Bhairav Ras, Kshetra Phara Ras, Jwaramurari Ras, Mrutyunjay Ras, Hinguleshwar Ras, Sri Siddha Hinguleshwar, Daradvati, Hingulamruta Malahar, and also very well-known drug of or choice, that is Tribun Kirti Ras. So antimicrobial activity of Hingul, actually it is there are many research papers and all over this, which have proven that the drugs, like for example Tribun Kirti here, it has shown antimicrobial effect, and it has also shown effects on jwara. It's clearly written, and the main ingredient in all of these four examples that I have written here, the main ingredient is hingul. So Tribun Kirti Ras is used in jwara as well as Rasayana also. In Mrutyunjay Ras, hingul is the main ingredients. It nullifies kapha, and it also has jwaragna properties. Hinguladya Malhar, it is again used in external application, antimicrobial in nature, and it is used in Firanga Vrana. In vitro study has also been done on this Hinguladya Malhar. And now Anand Bhairav Ras. So again, antimicrobial properties of Anand Bhairav Ras have also been tested, as Hingul is Katu Tikta Kashaya Ras and Ushna Katu Guna. So it is Kapha Pittahar, and just a second. So these four examples, like there are papers as more important ingredient of Ananda Bhairav Ras is Hingul, Tibon Kirtin Mrutyunjaras and Hinguladya Malhar also. And as the Rasa Virya Vipak definitely have Katu Ras Ushna Virya and Laghu Ruksha Guna it has. So it has an exception and it can be acted like an antimicrobial agent, and hence there are many articles which have proved them. So this was all about hingul and its antimicrobial activity in short. Yeah,
Thank you, doctor. Thank you for the wonderful presentation.
thank you, sir. Thank you so much.
Next is a paper presentation. I would like to invite Dr. Rohini Nagendra for the paper presentation.
Namaste everyone. I'm Dr. Rohini Nagendra, a third year PG scholar, Department of Rasashastra and Bhaishajya Kalpana, Government Ayurveda Medical College, Bangalore. My topic of presentation is an Ayurveda perspective of diet and lifestyle in skincare and skin disorders. Today we'll be learning about the introduction, Ahara, Vihara and Swastha and Atura, and the conclusion part. So, as we know, Ayurveda is a science which deals with the holistic and scientific approach of swasthasya swasthya rakshanam, aturasya vikara prashamanam cha. So all this can be achieved by ahara, vihara, aushadhi, which strengthens mind, body, and soul. Twak or skin is a barrier organ which protects the internal organs and the body from harmful agents, regulates body temperature and immune system. It aids in hydration, stores fat and vitamin D. According to Ayurveda, Twak is one among the Jnanendriya. It indicates the health of a person, a sthana of Brajaka Pitta. It is the nutrition, it gets its nutrition from Rasa and Rakta Dhatu and its Dhatwagni, Ashraya of Svedavaha Srotas and Loma. Coming to Ahara and Swastha, Ahara is considered as one among the Trayopastamba. In Matra Shitiya Adhyaya of Charaka, we can assess the quantity, quality, and intake time of food intake. The ideal quantity of food intake would be 2 parts of solid, 1 part of liquid, and 1 part which is left empty for proper movement of doshas and proper pachana. So dietary regulations would be including all shadrasas in a meal. The sequence of food intake would be Guru, Snigdha, Madura, Amla, Lavana, and Ruksha, Katu, Tikta, Kashaya. After consuming of ahara, one has to make sure they walk 100 steps. Vihara and Swastha in Dinacharya, Brahmi Muhurte Uttashte, that is waking up in Brahmi Muhurta, followed by Abhyanga, Udvartana, Pratimarshanasya, Vyayama, Gandusha, trimming of nails, beard and hair are considered various aspects to maintain skin health. In Rutucharya, we get references of Rutu Anusara Lepa, Rutu Shodhana, which help in maintaining good quality of skin. Vegadharana, like Chardi Vegadharana, leads to various skin disorders. In present era and our daily life, we find Viruddha Ahara, excessive use of lavana, kshara dravyas, stress, anxiety, sleeping habits, and lack of exercise, which are being the main causative factor for skin disorders, which leads to dosha dhatu and sroto dushti, which causes impaired digestion and metabolism. which again in turn leads to dull, dry skin, dark circles, hair fall, or other major skin disorders. Ahara in skin disorder. Nutritional medicine. Food which cleanses the internal atmosphere should be consumed, thereby aiding in skin healing. Anulomana, Deepana Pachana, Dosha Shamana, Dhatu Prasadana, and Ojo Vartana Dravyas have to be given. Ahara which cause Anulomana, Deepana Pachana are Manda, Peya, Vilepi, Yavagu, Yusha. And one has to include protein, vitamin A, B, C, zinc, selenium, probiotics, omega 3 and omega 6, and antioxidants, which help in healing the gut as well as the skin. Aushadha Siddha Jala, which are Deepana, Pachana, as well as Rakta Prasadana. Example, Musta, Shadanga, Amrita Shadanga, Padmaka, Dhanyaka, Parpataka, etc. can be consumed throughout the day. Viharas like Abhyanga, Snana, Dhara with medicated oil and water can be done. Malahara applications, yoga, pranayama, Padabhyanga can be done to cure skin ailments. Avoiding of alcohol, tobacco, smoking, use of excessive cosmetics, etc. help in curing skin disorders. Importance of ahara and vihara mainly help in preventing by restricting the pathogenesis, interferes in disease course, thereby easily resolving it. It nullifies the adverse effect of the disease and medicines, prevents of the disease. Day, he'd be devoid of any disease. And also, a person who follows dinacharya, ratricharya, ritucharya cannot be affected by any disease. Thank you.
Thank you, Dr. Rohini. Thank you for the wonderful presentation. Next, I would like to invite Dr. Lakshmi R. Pillai for the paper presentation.
Namaste everyone. Myself Dr. Lakshmi R. Pillai, third year PG scholar from the Department of RSPK, GMC Bangalore. Today my topic of presentation is Rasaushadhi in Tvakvikaras. Introduction. Ayurveda is a holistic science which deals with health, diseases, and their management by using herbal, mineral, and animal originated drugs. The Shastra, a branch of Ayurveda, specially deals with the use of various minerals and metals along with the procedures required to transform it into therapeutically fit medicines. In Ayurveda, there are three types of medicines like Asuri, that is therapy involving various herbs and rituals, Devi, divine therapeutics, and Manavi, medicinal therapies. Rasaushadhi, herbo-mineral and herbo-metallic medicines comes under Devi Chikitsa. In the Shastra classics, mainly in Dasaratna Samuchaya, separate chapter is allocated for skin diseases. In this chapter, 40 formulations are mentioned for Kushta Chikitsa. Major ingredient in most of the formulations are Gandhaka, Haritala, Tamra Basma, and Swarnamakshiga Basma. In this review, an effort is made to explore in detail the effects of above drugs in Tvakvikaras. Kushta is a Tridoshaja Vyadhi mentioned in Ayurveda that undergoes manifestation in Bahya Marga. Kushta is considered as a Mahagada due to its Durvijnaya, Sutustara, and Daruna Svabhava. The Samprapti of Kushta begins with a multitude of interaction of Tridoshas with Tvak, Rekta, Mamsa, and Lasika. Gradually may afflict other dhatus depending upon the strength of Samprapti Ghataka. Rasaushadhi mainly corrects the doshas, dusha vitiation, with the help of its rasa, virya, and vipaka. Coming to the first drug, Gandhaka. In the Shastra, Gandhaka has been classified under Uparasa Varga. Gandhaka is being given prime importance because of its Rasayana property and also for its Prativisha property against Ashuddha Parada. Gandhaka, owing to its Madhura Rasa, Katuvipaka, Ushna Virya, and Kapavadahara properties, it has Vishakna, Krimikna, Kantu, and Visarpanashaka properties. It also aids in healthy digestion and prevent toxic buildup. Sulfur has been associated as an important constituent in sulfonamides, which are used as an antimicrobial agents. These groups of drugs have been proved to act by inhibiting folic acid metabolism in susceptible bacteria and preventing their growth. Sulfur is a time-honored dermatological agent useful in a variety of dermatological disorders. Its keratolytic action is due to the formation of hydrogen sulfide through a reaction that depends upon direct interaction between sulfur particles and keratinocytes. The smaller the particle size, the greater the degree of such interaction and greater the therapeutic efficacy. When applied topically, sulfur induces various histological changes, including hyperkeratosis, acanthosis, and dilation of dermal vasculature. Formulations that include Gandhaka are Arogya Vardhani Vati, Chandra Prabhavati, Arkeshwara Rasa, and Gandhagadya Malahara. In vitro evaluation of antimicrobial activity, that is a well-diffusion method of Gandhakadya Malahara done by Nikhil Gigi. In this study, Gandhakadya Malahara antimicrobial activity is compared with ciprofloxacin on Staphylococcus aureus, Staphylococcus epidermidis, Proteus mirabilis, and in propionic bacterium acnes species. For antimicrobial activity, Gandhakadya Malahara was used in the concentration of 1000 μg per ml, 2000 μg per ml, and ciprofloxacin in 2 μg per ml. Results. Gandhakadya Malahara got better results as antimicrobial agents with high doses in species of Proteus mirabilis and in propionic bacterium acnes species. Coming to Haritala, Haritala also falls under Uparasa group. Acharya Charaka and Sushruta has mentioned Haritala in treatment of Tvakvikaras. Haritala is of Katutikta Kashaya Rasa, Ushna Virya Guna, and Guru and Snigdha Guna. It is mainly used when there is a Vata Pradhana and Kapha Pradhana Dushti, and also in Tvakmamsa and Ambu Dushti. It used mainly in serious and advanced conditions of Kushta where organ deformities appear. Ushna Guna of Haritala penetrates into the skin and Snigdha Guna reduces dryness and itching. Main karma of Haritala are Shotahara, Rakta Shotaka, and Tvachya, Mamsa Pajaka, as well as Metopajaka. It also deals with the Tvak and Rakta Doshti and also removes Krini along with Mala. Along with Kushta, it also works well in other skin diseases like Visarpa, Vaipadika, and Virchachika. Balances Vata, Kapha, and pacifies Pitta. As per the in vitro study done by Dr. Garg Lokesh Kumar, Haritala Basma 250 mg per ml concentration showed more antimicrobial property on gram-positive bacteria, Staphylococcus aureus 100% compared to gram-negative various Pseudomonas aeruginosa 50%. Formulations that contain Haritala are Talakeshwara Rasa, Vruddha Talakeshwara Rasa, and Rasamanikya. Coming to Tamra, it is said to have Tikta Kashaya Madhura Rasa, Madhura Vipaka, and Ushna Virya. Tamra removes Dushita Pitta and Kapha by its Urdhva Athashodhana activity, which forms the major reason for skin diseases. It promotes proper flow of Pitta dosha due to its cholagogic action and also have hematogenic action. It is a Vrana Ropaka, Lakhu, Lekhana, and mild Brahmaniya in nature. Formulations include Tamra Parpati and Arogya Vardhani Vati. Why copper is essential for the skin? Copper is an essential mineral for skin because copper plays a major role in the synthesis and stabilization of skin proteins, and it also has a potent biocidal property. In skin, copper stimulates dermal fibroblast proliferation, upregulates collagen type 1, 2, and 5, and elastin fibers component production by fibroblast. Serves as a cofactor of superoxide dismutase and an antioxidant enzyme present in the skin, important for the protection against free radicals. Serves as a cofactor of tyrosinase, a melanin biosynthesis essential enzyme responsible for skin and hyperpigmentation. Coming to conclusion, all the skin diseases are associated with simultaneous vitiation of all the three doshas, but the symptoms represent of predominating doshas respectively. So our line of treatment is mainly concerned with the elevation of doshas and blood purification. Almost all drugs discussed above has Katu Tiktarasa, Ushna variant, Katu Vibhaga. The probable mode of action of above drugs can be explained mainly at four levels: dosha, dhatu, mala, and shrodhas. At the level of dosha, Prajaka Pitta helps in the metabolism of drugs applied to the skin and the manifestation of color and complexion. Ushnavirya of all drugs would act against Kapha and Vata dosha. At the level of Dhatu, the ingredient might show Rakta Shodhaka action due to Katurasa and Katu Vibhaga. At the level of Mala, Kleda, Puya, and Sweda are dried up by Tikta Katurasa, Ushna Virya, and Katu Vibhaga. At the level of Shrotas, Tikta, Ushna, and Katu, Guna clears the channels. Thank you.
Thank you, Dr. Lakshmi. Thank you for the wonderful presentation. Next, we go to the another paper presentation. Next, I would like to invite Dr. Prerana Prakash Kumpar for the paper presentation.
Hello. Hello, am I audible?
Yes, Dr. Audible.
Okay, I'll share my screen.
Sure, Doctor.
Is it audible? Is it visible? Screen?
Hello, Doctor. Your voice is breaking, Doctor.
Hello.
Yes, Doctor. Now it's audible, Doctor.
Okay. Good evening. I am Dr. Prerana Prakash Kumbar, PG scholar, MS Shalakya Tantra, presenting epidemic keratoconjunctivitis under guidance of Dr. Kate from Anna Sahib Dange Ayurved Medical College, Sangli. So, epidemic keratoconjunctivitis is a follicular conjunctivitis, type of follicular conjunctivitis caused by adenovirus type 8 and 19. It is of contagious spread, that is spread from one infected person to other. Its spread is through used towels, napkins, goggles, and from finger, eye to finger contact. Incubation period of virus is 6 to 10 days, and virus continues to shed from eyes to are mostly affected, and onset is unilateral in two-thirds of the cases. Onset with non-specific conjunctival hyperemia, mild chemosis, and corneal involvement is seen. 3 auricular lymph nodes are involved mildly. No specific treatment is seen in modern science. Hence, here I chose Netra Dhawan with Nimbapatra Quat, as Nimbapatra Quat is the Kafahar proper. So, Netra Rog OPD of our institute, and he showed following complaints: redness of right eye more than left eye, lacrimation, foreign body sensation in right eye, and photophobia. Patient has no any significant previous ocular history, but he was exposed to viral conjunctivitis at his workplace. He has no any special family history. General condition was fair. BP was 130/90 mm of Hg, SpO2 99%, respiratory system was clear, so as cardiovascular system. Now ophthalmic examination leads no any deformity noted, conjunctiva, bulbar and palpebral conjunction seen in right eye more than left. Limbus, ciliary congestion was more in right eye than left eye. Cornea was clear for both eyes. Anterior chamber normal. Iris was color pattern was normal in both eyes. Pupil, both pupil were normal in shape and reacting to light. Both lenses were normal. Vision for both eyes was 6/6 partial. Now subjective criteria according to task gradations. Ushna Shruta, and that is warm tear flow. In right eye, it was scored 3 out of 3, and in left eye, 0 out of 3. Daha, that is burning sensation in eyes. Right eye scored 2 out of 3, and left 1 out of 3. That is desire of cold compression. That right eye was 1 out of 3, and in left it was 0 out of 3. Diagnosis: with his all presenting signs and symptoms, he was clinically diagnosed with epidemic keratoconjunctivitis. Treatment: as EKG does not require any special treatment, but to prevent further any secondary infections, symptomatic antibiotics and lubricants can be used. So here I am doing Netra Dhavan, that is Netra Parishik with Nimbapatra Kvat for 5 minutes a day for 3 days for both eyes. Now we will see the properties of Nimba. Latin name is Azadirachta indica. Family is Malvaceae family. Rasa Tikta, Vipak Katu, Vishi. Nimbapatra properties are Kapha Pittahara, Deepana, Grahi, Krumigna, and Netra. Nimba leaf and bark itself is antiviral, antimicrobial, antifungal, and so on. So, Purva Karma, all explained to the patient and counseling was done. Patient's eyes were cleaned with cotton dipped in lukewarm water with all antiseptic measures. Temperature of Nimbapatra Quath was attained to room temperature and a Quath was filtered through filter paper. A position to the patient was given. He was laid on his back with room no dust or any sunlight. Then a quantity of Nimbapatra was 50 ml. Site of pouring, that is, patient was asked
So we took his follow-up on day 5th and day 10th. Symptoms were markedly reduced. That is, Ushna Shruta, before treatment it was 3, and after treatment it scored 0. Daha scored 2 firstly, and now Daha is 0. Chishra Binandada was first 1, and now it is 0. Other symptoms like photophobia and mild lacrimations were markedly reduced. Redness of right eye was reduced to nil. That is, no redness was present on day 5th and 10th, and possibly that is left eye infection was prevented from day 1 itself. Lacrimation was markedly reduced, no photophobia noted, and vision was 6/6 partial for both eyes as earlier. So here we already discussed Latin name, family, rasa, etc. Here we are going to see the Netra Dhavan and its mode of action. There is no specific treatment mentioned in modern medicine, but as we know, Nimbapatra act as antiviral agent and act as Kapha Pittahar and found to be effective in weak. Thank you.
Thank you, Dr. Prerana. Thank you for the wonderful presentation. Next, I would like to invite Dr. Samarth Chandappa Kamble for the paper presentation.
Good evening, myself, Dr. Samarth, PG scholar, Kaichikisa department from LKRS Ayurvedic Mahavidyalaya, Gadingla scholar. Today, my title of paper presentation, study of efficacy of Shunti Khandi in the management of Urdhvaga Amla Pitta with special reference to hyperacidity. Abstract. The word Amla Pitta is a composition of two words, Amla and Pitta. Amla Pitta is a pathological condition in which there is a aggregation of pitta dosha in the body. According to modern science, this condition is called hyperacidity, and this is caused due to spicy diet, stress, smoking, incomplete sleep, genetic factors. So allopathic treatment for this condition is antacid and anticholinergic drug and proton pump inhibitor. Here, original Katarasa of is changed into Amlarasa. According to Madhav Nidan, clinical definition of Amla Pitta is the condition in which Vidahi and Amla Guna. Pitta is aggregated is called as Amla Pitta. It causes burning sensation, irritation of gastric mucosa, bedside, beside, and this psychic emotion like passion, anger, dread, fear, etc. So, which leads to Amla Pitta is a clinical management according to Ayurveda is based on a Jatragni and Tridosha. Shunti Khanda is a combination of Shunti, Dhruta, Vamsalochan, Toka, Jirak, Ela, Amalaki, Musta has been given in a Vaishajya Ratnavali. They having a properties of Amla Pitta, Pachana and Pitta, Pitta Shamana. Introduction Ayurvedic Samhitas has ever described a healthy routine under Dinacharya and Ritucharya, but in a present scenario, due to busy lifestyle, people are unable to follow norms of Dinacharya and Ritucharya, resulting into Agni Mandya, ultimately leads to diseases like Amla Pitta. Roga Sarvapi Mandagni Vagmat Nidan Tell 1. In this modern world, the human life is completely changed due to development of industrial and fast business life, due to which people are having a adverse effect on their health and even suffering from ailment because increase intake of tea, oily spicy food, drinking alcohol, tobacco, smoking, irregular time to food and sleep habits, irritant drinks, antibiotic increase yield and creates a bad effects on digestion. So it causes burning sensation, irritation of gastric. So beside this psychic emotion like anger, greed, fear, which leads to amlapita. Thus, mithya ahara vihara, which is improper diet, mithya vihara, patnya are the main etiological factor of for any disease. Clinical management of amlapita according to Ayurveda based on Jatragni and Tridosha. Amlapitta is described in detail in Madhav Nidana, Kashyapa Samhita and Yoga Ratnakar. Aim to study the efficacy of a Shunti Khanda in the management of Urdhva Pitta. Object to study the effect of a Shunti Khanda in the management of Urdhva Pitta. Methodology in this study, the efficacy of Shunti Khanda in the management of Urdhva Pitta. Shunti Khand is contains Shunti, Amalaki, Musta, Jirak, Vamsalochan, Pipli, Toka, Ela, Tejapatra, Krishna Jiraka, Haritaki, Nagakeshar, and Dhanik. So these Shunti Khand described in a Vaishajya Ratnavali Amlapitta Chikitsa Adhyay 56. So Shunti Khand contain Shunti, Amalaki, Musta, Jiraka, Pipli, Dhanyaka, Haritaki, Krishna Marich, Ela, Vamsalochan, Nagakeshar, Tejapatra, Tok, etc. So Matra 3 gram BD. औषध सेवन का अपान का anupan with gel. In this Aushadhi Yog, there is no any prakshak dravya are used to relieve the symptoms of Amla Pitta. The Aushadhi Matra is 3 gram in Apankal, Anupan is gel. Therapeutic uses of Shunti Khanda. Shunti Khand is indicated for Urdhva Amlapit mentioned in the Vaishaj Ratnavali, Samhita, Amlapita Chikitsa Adya. Other uses Shul, Rudharog, Vaman, Amvad, Amlapitta, etc. Samprapti of Amlapitta. In Amlapitta, there is a aggregation of a Pitta dosha. It causes Agni Mandya, which leads to Amashe Dushti and Amlapitta occurs. Tridosha Prakop and Agni Mandya. Again, Apatyakaraka Hetu Shevan, Pitta Prakop, mainly Pitta Gun Dravana, Amla Guna Vruddhi. It leads to ultimately Amla Pitta. Conclusion. Shunti Khanda mainly contain shunti, amalaki, mustak, toka, yela, hariteki. These drugs act as pittahara, ruksha, dahashamaka, deepana, pachana, shulnashak, etc. In amala pitta, there is a increase pitta dosha. They leads to amla udgara, uradaha, udarashula, aruchi, chardi. So the Aushadhi Yoga Shuntikan causes a pitta shaman, Tidoshnashak, Rusha, Deepan, Pacha. These all properties helps to relieve the symptoms of Amla Pitta. So reference of this uh, Shuntikhanda in Amla Pitta Chikitsa, there's this detail described in Amla Pitta in Ashtanga Hridaya Samhita, Madhav Nidan, Kashyapa Samhita, Yogaratnakar, according to hyperacidity, that's GRD, according to Ayurveda, our model that described in Brahmanand Tripathi, Gadaningra Samhita, Kaya Chikitsa, books, Charaka Samhita, by Shajaratnavali, Davidson Principles of Practice Modern Medicines. Thank you.
Thank you, Dr. Samat. Next, I would like to invite Dr. Pradiksha Suresh for the paper presentation. Dr. Pradiksha, are you there?
Yes,
Dr.
sir.
Pradiksha Suresh, are you there?
Yes, sir.
Good evening, doctor.
Hello. Hello.
Hello, good evening, doctor.
I'm audible?
Yes, doctor, you're audible.
Okay. Please share my PPT.
Just a moment, doctor. I'll share for you. Please start the session, doctor.
Thank you. Good evening. Myself, Dr. Pratiksha Suresh Kovka. I'm PG final year student, Department Comar Bhajya, and from Sri Annasaheb Dange Ayurved Medical College, Asta. My topic is Navjat Shishu Pariyacharya, that is neonatal care in Ayurveda. Next. In introduction, Komar Vrita is one of the 8 branches of Ayurveda, formed by the 2 words, that is Komar and Vrita, which deals with the care of the children and their diseases. Respective treatment is called Komar Vrita. Different Acharya placed Komar Vrita according to their positioning. That Acharya Charak placed Komar Vrita at the 6th position. Acharya Sushruta placed it at the 6th position. Acharya Vagbhat placed Komar Vrita at 2nd position, and Acharya Kashyap placed at the 1st position. Different Acharya advise various procedures for the stability of the newborn, with few difference in options regarding the sequence of these procedures. Their sequence are Acharya Charak sequences. First is Pran Pratyagaman, that is second Snan, Mukha Vishodan, Pichudharan, Garbha Udakvaman, Nal Chedana, Jata Karma, Raksha Karma. Acharya Shushruta sequence is Ulva Parimarjana, Mukha Vishodanam, Pichudharana, Nala Chedana, Jata Karma, and Snana. Acharya Vagbhat, that is Ulva Parimarjana, Prana Pratyagaman, Nala Chedana, Snana, Pichudharana, Suvarna Prasana, Garbha Udakvaman, and Jata Karma. The first is Prana Pratyagaman, according to Charak, that is neonatal resuscitation. Acharya Charak opines that immediately after birth of the baby, while taking steps to bring out placenta, the following measures should be taken for the resuscitation of the fetus. That is, striking of the stone near the base of the ear of the baby, sprinkling cold water in summer and hot water in winter on the face of the baby. By this measure, the baby will regain consciousness. If baby does not stabilize, waving the Krishna Palika Shupa, a blackened surface of a broken earthen pot, near it until the baby is fully revived. Acharya Vagbhat stated that for proper revival, that is resuscitation of newborn, First, the child should be parisheka with balatil along with the striking of two stones near the base of the ear of the newborn. If these steps do not regain the stability of the child, then provide the oxygen to the child by Krishna Palika Shubha and chanting of the mantra in the right ears of the newborn. What is the clinical importance for the prana pratyagaman in according to modern science? The Acharya Charaka has laid emphasis on the initiation of prana pratyagaman measures immediately after the birth, along with the efforts of the placenta extraction without losing any time. It seems that sensory, tactile, and auditory stimulation are produced by stacking of the two stones, sprinkling water over the space. Striking of two stones near the mastod or base of the ear produces intense sound, stimulating the vestibulocochlear nerve. It is the sensory nerve whose front branch carries the sensation to the nuclei, situated on the floor of the fourth ventricle near the respiratory center, which is also stimulate the respiration begins. Sprinkling hot and cold water may stimulate the sensory fibers of the facial nerve, which stimulate the respiratory center in the brain. Rubbing of balatil on the baby's body serves the purpose of tactile stimulation, temperature maintenance, and providing the strength to the baby. Enhancing of mantras close to the baby's ear may serve as a psychological support to the mother and auditory stimulus to the baby. Next is snan. According to Acharya Charak, when respiration is established in neonate and he is in stable condition, his oropharynx passage should be cleaned with water, then should be given a bath. So should prescribe bathing of neonate after the Jat Karma. He says that baby should be bathed with decoction of lactiferous fish, waters of aromatic drugs, and waters heated with silver or gold or warm decoction of kapita, lives in accordance with the season, dosh and means. Acharya Vagbhat advised snan to be done on the basis of the dosh, kal, and bala of the baby. Acharya Vagbhat dravyas like lukewarm, Shira Viksha Kwat, Sarvagandha Dravyas, medicated water, water which heated with Rajat or Swarna have been quenched or in the Kapita Patra Kwat for Snana. What is the clinical importance of Snan according to modern science? Is the bathing of the baby maintains hygiene and medicated bathing water promotes healing of the umbilical stump and leave pacifying properties. Most of the drugs which are described by the acharyas are antimicrobial, anti-inflammatory, and analgesic activities. Next is Mukha Vishodhan, that is cleaning of the oral cavity. Acharya Charak stated that the neonatal talu, oshta, jiva, kantha should be wiped with properly cleansed off, well cleansed and covered with cotton swab. Attendant finger, then shirsa talu of the baby should be covered with uncutaneous substance, cotton swab. Similar description given by the Vagbhat. Use of ghee and rock salt for oral cleansing prescribed by the Acharya Shushruta. Covering front annals by ghee-soaked cotton has been advocated by the both Shushruta and Vagbhat. Clinical importance. This technique involves first cleaning the oropharyngeal cavity and thereafter the nasal cavity to avoid the aspiration of the secretion into respiratory tract when baby starts breathing. Thus, these measures rule out the risk of aspiration pneumonia. Placing of ghee-soaked cotton on the anterior front annals prevents heat loss from the large surface area and neonate head and also protect it from injury. Next is Pichudharan. Pichudharan, Acharya Sushruta has also advised that Mukha Vishodhan, the use of tampon soaked in a grit or on murga, cover the talu pradesh, which Sneha Pichu recommended by Acharya Vagbhat. Clinical importance as murga, which are also called that the anterior frontana, are soft intracranial structures of the newborn and unprotected at the time of birth due to unfused cranial fissures. Covering the anterior frontals with Sneha Pichu advised by the Acharya as protective mechanism. Garbhodak woman, that is stomach wash. Acharya Charka holds the view that the child should be given woman as a sandhav and gruth to wash out the gastric content right after carrying out the Pichudharan. Acharya Vagbhat has advised use of sandhav and gruth with specific drug like the pacha. Clinical importance. Garbhodak woman prevent the chances of regurgitation and aspiration of regurgitated content. It also prevents vomiting after the feed, which may occur due to irritant effect of muconium, blood, or amniotic fluid which present in the birth, in the stomach. According to Acharya, Sandhav Lavan and Vacha have स्वादुदीपन and पाचन, शीत, त्रिदोषहर, वमनकारक, मलमूत्र शोधक, and cures Vibandha, that is constipation, Adman. Thus, these medication are advised for the Garbhodak woman, that is stomach wash. Then Nala Chedanam, cutting and care of the umbilical cord. Acharya Charak prescribed the Nal Chedan after Garbhodak woman, while Acharya Sushruta recommended it after Mukha Vishodhan and Pichudaran. Acharya Vagbhat has prescribed cutting the umbilical cord after Ulva Parimarjan. Charak states that the umbilical cord should be cut at the 8 angul distance from the baby's umbilicus with the help of Ardhadhara type of instrument made from the Swarna Rajat Ayasa, and 108 followed by the tying to cut end with the clean thread. The free end of the clamp should be hung onto the neck of the baby. If there is a production of pus formation over the umbilical cord, oil prepared with the paste of Lodra, Madhuka, Priyangu, Suradaru, Haridra should be applied. Powder of the medicines prescribed for oil preparation should be sprinkled over the spotted umbilical cord. Sushruta has also mentioned same process for Nal Chedan in Navjat Shishu Paricharya. Similar technique of Nal Chedan stated by Acharya Vagbhat. Regarding the procedure, he advised that the umbilical cord cut at the distance of 4 anguls from the umbilicus and kushta medicated oil to be prevented for the inflammation. Clinical importance. Acharya advised cutting the umbilical cord after completion of resuscitative measure and stabilizing the baby because it provides the nutrition and blood supply to the baby. It is advised to clamp the cord by thread to prevent bleeding, which may cause the hypovolemic shock. Umbilical cord should be hung onto the neck after cutting the cord to prevent bleeding and also prevent the cord infections by the urine and stool. Lodra, Madhuka, Priyangu, Suradaru, Haridra, Kushta have Janjugna, Vedna Stapana, Shotahara, that is anti-inflammatory properties. So these drugs are used to prevention from the infection. Second is Jat Karma. Jat Karma is the first sanskar after the birth. The Acharya Charaka states that the one of the first neonates feed with mantras, that is Madhu and Grita. Thereafter, the mother should give her right breast for feeding to the baby after placing by the side of the baby's head. An earthen jar filled with water should be impregnated with mantras and kept near the head of the child. Acharya Shushrut advised to lick Madhu, Grita and Ananta with index finger. On second and third, Lakshmana with Grita, while on fourth day, that is Shavapanita Tala Smita, or amount which fills with the neonate palm. Madhu and Grita to be offered to the newborn. After this, the baby can be exclusively breastfed. Acharya Vagbhat follows Sushruta with slight variation, where on the fourth day he has advocated offering Ghee and Navneet to the newborn, thereafter initiating breastfeeding. Acharya Vagbhat also stated that Jat Karma should be performed by the Prajapatya method described in religious texts. Clinical importance. Jat Karma is the birthright which helps the baby transcend to the extrauterine life. Honey and ghee act as a nutrition for the baby because they have high caloric value, giving energy and nutrition to the baby. Gold powder gives the protection and enhance the brain development of the baby. First feed initiated movement and activate the gut and gastrointestinal. During the Jat Karma, we can assess the rooting and sucking reflex of the newborn. Jat Karma with mantra, psychological support to the mother. Charaka advised breastfeeding start as soon as possible after birth, right from the first day of the life. Protective immunoglobulins present in a colostrum as well as for nutrition. Next, Raksha Karma. Raksha Karma means protection of the newborns, which prescribed by the Acharya Charaka in detail all around the labor room. That is Sutika Grah, the twig of Adani, Khadira, Karkandu, Pilu, Parushaka should be hung and Sarchapa, Atasi, Tandula, Kanakti should be scattered on the floor. A pocket of Vacha, Kushta, Shoma, Hingu, Sarchapa, Atasi, Lasin, Gugul, etc. Rakshokna Dravya should be hung on the door and same Dravya should be tied around the neck of the mother and child. Inside the Sutika Grah, the fire lit from tandoor should be constantly kept burning. Female attendants should be consistent vigil by the remaining awake for 10 to 12 days. The whole house should be full of affectionate people and celebration should be made. To be best auspicious upon the mother and child, Brahmins will be
versed with the Atharva Veda should be offered prayer twice a day. Acharya Shushruta stated the newborn wrapped in a kushum cloth and sleep on the bed covered with soft linen, fan with the baby with sweep of silu, badar and nimba parushaka. Application of oil soaked tampons, taila pitchu should be applied over the baby's forehead daily. Rakshagna Dravya fumigation should be done in the Sitika Graha daily. Clinical importance, Raksha Karma aims to protect the newborn baby from various infections as in use clean clothes, bedding, etc. The various drugs mentioned in Bhupan Karma have antiseptic, antimicrobial properties. Fumigation of the Sitikagra by various Bhupan drug is mentioned to protect the baby from various opportunities, infections and diseases. Conclusion, our Acharya had gained a brief knowledge of neonatology. After review of our Samhita, it has found that considered the text has mentioned all the important aspects of Kamarbhata like care of newborn, breastfeeding, protection of the child, neonatal nursery, etc., which are enough for the basic knowledge and necessary to understood by mother, student, scholar, and physician. Various proponents of Ayurveda have described the care of newborn in their own major state. Its essence is the same and moreover it intends her as the modern day of neonatology. Though with the advent and newer scientific knowledge and technologies, this practice has become obsolete these days. Aid and understanding of Navjat Shishu Paricharya proves it to be foundation stone and base of the neonatal care. Thank you.
Thank you, Dr. Pradiksha. Thank you for the wonderful presentation. Next, I would like to invite Dr. Payal for the paper presentation. Dr. Payal, are you there?
I'm audible?
Yes, Doctor.
Hello.
Audible. Good evening, Doctor.
Good evening, all. I'm Dr. Payal Ade from LKRS, Garhinglas, Kolhapur, PG scholar from Comorbidity Department. My topic is comparative clinical trial to evaluate the clinical efficacy of Darvadi Churna and Triphala Churna Pratisaran in the management of Pittaj Mukhapak, with special reference to current Abscess stomatitis in children. Mukha Swasthya has gained importance nowadays because Mukha is such an anga which is exposed to many risk factors in day-to-day life. Mouth is invaded by large number of microorganisms, which are normally controlled by maintenance of reasonable oral hygiene. If this is neglected, bacterial population may be proliferate and cause many oral diseases. In Ayurveda Classic, many health promotive procedures are explained. Of the stomatitis is one of the most unbearable and painful oral mucosal disease. Mostly children are often more susceptible for the disease. This condition has no specific cause to occur and no proper diagnosis or etiopathophysiciology. The treatment options are largely palliative and aimed at reducing the symptoms like pain, as it helps in improving patient oral condition. In Ayurveda, Mukpak is considered as specific disease, which is own specific Nidan, Purvaru, Ru, Samprapti, and Chikitsa. Thus, attempt has been made to study the disease of Mukpak according to Ayurveda. According to Acharya Dallan, Mukapang appears in mouth areas such as inside the cheek, soft palate, ventral tongue, and floor of the mouth. Mukapang is mentioned under 14 Nanatmaj Pitta Rog. Next, 14 Nanatmaj Pitta Rogas as per Acharya Charak. Acharya Dallan on his commentary on Sushrut Samhita mentioned Mukha is basically purely in Pittaj Vikar. Recurrent Abscess stomatitis is considered as most common oral mucous lesion. This present as recurrent multiple small and or ovoid ulcer. having yellow floor and surrounded by erythematous halos, present first in children or adolescents. Ophthalmos ulcer affect up to 25% of general population, and three mouth recurrent rates are high as 50%. It is the most common in female. Ophthalmos ulcer increased by increasing age, and minor ophthalmos ulcers are 80% of reported patients. Ophthalmos ulcers were reported from 5 to 66% amongst different nations. The cause of ophthalmos ulcer is unknown, and therefore many factors are still implicated in the disease, including hormonal changes, trauma, drugs, food hypersensitivity, nutritional deficiency, stress, and tobacco. There are three clinical presentations of minor recurrent ophthalmomatitis and major recurrent ophthalmomatitis herpetiform ulceration. Minor recurrent ophthalmomatitis is one of the most form of, and approximately 85% of patients have lesions of this type. Minor ophthalmos can involve the non-keratinized mucosa of the oral cavity, and the labral buccal mucosa, the floor of the mouth, and the ventral or lateral surface of the tongue. Moreover, the ulcers are usually um, concentrated at the anterior part of the mouth. The ulcers are superficial, usually less than 1 centimeter in diameter. The classification of minor recurrent ophthalmomatitis does not depend on the dimensions or lesions alone. Dimension lessons alone, but the number of other clinical features such as number of the ulcers from 1 to 5. Okay. Oh. Darvedi Churna. Darvedi Churna is indicated for the Mukhapak in Bhaishajya Ratnavali. Darvedi Churna contain Daru Haridra, Yashti Madhu, Haritaki, Zati Patra Madhu, Zati Patra Madhu. Darvedi Churna is a Tiktani Kasharasatmak, Lagu Raksha, Ushna Gunatmak, and Katu Vipak. Katu Vipak. Haritki is a Lagu and Ruksha Gunatmak, Ushna, and Madhur Vipak. Zati Patra is a Zati Patra Tikta Katurasatmak Lagu and Tikta Gunatmak, Ushna Virya, and Katu Vipak. Tripala Churna is mentioned as a Kapha Pitta Hara, so it is selected in Mukhapaka. Tripala Churna contain Haritaki, Bibhitaki, Amalki, and churna is preparation method. The churna is fine powder, completely dry drug is used and filtered through the cloth. The duration is 10 days, and the route of the application is local application. Criteria of assessment: pain, burning sensation during food intake, salivation, redness, ulceration in mouth, inflammation. Duration of the study is 18 months. Churna with Madhu, Darvedi Churna with Madhu. Thank you.
Thank you, doctor. Thank you for the wonderful presentation. Next is a poster presentation. I would like to invite Dr. Nikhil Nigade for the poster presentation. Dr. Nikhil, are you there?
Hello,
Good evening, doctor.
am I audible?
Yes, doctor, you're audible.
First of all, good evening to everyone. My name is Dr. Nikhil Nigde. I am studying final year, Shalatantra Department, Annasaheb Dange Ayurved Medical College, Ashta, Sangli, Maharashtra, under guidance of Dr. Vijay Dange. Today I am presenting in front of you that the poster presentation of my topic, Annava Sroto Drushti with respect to anorectal disease. Introduction. Annava Srotas is a channel for transportation, digestion, absorption of food, indigestion and anorexia, lack of interest toward the food, which leads to constipation and may result in anorectal disorder like malavastamba, arsha, and pericardia, and etc. So, Sushruta has described Arshanidanam, that those people suffering from Mandagni, which leads to Vata aggravation alone or in combination with other doshas and manifest itself with the symptoms like PR bleeding, pain, irritation, and discharge in the gut. This study aims to finding out hetu which causes anavastrotojushti in comparison with recent lifestyle, which is responsible for anorectal disease, especially hemorrhoids. Aims and objectives. This study includes etiological factors leads to anavastrotojushti and its relation in pathogenesis genesis of Arshvadi, materials and methods. Various other Ayurveda text and textbook of contemporary science that reference from internet journal were also critically reviewed. Mool and root, according to Charak, Anavastrotas originates from Amashaya, that is stomach, or Vamupashva. According to Sushrut, Anavastrotas are two in number, that they have origin in Amashaya, stomach, and Annavah Dhamni, Anna carrying Dhamnis. Sarva Roga Sarvapi Mandagni Ashtang in that the Mandagni is state of Agni, which unripe, undigested, unmetabolized products are formed that we have potential to block the strotas and resulting the accumulation of doshas and manifesting as a sickness. Mandagni is the main reason of all this. That is the explanation of this shloka. Nidan. Excessive intake of food, improper time of meal, constipation of unhealthy consumption of unhealthy food, unhealthy lifestyle, and sleep time. Lakshanas: distension of abdomen, pain, aversion to foods, vomiting, nausea, anorexia, indigestion, and especially in anorectal lakshanas, uh, that is in Arsha, Gudakandu, itching, Gudadaha, pain. First of all, after that, we see Samprapti of Arsha, that is, first of all, Nidan, Agnimandya of other doshas along with the Rakta, vitiation of Vata alone or in combination, spread throughout the body, throughout the Dhamnis, mainly Purushvahini Dhamnis, settle itself in Godavari, causes of Takasankaj, develop Mansankuras. Mansankuras become large with the contact of Shitajala, and that Arsha is developing. Management. To avoid etiological factor, dosh to kept in equilibrium, Sanshodhanam, Snehan, Deepan, Sanshod, some Swedan, Pachan, to keep Agni in normal status, Pachana, Deepana, and Anuloman. Conclusion. Annavastroto is mainly responsible for indigestion. Agnimanda is main reason for urge, which is due to improper diet habit, which leads to Annavastroto. Presentation is better than cure. Okay. Thank you, sir.
Thank you, Dr. Nikhil Nigade. Thank you for
Yes,
the
sir.
presentation.
Yeah. Thank you, sir.
Next, I would like to invite Dr. Devyani P. Dasar for the paper presentation.
Am I audible, sir?
Yes, Doctor, you're audible.
May I share the screen?
Sure, Doctor. Please, Doctor.
Is the screen is visible, sir?
Yes, Doctor. Screen is visible. Please start the session, Doctor.
Yeah. Thank you so much. Myself, Dr. Devyani P. Dasar, Associate Professor from Department of Shalya Tantra of Mahatma Gandhi Ayurvedic College Hospital and Research Center. which is a constituent unit of the Datta Institute of Higher Education and Research, deemed to be university, is going to present on the clinical study in the management of diabetic foot ulcer with the Jalokurtana, that is the lead application. So here is the diabetic foot ulcer, the epidemiologies, which are we are going to see day by day. In this one, actually, diabetic foot ulcer, these are the leading cause of the amputations and affect the more than the 15% of the people with this. And this is according to the Bremen Atomic Mechanic article in the 2007. And it is precise 84% all diabetic related lower limb amputations, which is as according to the research article of the Ripple. And this affects the micro and microvascular complications, also including the failure of wound healing process. The risk factors for this are the diabetic neuropathy with the ischemia. So Acharya Sushruta, he have given a very nice conservative management for this. So these are included under the Brahmacharya Vrana, which are the Kricha Sadhya. But when it going to get Pakwa, it is called as Pakwa Pidika. So in that time, we are going to do with the Pranava Chikitsa. So yeah, according to the Upakramas of Pranava Chikitsa, in that one, Rakta Moksha, that is the Jalokarcharna, is indicated. So all the patients with the complaints of this foot ulcer categorized under the type 2 diabetes mellitus with the informed written consent. Also the known diabetes for 17 to 50 years and had ulcer the 4 to 9 years without the signs of healing that were taken in this study. That all are fall in the low socioeconomic group as per the criteria mentioned by the Indian Council of Medical Research, and there is no any record with the smoking or any other major illness was found. They had undergone treatment previously in various hospitals, but there is no any relief found to them. So many patients also scheduled for the amputation of the affected leg on their respective medical units. But in these patients, we just followed this Nihana Svedana for 3 days, and from 4th day, the leech application was done. And that is also done weekly once, and for the 6 weeks, and follow-up taken for the 6 weeks. And these are the materials required. We all know with what are the materials required for the leech application. And that is also going to depict in the slide. In histopathological slide and report, here we are going to see that there is a microcirculation is going to be increased. So there is the circulation of a good blood with the with full of the nutrients and oxygen. So it definitely going to help the wound healing. This is the statistical analysis of this one, male and female patient having the mean age with the diabetes also mean and ST in duration, and the current medication was given for them, that is oral hypoglycemic medicines, and the controlled one. Here the ulcer gradations, the Wagner gradations were used, and nutritional status is also I got a very significant one with the mean and standard deviation. Here is the descriptive statistics for the wound closure, where I got a very nice this one, that a day 0, 45th, and T value and P value, where it is called as the significant one. And here is the reduction, that is percentage of reduction of the ulcer was the 68.10%. So here we can see the photographs of the patient having the mean ulcer area in the centimeter. Here you can see at the 0, and at the last is 45th, where it is a very significant one. So conclusion was taken that this is a marked decrease in ulcer size with the significant reduction in erythema, edema, and increase in granulation. And this is a very safest and cost effective. Here is the statistical depiction of all the parameters which I've used for my study. And really, for so many patients, we can prevent for Dharaka team for giving this a nice opportunity to me to present over here. Thank you so much.
Thank you for the well explanation, doctor. Thank you so much. Next, I would like to invite Dr. Snehal Tingare for the paper presentation. Dr. Snehal, are you there?
Yes, sir. Am I audible?
Audible, doctor. Good evening, doctor.
Sir, can you please share my paper presentation?
Yes, doctor, just a moment.
Good evening, everyone. Myself, Dr. Snehal Dada Sotingre. I am pursuing MD in Rognidan department under the guidance of Dr. Ashok Patil, sir. My topic for paper presentation is pain management as per Ayurveda. In Ayurveda, Vata dosha is the root cause of all types of pain. Vata rute nasti ruja. As mentioned by Acharya Sushruta, pain is the most common symptoms of inflammatory process. Ayurvedic can ray of hope to understand its actual concept of pain and protect from NSAID's hazards. Ayurvedic pain management therapies are safe and natural ways that help in management of different kinds of pain. All Ayurvedic treatments and therapies involve biopurification of body and enhance the body or body's own healing process and don't have any adverse effect if given in proper dose according to the fundamental principle of Ayurveda. Here, a conceptual study of vitation of Vata dosha responsible for pain with chief therapeutic procedure such as Snehan, Swedan, Agni Karma, Jaloka Charan, Vidha Karma or Lepan Karma and Basti Karma as described. Introduction. Pain is an unpleasant sensory and emotional experience associated with the actual or potential tissue damage or described in terms of damage. Pain is a subjective experience. Pain interferes with the physical functioning and what that also causes impairment in attention control, working memory, mental flexibility, problem solving, and information processing speed. The chronic pain may also associated with the increased depression or anxiety. To diminish the pain, every person thrives a treatment which is less side effect and maximum benefit. And as we know, Ayurvedic procedure and medicine seem to be more effective. According to Ayurveda, it is termed as Shula Roga. The word Shul refers as a type of pain. For example, Karna Shul, Shiras Shul, Netra Shul. Shul can appear as synonym or symptom or complication of disease. Shul is classified as Swatantra Shul as Vyadhi itself and Paratantra Shul as a complication of disease. Ayurvedic classic like the Sushrut Samhita define pain as a distinct concept called Shul, which primarily denotes colic. In Ayurveda, all types of pain are considered under Vata aggregation. As Vata dosha is responsible for every movement and action in the body, the vitation of Vata occurs in two ways: Dhatukshay Janya Vat Prakop and Margavrat Janya Vat Prakop. As Vata also allows the other Pitta and Kapha to function in a body. Therefore, Vata should flow easily in the body without any obstruction. Otherwise, it causes the pain in the body. Material and methods. Ayurvedic classics like Charak Samhita, Shushruta Samhita, Bhagavad Samhita, with commentaries were consulted as reference. These references from both the streams of knowledge were compared and analyzed thoroughly. As we know, there is no separate chapter of pain or its symptoms in Ayurveda. It is dispersed in various chapter description in Ayurvedic, either in the form of Rupa, Purva Rupa, or Upadrava. In Charak Samhita, fourth chapter, two Mahakasha are directly mentioned for the management of the pain. That is Shula Prashaman and Ved Viprashanam. Also, there is another one which directly relates to pain management as Angamarda Prashaman. In Charak Samhita, Chikitsastan 28th chapter describes some of the physical activities which causes aggravation of Vata dosha that are Ati Vyavaya, Prajagara, Vishmat Upachara, Ati Dosha Shravana, Ati Ashruk Shravana, Ati Plava, Ati Langhana, Ati Vyadha, Ati Vyayam, and Chinta, Shoka, Karshana, Roga Ati Karshana, Vega Vidharana, Ama, Marmaghata, and also riding over elephant, camel, horses, or fast moving vehicles. These aggregated factors give also rise for these symptoms. Symptoms such as Sankocha, that is contraction, Pravanam, Stambhabheda, Lomaharsha, Pralapa, Paniprushta, Shirograha, Khanja, Pangulya, Kubja, Pandanam, Gatrasputana, Shiro, Nasa, Akshi, Jatrunam, Griva, Toda, Arati, Moha, Ayasa. Classification type of pain shul according to Ayurveda. As per Shushruta, 11 types of shula are mentioned, and as per Madhokara, 8 types of shula are mentioned. As per Shushruta, 11 types of shula are Vataj, Pittaj, Kafaj, Sannipataj, Pashvashul, Kukshishul, Ritishul, Vastishul, Mutrashul, Vittashul, Vipavaka, or Annadoshajashul. And as per Madhokara, 8 types of shul are mentioned, that is Vataj, Pittaj, Kafaj, and all Sannipataj. Dvidoshas also, Amaj Parinam shul, and Annadrava shul. Nature of pain in occluded Vata dosha. Raktavritta Vata, Daha Aratitvaka, Mansa Pitta and Kapha Vrittavata, Shula, Asti Avrittavata, Chilava, Majavrittavata, Pariveshtanam, Shula, Annavrittavata, Kuksharuka, Jimi, and Purusha Avrittavata, Parikartana. Management of pain in Ayurveda. Pain management in Ayurveda incorporates several therapeutic procedure and behavioral modification with the help of basic principle narrated in Ayurveda. Ayurvedic management mainly based on dosha tartamya diagnosis. Main dosha for causing pain should be eliminated first. The diagnosis is made on the basis of symptoms produced. Avarana concept. In case of Avrutta Vata dosha, the dosh which covers the Vata dosha or Avaran is treated first. Shamana Chikitsa, pacification method. It includes Ahara Vihara and Vedna Stapan Mahakashaya. In Ahara, that is in diet, consumption of food that are nutritious and easy to digest, like green vegetables, fruits, juices. Avoid oily, fried, and spicy food. In Vihara, that sleep, exercise, and yoga are important. The asanas and pranayamas and the physiological, which harmonize the physiological system and initiate relaxation response in a neuroendocrine system. Sleep and medication also help individual deal with emotional aspect of chronic pain, reduces anxiety and depression effectively, and improve the quality of life pursued. And the third is Vedna Stapan Mahakashaya, includes drugs as Katafala, Kadamba, Padmaka, Tumba, Shishta, Vajuka, and many more. Shodhana and other adjunct treatment. First is Snehana. In Ayurvedic classic have been mentioned 2 types of Snehana. First is external massage of oil. Second is internal use of medicated oil or broth. Kshar Tail is considered as the best among Stavar Sneha. That is the oil derived from plant source, and neurohormonal effect due to Balya Snehan has been established, stating that massage increases level of dopamine, increases availability of serotonin, may elevate epinephrine, and release of endorphin. Svedana. The main object of Svedana is to soften the muscle, relaxes tissue, and dilate vessels for circulation, thus help to relieve pain. This procedure is done to cure the Vata dosha, whited due to increase in its Shita property. Vaman in pain. Vaman procedure is especially indicated in Kapha sugar, but is also suggested in a management of Vatika Shirorog. Virechana. Virechana implies utilize of purgatives that fundamentally offer assistance in Vata Rakta and other Vata dosha. It cleans body from poisons. It liquefies horrible doshas and remove them out through anal route. It controls Srotarodha, normalize Pratiloma Gati of Vata, and aberrate circulatory repair in the way makes it difference in disease related to disturbed vata. Next one is Basti. In one of it is one of the chief therapeutic procedure of Panchakarma in which drugs are administered into rectum of the patient. Basti is treatment of choice in origin of Vata dosha. It's from Pakvasya and hence described as Ardha Chikitsa in Samhita. It is proposed that Basti encompasses a highlight to regulate sympathetic action, subsequently adjusting the autonomic nervous framework. Hypothalamus pituitary adrenal axis HPA gets enacted with the visceral afferent stimulation, including the discharge of neurotransmitters and adrenal organ called cortisol. Neuroendocrine hormone acts as a powerful anti-inflammatory systematically. Next one is Agni Karma. Agni Karma, that is intentional heat burn therapy, is one of the most effective parasurgical procedure mentioned for the management of pain, which is done with the help of Shalaka, that is metal probe. Agni Karma pacifies Vata and Kapha doshas, removes Strotarodha, increases Rasa Rakta Samvahan to the treated area, increases Dhatavagni, causing digestion of arm. According to modern science, the ascending neurons are the pathway for conduction of pain, pressure, temperature. When perception of pressure and temperature factor is increased, pain perception is reduced, which help us to understand the role of Agni Karma in relief of pain. Another hypothesis suggests that the released heat could have caused irritation on the superficial sensory nerve, ending thereby relieving pain from the concept of counter irritation. Next one is Jalokacharan. Jalokacharan is one of the therapeutic procedure of Rakta motion. This therapy of pain relief involves application of Nirvish Jaloka, that is non-poisonous leeches, for removal of vitiated blood at the site of pain. It is hypothesized that the strong sensory stimulus caused by the pain and burning sensation of the leech bite can alleviate the symptoms of the patient through the gate therapy. Review of components of medical leech saliva reports inhibition of blood coagulation, inhibition of collagen mediated platelet aggregation, anti-inflammatory, vasodilator, anesthesia. Next one is Vidya Karma, also known as Veda, is one of the 8 Shastra Karma, that is surgical measures mentioned as Shushruta Samhita. This is sterile procedure which includes piercing the points with special hollow needles, considering the anatomy of marmo. As per Ayurveda, the piercing leads to painful mechanical stimulus which causes release of endorphins, thereby causing immediate pain relief. Next one is Lepan Karma. Lepan Karma is application of medicated paste on a skin. Mode of action of Lepan Karma can be explained with the help of transdermal absorption of drugs. Inflammation increases cutaneous blood flow and also enhances absorption. Moreover, thermoreceptor in the skin have cold receptor, thin myelated fibers and warm receptor, which help in understanding the regulation of pralepa and pradeha respectively. Probable role of pralepa can be explained with the mechanism of transduction of cold thermoreceptor as for example, menthol sensation as perceived via TRPM8 channel, whereas role of pradeha can be explained with TRPV1 channels, and furthermore, certain warm receptor also being sensitive to painful stimuli function as a non-receptor, and thus medicine action of herbs which with hot consistency. Next one are Shirodhara, pouring of medical oil over forehead, Abhyanga, Pichu, and other Kriyakalpa like Anjana, Netratarpana, Karnapurana, Kavala are done as per pain scale of a patient, and Bahya Vedan, Stanik Basti also given for respective pains. Conclusion. Pain can be effectively managed by use of shaman chikitsa, shodhan chikitsa, diet and lifestyle. Many single drugs and formulation have been told in Ayurveda to manage different kinds of acute and chronic pain. Current article is an attempt to cover the maximum aspect of pain treatment, uh, emphasis on probable mode of action of a chief therapeutic procedure utilized in pain treatment in Ayurveda. But as the symptoms being subjective, it depends on the patient, site, extent, and stage of disease, and hence doesn't offer more appropriate modality to pain relief. Main aim of treatment is to pacify vitiated vata dosh. Ayurvedic pain management therapies are safe and natural ways and help in management of different kinds of pain. That is pain management according to Ayurveda. Thank you, everyone.
Thank you, doctor. Thank you for the wonderful presentation. Next, we go to the another paper presentation. I would like to invite Dr. Siddhi Ramakrishna Patil for the paper presentation.
Good evening everyone. Myself Dr. Siddhi Patil, second year PG scholar, Department of Commonwealth Parul Institute of Ayurveda, Parul University, Vadodara, Gujarat. I am presenting a case of Ayurvedic management of chronic renal failure, a case study. Introduction. India, like any other developing country, is facing a silent epidemic of chronic renal failure, facet of the health transition associated with industrialization, partly fueled by increased in sedentary lifestyle, low birth weight, and malnutrition. India has very little infrastructure renal care facilities, with few centers, that too being placed at major cities only. Indian government spend very less on health each year, and patients are supposed to attend its primary health centers. Patients do not attend because in doing so they lose a day's wages. A normal person in India cannot afford this high costing treatment, that too for an incurable disease CRF. It still can afford it. These costs have to be borne for a long time. This puts an unbearable load on the patient and his or her family. This is the most important reason why only 2 to 3% of kidney failure patients in India get treated. Rest prefers an early death so to decrease the financial burden on their kith and kins. This is a case study. A 60-year-old male patient presented with the following complaints, that is bilateral swelling in foot from last 4 months with difficulty in walking due to swelling, frothy urine also from 4 months, decreased appetite from 3 months, nausea fatigue from 3 months, and reduced frequency of micturition from 2 months. History, family history not specific, allergy not specifically known, addiction no any addiction, surgical history not specific. General examination, pallor present 1 plus, pedal edema 2 plus, temperature 98.6, pulse rate 82 per minute, respiratory rate 22 per minute, blood pressure 140 by 90 mm of Hg, weight 80 kg. Investigation, hemoglobin 13.3 gram percent, neutrophils 78%, serum creatinine 2.1 mg per dl, blood urea 62 mg per dl, and SGOT 39 U per L. Treatment includes oral medication and also a panchakarma therapy. Oral medication was given with the following ways, that is dravya, matra and kala. Sarvakalpakvat, what dravyas are given on oral medication are Sarvakalpakvat, Gokshurati Gugur, Haritaki Churna, Varunadikvat and Korighanvati. Matra of Sarvakalpakvat is 100 ml BD on empty stomach. Gokshurati Gugur is 1 gram TDS after food. Haritaki Churna is 1 TSF HS with lukewarm water after food. Varunadikvat 10 gram BD after food and Corignavati 1 tablet BD before food. This is the oral medication, and Panchakarma includes the Niruha Basti. Niruha Basti with Punarnavadikvat was given daily. Pathya Pathya. Pathya diet include Mudgaras once weekly, Yav Anna Sevan, Patol Sevan and boiled vegetables, Saindhav Lavan, fruits that is apple and papaya, and increase fruit intake. A Pathya diet include protein diet. Protein diet is strictly not indicated, including milk or dairy products except takra, godhum, heavy pulses, packaged food, citrus food, and also a spicy food and pickles are also strictly contraindicated. A Pathya diet. Probable mode of action Sarvakalpakvat. It contains Punarnava, Bhumi Amla, Makoy helps in conditions of reduced urine content, stomach and pelvis pain, indigestion, lack of appetite, and others. Since these drugs are considered as best hepatoprotective agents, as per Ayurveda text, thus helps in strengthening liver, which results in proper formation of Adhyaras dhatu. Phyllanthus niruri is one of the commonly used species of this family for the treatment of liver and kidney disorders. S. nigrum, also known as McCoy, contains several steroidal glycosides, steroidal alkaloids, and steroidal glycosides that also act as antioxidants, reducing hepatic injuries through amelioration of oxidative stress. That is, it decreases oxidative stress. Gokshuradi Gugur acts by Rasayan for Mutravah Srotas, and it has also Lekhan, that is a scrubbing effect because of Gugulu. Haritaki Churna helps in proper absorption of water and other liquids in undigested material. Haritaki Churna have anuloman properties, thus helps in balancing Apan Vayu, which relieves a symptom of constipation. The use of such Mridu Virachan Dravya is recommended in Vata predominant disorders and diseases situated in central location of the Vata dosha. Varunadikvat is also helpful to release the cough and Vata doshas. Rasayan Churna has Rasayan properties. Corignavati, it contains extract of coriander sativum, an important medical plant, is known for its hepatoprotective, diuretic, carminative, digestive and anti-helminthic potential. Moreover, the plant was also reported to treat jaundice. Treatment with coriander sativum extract prevented a rise in urea, creatinine and blood urea nitrogen in serum. Coriander sativum is potential source of nephroprotective phytochemical activity with flavonoids and polyphenols as the major components. Punarnavadikvat, chronic renal failure has pitta dominant doshas in its pathology, hence probably it can be postulated that Punarnavadi compound shows its action by controlling Pitta and Vata, followed by rest of dosha, avoiding them from further aggravation, thus slowing the pace of disease. Upashay. Patient renal profile was improved with decrease in serum creatinine level, decrease in blood urea level. Other lab investigations got normal in 1 month of medication, decrease in symptoms by following strict Pathya diet. These are the references, and thank you.
Thank you, doctor. Thank you for the wonderful presentation. Next, I would like to invite Dr. Kajal Dubey for the paper presentation on the topic Hypertension, Ayurvedic Insights and Management.
Hello everyone, myself Dr. Kajal Surendra Dubey, pursuing MD in Chikitsa Department from Late Kedari Redekar Ayurved Mahavidyalaya, Gadinglaj, Kolhapur. My topic is hypertension, Ayurvedic insights and management. Introduction. Hypertension, commonly known as high blood pressure, is a medical condition in which the force of the blood against the artery walls is constantly too high. It is often termed as silent killer because it may not show symptoms but can lead to serious health problems like heart disease, stroke, and kidney failure. Hypertension is classified into two types: primary, that is essential hypertension, which has no identifiable cause and tends to develop gradually, and secondary hypertension, which results from an underlying condition such as kidney disease or hormonal disorders. Managing hypertension typically involves lifestyle changes and medication to control blood pressure and reduce the risk of complication. Hypertension according to Ayurveda. In Ayurveda, hypertension is viewed as a result of an imbalance in the doshas, particularly Vata and Pitta. The condition is referred as Raktagat Vata, meaning Vata affecting the circulatory system, that is Raktadhatu. Here is how it is understood in Ayurveda. Causes of hypertension. Imbalances in doshas. Vata dosha. When Vata becomes imbalanced, it can cause irregularity and increased pressure in the blood vessel, leading to high blood pressure. Pitta dosh. When Pitta is aggravated, it can cause the blood to become overheated, creating stress and inflammation in the circulatory system. Kapha dosh. If Kapha dosh is aggravated, it can lead to sluggish circulation and buildup of toxins, which can contribute to high blood pressure. Types of hypertension. There are mainly two types: primary hypertension and secondary hypertension. Primary causes no identifiable underlying cause. Prevalences accounts for about 90 to 95% of hypertension cases. Risk factor: genetics, aging, diet, obesity, lack of physical activity, stress, and excessive alcohol use. Secondary hypertension causes result of an underlying medical condition or medication. Common causes are kidney disease, endocrine disorders, obstructive sleep apnea, adrenal gland tumors, certain medications, and illegal drugs. Prevalence accounts for about 5 to 10% of cases. Other types of hypertension: isolated systolic hypertension. Causes: commonly occurs in older adults due to stiffening of the arteries. Characteristics: elevated systolic pressure, the top number in a blood pressure reading, while diastolic pressure remains normal. Risk factor: aging, atherosclerosis, plaque buildup in arteries. Malignant hypertension causes sudden severe high increase in blood pressure, often linked to an existing form of hypertension. Symptoms: severe headache, blood vision, chest pain, or organ damage. Medical emergencies: requires immediate treatment to prevent organ failure or stroke. Resistant hypertension: high blood pressure that remains uncontrolled despite the use of 3 or more antihypertensive medication. Commonly causes are poor adherence to treatment, secondary causes such as kidney disease or a certain medication. White coat hypertension: when blood pressure spikes in a clinical setting due to anxiety. Characteristics are: normal blood pressure is normal outside of the doctor's office but elevated in medical settings. Masked hypertension: blood pressure is normal in clinical setting but elevated in daily life. Risk factors are stress, smoking, physical inactivity. Factors affecting hypertension. Diet. Excessive consumption of salty, spicy, and processed food aggravates pitta and vata. Lifestyle. Stress, lack of sleep, irregular eating habit, and a sedentary lifestyle can disturb the doshas. Mental strain. Excessive mental stress or emotional disturbances increases vata and pitta. Ayurvedic management of hypertension. Herbal remedies are Arjuna, Terminalia Arjun, supports heart health and lowers blood pressure. Sarpagandha, a traditional remedy for controlling blood pressure. Ashwagandha helps manage stress and calm vata. Brahmi, known for its calming effect on the mind, reducing stress and anxiety. Triphala, a combination of three foods that balances all three doshas and detoxifies the body. Dietary changes. Reduce salt intake, spicy and acidic food, increase consumption of fruit, vegetables and foods rich in fiber. Include cooling and calming foods like cucumber, watermelon and pomegranate. Use spices like turmeric, coriander and cardamom that help balances pitta and vata. Lifestyle modification. Meditation and yoga. Practice like meditation, pranayam and specific yoga postures such as Shavasana, Vajrasana helps reducing stress and balances the doshas. Regular sleep. Ensure adequate and restful sleep to calm vata. Abhyanga, a daily oil massage with calming oils like sesame or coconut can pacify vata and promote relaxation. Panchkarma therapies. Virechana, a detoxifying treatment to balance pitta by eliminating toxins. Shirodhara, pouring of warm oil on the forehead to calm the mind and reduce stress. Mental and emotional balance. Cultivate a peaceful mindset by practicing mindfulness, avoiding excessive mental strain, and engaging positive thinking. Pathya Pathya. Avoid meat, eggs, salt, pickles, tea, and coffee. Regular exercise at least for 30 minutes daily. Avoid alcohol and smoking. Reduce intake of dietary saturated fat and cholesterol. Increase the use of garlic, fruit, and green vegetables. Laughter is the best medicine as it relieves stress and anxiety, which are the main cause of high blood pressure in the present era. Thank you.
Thank you, Doctor. Thank you for the wonderful presentation. Next, I would like to invite Dr. Payal Ade for the poster presentation. Dr. Payal, are you there? Dr. Payal, are you there? Dr. Payal Ade, are you there?
Yes, yes, sir. I'm audible.
Yes, Doctor, audible.
Yes. Good evening, all. I'm Dr. Payalari. Today's my topic is Darvedi Churna and Trifara Churna Pratisaran in the management of Pittash Mukhapak in children. Introduction. Comorbidity is one of the most important branch of Ayurveda dealing with the care of child from the conception of maturity. Mukhapaka is children. Mukhapaka in children prevalent to maturity all over the world. It occurs due to illness, dietary triggers, nutritional deficiency of vitamin B12 deficiency, leukemia, in inflammatory bowel disease. The symptoms of on Mukhapaka ulceration, difficulty to open mouth, looseness skin, tongue becomes intolerant to cold, burning sensation, bitter taste in mouth, itching. The lakshanas of Mukhapaka can be so common symptoms include of Toda daha, small painful round ulceration. According to Ayurveda, various treatment like Kavala, Gandush, Dharan, Shirovirechan, Pratisaran, Pratilepan are described. Need for the study. Mukha Swasthya has gained importance nowadays because Mukha is such a anga which is exposed to many risk factors in day-to-day life. Mouth is invaded by large number of microorganisms, which is normally controlled by maintenance of reasonable oral hygiene. If this is neglected, bacterial population can proliferate and cause many oral diseases. In Ayurvedic classes, many health promotive procedures are explained in the form of dinacharya, like Dantadhavan, Kaval, Gandush, which helps in prevention of many oral problems such as bad breath, poor taste perception, dryness of mouth. Recurrent office ulceration or recurrent office stomatitis is one of the most unbearable and painful oral mucosal disease. Mostly children are more susceptible for the disease. The condition has no specific cause to occur or no proper diagnosis or etiopathophysiology. The treatment options are largely palliatives and aimed at reducing symptoms like pain as it helps in improving patient oral conditions. In Ayurveda, Mukhapak is considered as specific disease, which is its own specific Nidan, Purvarupa, Rupa, Samprapti, and Chikitsa. This attempt has been made the study. This is Mukhapak according to Ayurveda text. The symptoms, the recurrent of the stomatitis is considered as the most common oral mucosa lesion. This present as recurrent multiple small ovoid ulcers having yellow floors and surrounded by present first in childhood or adolescence. The Ophthalm's ulcers are affected up to 25% of the general population and 3-month recurrent rates as high as 50%. It is the most common in female. Ulcers increases by increasing age. Minor ulcers are 80% of suffered patient. Ophthalm's ulcers were reported from the 5 to 66% amongst different natives. The cause of ophthalmos ulcers is unknown, and therefore many factors are still implicated in the disease, including hormonal changes, trauma, drugs, food, hypersensitivity, nutritional deficiency, stress, and tobacco. There are 3 clinical presentation of recurrent ophthalmos stomatitis: minor, major, and hypertiform ulceration. It is the most common form of minor is the most common form of recurrent ophthalmos stomatitis. Approximately 85% of the patients have lesions of this type. Minor ophthalmos can involve the non-keratinized mucosa of the oral cavity. Moreover, the ulcers is usually concentrated in the anterior part of the mouth. The ulcers are superficial, usually less than 1 centimeter in diameter. The classification of minor recurrent ophthalmos stomatitis does not depend on the dimension of the lesions alone, but on the number of other clinical features such as number of ulcers from 1 to 5. 1 to 5. The criteria for the inclusive criteria for the patient age group between 6 to 12 years, patient with sign and symptoms of mukhapak like salivation, irritability, difficulty in deglutition, minor recurrent ophthalmos stomatitis. The Ayurvedic Churna is indicated for the Mukhapak in Bhaishajya Ratnavali. The Ayurvedic Churna contains Daru Haridra, Yashti Madhu, Haritaki, Jati Patra, and Madhu. And Triphala Churna is mentioned as a Kapapitta. So it is selected in a Mukhapak. Triphala Churna contains Haritaki, Bibitaki, Amalaki. Churna is fine powder. The preparation method is Churna. Churna is a fine powder of completely dry drugs which is filtered through cloth. The anupan for the Ayurvedic Churna and Triphala Churna is Madhu. The requirement as the The drug is required as per the requirement for the Pratisaran 2 times a day before meal. The duration is for 10 days. The route is local application and follow-up of the patient of 0, 3, 5th, 7th or 10th days. Criteria for assessment of the patient is pain, burning sensation during food intake, redness, ulceration in bowel, that is number of ulceration 1 to 2, ulcer in oral cavities 2 or 3 or 4 or 5, inflammation, that is no inflammation, slight inflammation, moderate inflammation or severe inflammation. Thank you.
Thank you, doctor. Thank you for the wonderful presentation. Next, I would like to invite Dr. Guddi Gupta for the paper presentation.
Good evening to you all, respected sir and madam. Myself, Dr. Guddi Gupta, MD Scholar Dragagun, Yeshwant Ayurvedic College of Postgraduate Training and Research Center, Kodoli. Today I am going to presenting significance of chromatographic technique in Ayurveda pharmaceutics. So first, assessment of pharmaceutical preparations. There are 3 parameters which comes under in assessment of pharmaceutical preparations: Ayurvedic parameters, Ayurvedic dosage forms, and modern parameters. According to Ayurvedic parameters, Sabdasparshadi Pariksha, Siddhi Lakshana, Rasa Panchaka, Panchbhautikatva, etc. These all are comes under in Ayurvedic parameters. Panchavida, Kashai Kalpana, Churna, Kutivati, Sandhana Kalpana, Avaleha, Rasa Aushadhi, soft gel capsule. These all are comes under in Ayurvedic dosage forms like herbal chromatography, DNA analysis, FTR analysis, FTR, Fourier transform, infrared spectroscopy, X-ray, X-ray diffractions, X-ray fluorescence, herbomineral, spectroscopy, etc. These all are comes under in modern parameters. What is chromatography? Chroma is color and graphene to write. Chromatography is a technique in which substances are separated, purified and identified from a mixture for qualitative and quantitative analysis on the basis of hydrophobic interactions. Polarity enzymes and net charges are separated by using chromatography. Chromatography is a physical method of separation of compound. This technique was first used by Dwight. Dwight is a father of chromatography to separate various plants pigments such as chlorophylls and xanthophylls by passing these pigments through glass column packed with finely divided calcium carbonates. Types of chromatography. Like types of chromatography, like first column chromatography, paper chromatography, thin layer chromatography, gas chromatography, high performance liquid chromatography, fast protein liquid chromatography, supercritical fluid chromatography, affinity chromatography, reverse phase chromatography, two-dimensional chromatography, pyrolysis gas chromatography, and counter current chromatography. There are 2 phases which comes under in chromatography, that is first mobile phase and second is like stationary phase. Stationary phase which may be solid or liquid supported on a solid which is immobile, which means it does not move. The mobile phase migrates the sample through stationary phase. The mobile phase, the sample through stationary phase. Mobile phase may be either liquid or gas. All chromatographic method involve separation of mobile phase through stationary phase. Chromatographic Ayurveda pharmaceutics, according to primary objectives. First, separation of active components in plant material, pharmaceutical preparations, identification of an active component in unknown plant material and pharmaceutical. Third, quantification of an active component in plant material and pharmaceutical. Fourth, quality control of plant material and pharmaceutical preparations. Fifth, assessment of stability of bioactive component in plant. According to significance in Ayurvedic pharmaceuticals, like new drug development, identifying toxic and unwanted component in plant material, determine the mode of action of a plant material and pharmaceuticals preparations feasible for any dosage forms, understanding the concept behind Ayurvedic textual preparation, etc. Discussion. In Ayurveda, pharmaceuticals market is expanding globally. Introducing modern techniques in Ayurveda would be beneficial in pharmaceutical industry. Utilization of chromatographic techniques in separation, identification, and quantification of bioactive components would be beneficial in quality control, new drug development, etc. New drug development in minimal use of plant need at present. Plants which are abundantly available, also showing multiple pharmaceuticals properties, should be encouraged in a new formulations. So these are our references for chromatography. Thank you so much.
Thank you, doctor. Thank you for the presentation. Next, I would like to invite Dr. Snehal Tingare for the poster presentation. Dr. Snehal, are you there? Dr. Snehal, are you there?
Yes, sir.
Good evening, doctor.
Hello. Am I
Good evening,
audible?
doctor. You are audible, doctor.
Sir, can you share my poster?
So, doctor, just a moment.
Hello.
Just a moment, doctor. I'll share for you. Please start the session, doctor.
Okay. Good evening, everyone. Myself, Dr. Snehal Tingre, and my topic for poster presentation is child asthma. Child asthma is a chronic inflammatory condition of lung airways resulting in episodic airway obstruction. Commonest respiratory disease of children. It can start at any age. Nearly 14% of world children experience asthma symptoms. We can correlate child asthma with the Shwas or Tamak Shwas with in Ayurveda. First of all, let's see pathology. Child asthma pathology mainly consists of airway obstruction due to bronchospasm, edema, or mucus plug. The airway inflammation is mainly due to viral infection, allergens, or air pollution. Allergens such as plant pollens or house dust. Air pollution includes smoke, cigarettes, dust, and also family history or genetic condition can cause child asthma. Antigen inside inflammatory reactions and cytokines produces airway inflammations. The symptoms of child asthma includes cough, wheeze, breathlessness, chest tightness, sleep issue, fatigue, or prolonged expiration. Cough includes mainly late night cough or morning cough. The investigation which can show child asthma diagnosis are X-ray chest. X-ray chest shows hyperinflammation, and CBC shows eosinophilia. Serum IgG level are increased. Also, spirometry and lung function test also can be done. The risk factors of child asthma are allergen infections, comorbidities, or any other triggers. And management of child asthma. First of all, educate the parent about the disease. Avoid any allergens which can trigger asthma attacks, and prevent infections. The treatment of asthma, child asthma, consists of two types, that is modern and Ayurvedic. In modern treatment, 3 points are included, that are relievers, controllers, and preventers. In the relievers, short-acting beta-2 agonist, that is albuterol and terabutaline, anticholinergics and antihistamines, example, diphenhydramine. Second is controllers. Controllers are long-acting beta-2 agonist, that is salmeterol or formoterol. And third one is preventers. Preventers are inhaled corticosteroids, that is budesonide, or leukotriene receptor antagonist, that is montelukast. Second type is Ayurvedic treatment. Ayurvedic treatment consists of two types, that is Vegavastha, and another one is Avegavastha. Vegavastha consists of Anuloman Virechan given with Sendav Tel, and in Avegavastha we can give Gokshuradi Gugur or Madhumarini Vasanta. The preventive measures according to Ayurveda are we can give Bal Chatur Bhadra Ras, Chavan Prash, or Suvarna Prashan to children. Along with this treatment, we have to do some lifestyle modifications for child asthma, such as pranayam or ahar, vihar. In ahar, we can suggest lagu ushna ahar, avoid curd, rice, buttermilks. And in vihar, we should avoid cold shower or bath, anything that can trigger the asthma attacks. This all is child asthma. Thank you.
Thank you, Dr. Snehal. Thank you for the wonderful presentation. Next, we go to the paper presentation. I would like to invite Dr. Deepali Jibse for the paper presentation.
I'm from Kashmir Ayurveda Rural College, Sangamner, Manchi Hills. I'm presenting management of Ahiputana napkin rash using Triphala Vata Khadir Dhawan. My guide is Dr. Jaiprakash Khan. Introduction. Ahiputana, commonly known as diaper rash. It is commonly Kapha-Rakta disorder. Ahiputana is associated with imbalance of Kapha and Rakta. It is caused due to unhygienic condition. Improper hygiene after defecation contributes the condition, and it is caused by bacteria P. proctatis. Pathology of napkin rash due to overhydration, increase the skin pH due to moisture from diapers, enzymes, and friction and pH. Mechanical friction of diaper and pH changes exaggerate the condition. Aim and objective. The aim is to study the effectiveness of Triphala Vata Khadir Dhavana in management of Ahiputana. To evaluate Triphala Vata Khadir ability to reduce inflammation and improve symptoms. Assess the effectiveness of Triphala Vata Khadir Dhavana restoring skin health. Case study. A case study involved 3-month-old male baby with Ahiputana having symptoms like irritability, itching, burning, redness, and skin lesion. Location. All patients are selected from Ashwin Rural Ayurveda College, Manchi Hill. Duration. The symptomatic period was 3 to 5 days. Examination. The patient was diagnosed based on observed symptoms like irritability, Kandu, erythema, W-shaped distribution, Pitika, and Strava. subjective criteria for observation. Kandu, like itching, graded from 0 to 3, 0 being no itching and 3 being severe itching. Rag, graded from 0 to 3, 0 being normal and 3 being severe redness. Daha, graded from 0 to 3, 0 being burning, no burning, and 3 being severe burning. And Strab, graded from 0 to 3, 0 being no discharge, and 3 being more discharge. Treatment given. Trifalak Vata Khadir Dhavana include Haritaki, Bibhitaki, Amlaki, and Khadira. Discussion. Trifalak Vata Khadir Dhavana exhibits anti-inflammatory and antimicrobial properties, soothing effect, and protective barrier. Conclusion. Trifalak Vata Khadir Dhavana is effectively manages ahiputana, reduce inflammation, decreases inflammation and redness, infection prevention, prevent bacterial and fungal infection, soothing effect, provide soothing and calming effect, and protective barrier. Act as a protective barrier for the skin. Thank you.
Thank you, Doctor. Next, I would like to invite Dr. Monali Naneshwar Thage for the paper presentation. Dr. Monali, are you there? Dr. Monali, are you there? Dr. Monali, are you there? Doctor, we can't hear your voice, Doctor. Doctor, can you please reconnect your headset, Doctor? Dr. Manali, can you hear me? Dr. Manali, can you hear me, Doctor?
Yeah, sir. Yeah, sir.
Okay.
Good
Okay.
evening, sir.
Good evening, Doctor.
Yeah. So, can I share my screen?
Sure, Doctor. Please, Doctor. Hello, Doctor.
Yeah, sir. Hello.
Can I share your PPT, Doctor?
Yeah, sir. Okay, sir.
Please start the session, Doctor.
Hello.
Hello.
Hello. So this is my PPT. Hello. Hello.
Hello, sir.
Hello.
Hello, sir. Hello,
Hello.
sir.
Hello. Hello.
एक सेकंड मोनाली चार्ट मध्ये टाक.
Okay.
Hello, Dr. Manali. Can you hear me, doctor?
Yes, sir. Yes. Am I audible now?
Yes, doctor. Please present, doctor.
Okay, okay, sir. Okay. Good afternoon to one and all. So I'm Dr. Monali Daneshwar, PG scholar from Dravidian Department of GSC Dharashu. My topic is determination of Anukta Dravya through classical Ayurvedic principles. So starting from the introduction. One second. So starting from the introduction, what is meant by Anukta? Anukta is a dravya which is not included in Ayurvedic Pharmacopoeia of India or not found in Ayurvedic literature. So as we all know that the drug is a tool for physician and it is an important factor for successful management of disease in Ayurvedic classical texts. Our Acharya is also suggesting Aptopadesh along with the Anuman to determine properties of undocumented drugs. Then our aim is to explore the classical principles regarding the determination of properties of Anukta Dravya. Then materials and methods we are using for determination of the Anukta Dravyas. Basically, we are using the Bruhatray with available commentaries and various scattered principles and methods providing the guidelines on the evaluation of Anukta Dravya were synchronized and explored. Then keywords I have mentioned over here. The need of determination of Anukta Dravya. As we all know that we are in the era of newly emerging diseases, Anukta Dravyas may help in finding the solution. And many important medicinal plants have been red listed and many are on the way. Anukta Dravyas may solve the problem of scarcity of medicinal plants. Our Acharya Charak clearly directs to collect information about known and unknown Dravyas from forest dwellers, shepherds, tribes, etc. And new drugs brings prosperity in the economy of the nation. Then protocol for the evaluation of the Anukta Dravya. So basically there are three kind of pariksha. First one is the Aptopadesh, second one is the Anuman, and third one is the Pratyaksha Pramana. So these pramanas have been described to assess all kind of substances. Anukta Dravya also can be assessed by these methods. Starting from the first praman, that is Aptopadesh. So I've mentioned shloka of Acharya Charak over here. That is Gopala Stapasa Vyadha Etascha Anya Vanacharanaha Mulaharasya Etebhyo Bheshajya Vyarash. These are authoritative instructions. It is said that foresters like shepherds and goatherds are acquainted with the names and forms. It has reduced confusion regarding the classification and identification of the drug. Then second one is the Pratyaksha Praman. As we all know, we are using this Pratyaksha Praman, evidence based on direct observations. So we are studying the organoleptic characters of the drugs like taste, color, smell, etc. with the help of this Pratyaksha Pramana. Then third one is the Anuman Praman. It is inference or indirect knowledge based on reasoning. Then it is also important method to determine the properties of Anukta Dravyas. Then Rasa Pariksha. The Rasa Pariksha can be done with the help of Pratyaksha Praman. That is the test perceived immediately on dropping the drug on tongue as is ras. Then Virya and the Vipak Pariksha. After Rasa, Virya and Vipak Pariksha is basic necessity. After knowing the ras, we can decide Virya and Vipak by its respective ras as implemented in the Sahitas. Even by the method of Upaplavadi Hetu explained in classics, also we can know the Anukta Dravya, Virya and the Vipak. So Virya Upaplavadi Hetu is nothing but the Adivasa, Nipata and the Adivasa. Adivasa is nothing but the drug is, whenever the drug is in our body, and Nipata means the test we perceive. Then the Vipak Pariksha, we can done it, with the help of Anuman Praman. Vipak can be assessed by Dosha Karma, that is action on humus, Dhatu Karma, and the Mala Karma, that is action on the metabolic. Then the Virya Pariksha, Virya means potential of drug can be assessed by Upaplavadi Hetu, that is Adivasa, Nipata, and Adivasa. Adivasa is nothing, Adivas means with the help of Anuman Praman. Nipat can be done with the help of Pratyaksha Praman. And Nipat and Adivas is the combination of both. Then Prabhav Pariksha. Prabhav can be assessed by asking to traditional folklore practitioners and also by inquiring Vancharas and the Gopalkas. Then I've mentioned a list of some of the Anukta Dravyas over here. The first is Ratki Rani. That is a locality where the vernacular names used is the Ramnagar. Botanical name of the Ratki Rani is the system nocturnum. Family is the Solanaceae. Native of the West Indies, it is found. And habitat, it is a shrub. The useful part of this plant is the leaf. It can be used in the spasm, heart diseases. Second one is the Ban Tambaku. It is also found in the Varanasi. Botanical name is the Solanum erianthum, family Solanaceae, and it is also a shrub. The useful part is the root or the whole plant. It can be used in the inflammation, pain, cough, skin disease, sore, asthma, and the rheumatism, diabetes also. Third one is the Nagful. It is found in the Varanasi also. The botanical name of Nagful is Gamelina asiatica. Family is the Verbenaceae family. Native origin is the native of East Indies, and the habitat is also shrub. Useful part, we can use the whole plant. Therapeutic uses, it can be used in the rheumatism, syphilis, gonorrhea, burning sensation in eye, fever, dysuria, and dandruff. Fourth one, Nukta Drava is the Ghoda Tulas. The locality where the vernacular names used is the Maharashtra. Botanical name of Ghoda Tulas is Paparia dulcis. Family is the Scrophulariaceae family. Native origin, native of America. It is a herb and useful part is the whole plant. It can be used in headache, toothache, cough, wound, heart disease, hemorrhoids, dysentery, and in diarrhea. Then another one is the Gulbakshi. We all know that the locality where the vernacular names used is the Maharashtra. Botanical name is the Mirabilis jalapa and family is the Nictaginaceae family. Native origin is the tropical America. It is a herb. Useful part root, leaf, stem, tuberous seeds. Therapeutic uses, it is used in boil, syphilis, abscess, colic pain, diabetes, dropsy, gonorrhea, itching, sore, and the tumor. So conclusion of the whole topic, that is the last part, that Anukta Dravya, that is the undocumented or the extra pharmacopoeial drugs can be assessed by Ayurvedic basic principles. Pramanas emphasize the role of evidence in any research of examination protocol. Utilization of Pramana with other principles may provide the evaluation method of Anukta Dravyas. And monograph of any Anukta Dravya can be prepared based on the examination method for drug mentioned in Ayurvedic texts. The study of any new drug by these examination tools will facilitate its inclusion to the Ayurvedic compendium. Here are some references. Thank you.
Thank you, Dr. Monali. Next,
Thank
I would
you.
like to invite Dr. Nayana Amol Chakwade for the poster presentation. Dr. Nayana, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir.
Dr. Nayana, please start the session, doctor.
Yes, sir. Good evening to all. This is Dr. Nayana Molsakwate, PG last year, Rasashastra and Bhaishya Kalpana, Yashwanta Ayurved College, Kodoli. My topic is broad spectrum dynamic preparation of the sulfur. Introduction. Gandak is listed in Uparas and is the second most important mineral in Rasashastra. It has the characteristic smell. It has various type of synonym like Keetanashana, Putigandha, Keetagna, Shulbari, Bali, Navnit, etc. Are the synonym of the Gandak. It has the Rasayan properties and it is used as a like a Krumidoshahar, Jantugna, Amadoshahar, and Kushtahar. Sulfur is very essential to the human body. It helps to maintain the strength, flexibility of the tissues, repair DNA, and protect the cell from the damage that could result in the serious disease like cancer. Additionally, sulfur support healthy skin, tendon, ligaments, and help to metabolize food. Rasavaidya used gandak in all medicinal preparations. After appropriate shodhan, it has many benefits as an important agent of the various procedure of the Parat, Murchana, Jarana, and Satvapatan. So the second point is Gandhak Kalpas in the Rasashastra literature. So here I am mentioning this 10 Kalpas. Their Gandhak proportion, Rogadika, specification of the Kalpa, and the key role of sulfur in each Kalpa. So the first one is the Kanak Sundaras. Gandhak proportion is Samabhag. Rogadikar is Balarok. Specification is a Rasakalpa, and sulfur act as a Yogavahi and Rasayan. Second one is the Gandhak Rasayan. only is in that only Gandhak is included. रोगाधिकारी सर्व व्याधीहर, खरलीय कल्प, विषग्न and Rasayan. Then Pratap Lankeshwar, Gandhak proportion is one part. रोगाधिकारी is Sutikajwar and specification of the kalpa is Kharaliya kalpa, Rudya and Rasayan. Then fourth one is Panchamrut Parpati. Gandhak proportion is two part. Rogadhikari is Grahani and specification of kalpa is Parpati. And key role of sulfur is 3 doshagna. Fifth one is Ekangavi Ras, Gandhak proportion Samabhag. Rogadhikari is Pakshaghat. Then specification of kalpa is Rasakalpa. Vatavahi Nadi Balapradhan. Sinhanath Gugul, Gandhak proportion 2 tola. Then Rogadhikar, Amvat, Gulkalpa, Agni Deepan, Dhatu Bal, Ayu Ruddhi. Gandhak Dhruti, Gandhak proportion is 5 tola. Tvacha Vikar, Tailam, and a key role 3 doshagna. Then Jati Faladi Putpak, Gandhak proportion is Samabhag, Rogadhikari Atisar, specification of Kalpa is Putpak, and it is key role of sulfur is Agni Deepan and Ampachan. Then Dadru Vidaran Malahar, Gandhak proportion is 1 tola, Dadru, Malahar, and Kushtagna. Then Gandhak Draw, Gandhak proportion is 100 pal, Rogadhikar Kushtha, then specification Arka Kalpana, Krumi, Krumigna. Then last point is conclusion. So the Gandhak has the most significant role in the preparation of all Rasakalpas. Panchamrut Parpati, Hemagarva Potali, Makardhwaj, Rasasindhu, Sinhanath Gugul, Gandhak Dhruti, Ekangavi Ras are the popular preparation of the Gandhak. It may be concluded that Gandhak and its preparation are widely used for their salutary importance. Thank you, sir.
Thank you, doctor. Thank you for the presentation.
Thank you so much, sir.
Next, I would like to invite Dr. Aarti Vishnu Nagare for the paper presentation. Dr. Aarti, are you there?
Good evening, sir.
Good evening, doctor.
Hello.
You are audible, doctor.
My name. Hello.
You are audible, doctor. Please
Hello.
continue.
Good evening, sir. My name is Dr. Aarti Vishnu Nagare. My topic name is Mineralogical Aspects of All Maharas under the guidance of Dr. Sunil Bakre, sir, from Yashwant Ayurvedic Medical College, Kodoli, Kolhapur. Mineralogy is the study of the chemistry, physics, and crystal structure of nature, solid crystalline materials. Also includes study of origin, processes of mineral formation, their geographical distribution, classification, as well as utilization. Parameters for identification of minerals: color, nature, luster, streak, asterism, cleavage, diaphanity, fracture, specific gravity, hardness, elasticity, taste, odor, porosity, and feel. Color is usually the first property of minerals which is noted. A mineral gives constant color when observed on freshly broken surface. Colors are determined by the main element in a mineral chemical formula. For example, azurite color is blue. Certain minerals has multiple colors like fluorite and tourmaline has a single crystal form, 2 or more colors. Idiochromatic minerals means self-color due to their composition. And next one is allochromatic minerals, other colors due to trace impurities in their composition or defects in the structure. Pseudochromatic minerals means false color due to tricks in a light diffraction. Next is nature. Being natural chemical compound, minerals may occur in any aggregation state, though most of them are known to belong to solid crystalline substances. Natural occurrence of minerals in the following forms, that is crystalline, amorphous, opaque, transparent, translucent, and aggregate. Next one is luster. Luster is the quantitative measure of the light reflective ability of a mineral. It describes how a mineral surface reflects light and how the interior of the mineral may refract or bend right. Two types of luster, that is metallic or metallic and non-metallic. Subtypes of non-metallic lusters are pearly, vitreous, resinous, silky, greasy, adamantine, dull, and waxy. Streak. Streak means simply the color of a mineral in its powder form is called streak. It is the reflected color of the mineral. The color of a streak may or may not be same as the color of a mineral. Method of determining streak is rub the mineral against a ceramic streak plate or other piece of unglazed ceramic. For example, hematite looks black but it produces red brown streak. And next is pyrite looks yellow gold but it produces gray streak. Next one is asterism. Asterism means star-like appearance. This concentration results from twinning or from regularly oriented conclusions. For example, uh, Phlogobite exhibits 6 red stars transmitted and reflected light. Next one is cleavage. Cleavage, it is the tendency of a crystalline materials to split along definite crystallographic materials to split along definite crystallographic structural planes. It is used in hand-sized specimen and microscopic examination of rock and mineral studies. Types of a cleavage is basal, prismatic cleavage, cubic cleavage, rhombohedral, octohedral, and dodecahedral. Diaphanity means transparency. It is a mineral degree of transparency or ability to allow light to pass through it. It also depends on the thickness of the mineral. 3 types of diaphanity, that is opaque, transparent, and translucent. Next one is fracture. Fracture is the property of a mineral breaking in a more or less random pattern with no smooth planar surfaces. Types of a fracture is conchoidal, Heckley, uneven, splintery, and earthy. Specific gravity of any substance is a ratio of its weight in air to the weight of an equal volume of water. The specific gravity of a mineral determines how heavy it is by its relative weight to water. The specific gravity of a natural mineral is known to vary from 0.8 to 21. Next one is hardness. Hardness of the minerals is its resistance to scratching. It is a relative parameter. In mineralogy, relative hardness is always determined by using set of minerals known as a Mohs scale of hardness. Next one is elasticity. The elastic qualities of minerals are so varied that is considerable number of types or degrees are recognized. Types are elastic, flexible, malleable, ductile, sectile, and brittle. Next one is taste. One of the minor properties of mineral is taste of some which are soluble in water. Type of taste are as acid or sour, alkaline, astringent. This property is restricted to relatively small number of minerals and is not especially diagnostic. Next one is odor. Although most minerals have no inherent odor, a few do have a characteristic smell. Types of odor are sulfurous, alaceous, and fetid. Porosity. Some minerals absorb water so readily that they will adhere to the tongue. This property in restricted value in mineral determination but is useful in special instances. Next, last one is feel. Certain minerals have distinctive feel which may be of some value in determining them. Example, minerals like diamond conduct heat very well, they tend to have a cold feel. Talc and graphite have a crazy feel. Chalk has a harsh or meager feel. Fibrous minerals has a distinct silky feel. Thank you.
Thank you, doctor. Thank you for the wonderful presentation.
Thank you. Thank you, sir. Thank you. Thank you.
Next, I would like to invite Dr. Deepali Sardar for the paper presentation on the topic Manashila. Dr. Deepali, are you there?
Yes, sir.
Good evening, doctor.
Hello.
Hello. You are audible, doctor.
Yes, sir.
Hello, Dr. Deepali. Please
Yes,
start the session, doctor.
Okay. Hello, everyone. Good evening, everyone. Welcome to my presentation. My name is Dr. Deepali Sardar. My presentation name is Manashila. My guide is Dr. Swati ma'am and HOD is Dr. Bakre sir. So this is Manashila. Okay. Introduction. Manashila is mentioned under Uparasa. Acharya Madhav has stated that Manashila is variant of Hartal, and the difference between them is that Hartal is deep yellow and while Manashila is dark red or blood red in color. It is chemically identified as a red reargar or arsenic disulfide or arsenic sulfide. As mentioned in Brodres, it was being used in India since Sanhita period and also used in other ancient civilization. It was recently used in modern chemotherapy to treat syphilis also. So the synonyms of Manashila are Manashila, Rogashila, Kunati, Kulati, Kalyanika, Nagmata, Nagajivika, Manogupta, Manodnya, Sheila, Rasanetrika, Manovaha, when pleasant of mind, Nagajivika, snake tongue, Nepali, because it is found in Nepal, and Manashila, which is found in stone form. That why its name is Manashila. The vernacular name of Manashila is in Hindi, we can call as Mansil. In Telugu, we can call as Manisila. Kannada, Manisile. Tamil, Kudirepal or Manosilai. In English, name of Manashila is Realgar, red arsenic, ruby sulfur. Composition and occurrence. Manashila is a compound of arsenic and sulfur. It consists of 2 atoms of arsenic mixed with 2 atoms of sulfur. Its chemical formula is As2S2. It naturally occurs in mineral and can also be prepared artificially also. Reference of Manashila are found in Sanhita are as follows. In Sushruta, Aragvadiya Adhyay, Manashila is a ingredient of 5 Kushtahara Lepa. In Chikitsa Stan, Kushta Chikitsa Adhyay, Manashila is used in Lepa Yogas for Sidma Kushta and Tailo Yogas indicated for Mandala Kushtam. Also, it is the ingredient of Shvitrahar Lepa also. Okay. In Ashtang Hriday, the reference is in Chikitsa Stan. Dhupan Yogas having Manashila in Kasa Chikitsa and Swasa Chikitsa also. In Lepan Yogas, we can use in Vidradhi Chikitsa as an ingredient of Guguladi Marichadi Tail mentioned in Kushta Chikitsa. In Mahajwara, okay. Varieties in Rasa Kamdhenu, the 3 types of Manashila are there: Rakta, Pitta and Khandakya. These types of Manashila are Shamangi, Kanvirika and Khandakya. The color is yellowish red or blackish tint, which is Shamangi, coppery red, which is Kanviraka, and excessive red compared to less to pale. This is in Khandakya. Luster is in Shamangi, the luster is bright. Kanviraka is bright also. Khandakya is not mentioned. Other heavy, Shamangi is heaviest in weight. Kanvirika is brighter, heaviest in weight, and Khandaki is also heavy in weight, which is mentioned in Rasaratna Samuchaya. Okay. Shreshtatva. Rasaratna Samuchaya shows that Khandakya is Kanviraka is greater than Khandakya, and Shamangi is greater than Kanviraka. This is when Kanviraka is greater, and the Rasa Kamdheru, Khandakya is greater. Ashuddha Manashila Dosh. If we consume the Ashuddha Manashila, the symptoms are there, which is Ashmari Mutrakucha Ashuddha Krute Shilaha, means Ashmari, which is Ashmari, Mutrakucha, Agni Mandya, and Malabadhata, which are the symptoms of Ashuddha Manashila consumption. Amayik Prayog. Visham Jwar, which is Swarasa Trikatu Madhu in a Shwasa her Manashila with Pipali Churna is titrated in water, applies anjan. This is also a form of Manashila. In eye disease, 1 part is Sainda, 2 parts Maricha, 3 parts Manashila, 4 part Shankha Churna made into fine powder, which is made the anjana, which is used in eye disease also. In Apasmar, Manashila plus Kapot with Rasanjanam as an anjani Apasmar also. Color of Manashila: orange to red, luster, resinous, adamantine or to submetallic, transparency crystal or transparent to transparent. Streak orange to red yellow, crystal system monoclinic, crystal habits prismatic, straighted crystals. Hardness of Manashila is 1.5 to 2. Specific gravity is 3.5 to 3.6. Cleavage is good in one direction. fracture subconchoidal, tenacity is sectile, slightly brittle. Other characteristics are that Manashila is unstable in light. Specific should be stored in complete darkness. Rarely some specific fluoresces under UV light also. Associate minerals are orpiment, calcite, stibnite, and other minerals also. A melting point of Manashila is 320 and burns with bluish flames, which release arsenic and sulfur. Realgar is famous for being beautiful specimen also. Deep ruby red color with amazing clarity and luster. Traditionally, historical uses of Manashila are ancient Romans, which use the Manashila for pigment and medicine. In China, it is used for medicine, for dye and paint also. For fireworks explosion, Manashila is used there. Toxic effect of Manashila organ system. In nervous system, long and short exposure may lead to encephalopathy and Guillain-Barré syndrome like neuropathy also. And blood, it affects bone marrow and cellular composition of blood, anemia and leukemia also. In liver, it produces fatty infiltration of liver. Central necrosis and cirrhosis may also damage the liver also. These are some toxic effect in organ system, which is in lung cancer, heart attacks, or urinary bladder cancer. These are some cirrhosis or the side effects of Manashila. Toxicology stored in liver, kidney, hearts, and lung. Minute amount found in muscle, neural tissue, nail, hair, bones. Crosses the placenta barrier and resulting fetal damage has been reported. Eliminated through many routes, mainly in urine. Half-life of excretion being 3 to 5 days only. Shodhan of Manashila in Rasaratna Samuchaya as Ashuddha Manashila is purified by subjecting into Bhavna with Agastya Patra Rasa for 7 times. Shodhan of Manashila are as follows. The other described are Manashila kept immersed in Shuddhodak for 3 days. Rasatarangini in Rasatarangini. Swedan in Dola Yantra with Bringraj Swaras for 4 yams. Rasatarangini in Rasatarangini. In Ayurved Prakash, there's Swedan in Dola Yantra with Ajamutra for 3 days. Bhavna with Pitta of Aja for 7 days. Bhavna with Bija Patra Rasa for 7 days. And Swedan of Dola Yantra with Jayantri Swaras for 4 yams. These are some Shodhan of Manashila. See, Maran of Manashila is not mentioned in Grantha, so there is no Maran of Manashila. Sattva-patan of Manashila is as follows. Take Manashila and add Bupul, Guda, Grita, Mandu together. 1/8 part of Manashila. Titrate them in together in Khalvendra to make mixture. Add the mixture in Musha and heat it with a high flame. After Sankhya is formed, this is Sattva of Manashila. The Sankhya is called as Sattva of Manashila. Properties of Manashila as Ayurveda are. See, Rasa of Manashila is Katu Tikta, Guna, Ushna Snigdha Guru in Rasa Tarangini. Ayurveda Prakash says Ushna Snigdha Guru Sara also. Virya of Manashila is Ushna. Karma Rasa is Rasayan in Rasaratna Samuchaya. Rasa Tarangini says Lekhani, Rasayani, Varnya. And Ayurveda Prakash says Varnya and Lekhani also. Dosha Karma is Kapavathara and Kapavathara says in both of the Granthas. Indication Visham, Agnimadnya, Kandu, Kasa, Kshaya, Bhutopaha. Important formulas are Swasakutta Ras, Rasendra Gutika, Kshaya Kesari Rasa, Kumihara Rasa, Krumi Vishnasha Rasa, Mrutyunja Sanjivani, Manashiladi Kruta, Manashiladi Taila, Manashiladi Varti. These are also the formulation of Manashila. Okay, thank you.
Thank you, Dr. Devali, for the detailed presentation.
Okay,
Thank you
sir.
so much, Doctor.
Thank you, sir.
Next, I would like to invite Dr. Anakha KP for the paper presentation. Dr. Anakha, are you there?
Yes, sir. Is it audible?
Audible, Doctor. Good evening, Doctor.
Good evening, doctor. Sir, is the screen visible?
Yes, doctor. Your screen is visible. Please start the session, doctor.
Okay. Good evening, everyone. Myself, Dr. Anaka KP, third year PG scholar, Alva Ayurveda Medical College, Department of Shalakitandra, presenting here on the topic Ayurvedic Management of Keratoconus, a case report. So, what is keratoconus? Keratoconus is a non-inflammatory bilateral ectatic condition of cornea in its axial part. It usually starts at puberty and progresses slowly. So, there will be a defective vision due to progressive myopia, irregular astigmatism. This is a normal person vision and a keratoconus person vision. Apart from blurring of vision, there are photophobia, diplopia, headache. Signs like placidodisc shows irregularity of circle. Slit lamp examination shows ectasia of cornea, box striae, thinning of cornea. Scissor reflex, Munson signs, and oil droplet reflex. So treatment advice are spectacle corrections, clearer lens, intact CDR treatment, corneal collagen cross-linking, and keratoplasty in advanced conditions. Keratometric values shows if there is a keratoconus, keratometric value will be increased. And according to the grade severity of the keratoconus, it is graded as mild, moderate, and severe. Corneal topography is a study of shape of corneal surface and also helps in detecting early keratoconus. So the case report here, person age of 20 years, came to our OPD on 7/8/24 with presenting complaints like blurring of vision of both eyes, discomfort while looking to light since 1 year, associated with heaviness of both eyes since 6 months. History of presenting complaint. Patient was already a known case of keratoconus before 2 years. For that, he took C3R treatment of both eyes. 1 year before, he developed pain, itching, redness, and blurring of left eye and diagnosed with viral keratoconjunctivitis. For these, he took treatment and got complete relief of all symptoms. He gradually noticed blurring of both eyes, which is progressive in nature, along with discomfort while looking to bright light, associated with heaviness of both eyes, which is more in left eye. For these complaints, he came to our hospital on 7/8/24. History of past illness, already a known case of viral conjunctivitis, took medicine non-containing, no history of diabetic mellitus or hypertension, bowel regular, twice daily, appetite good, maturation 3 to 4 times, sleep sound, mixed diet, and habit of rubbing eyes. Family history, nothing specific. Treatment history, both eye accelerated corneal collagen cross-linking was done 2 years before. And diagnosed has right eye is having severe keratoconus, left eye is having advanced keratoconus. These are the corneal topographic image of right eye, left eye, with correction and with after the correction of C3R treatment is given. Medicine advice at that time and not continuing using scleral lens for left eye after treatment for vision improvement. So local examination lead no abnormality of right eye and left eye, conjunctiva slight congestion in both eyes, sclera no abnormality, cornea showing keratoconus, walk straight and thinning and ectasia of cornea on both eyes, anterior chamber no abnormality, pupil reacting to light, lens grayish black which is normal. Ophthalmoscopic examination show fundus appear normal in both eyes, oil droplet reflex present in both eyes. Munson sign is present in both eyes, retinoscopic examination, scissoring of reflex present in both eyes, irregular astigmatism is also found. Shimmer stress 7 and 20 in left eye and right eye, lacrimal apparatus no abnormality, digital tonometry, fluctuation present in both eyes, corneal topography patient is not willing to take. Coming to visual acuity, with specs of left eye, there is a 6/6 60 corrections. Without specs, 5/60. Right eye, 6/9 and 6/80. Pinhole, with pinhole, he is getting a correction of 6/9. Near vision, N6 in both eyes, left eye and right eye. AR reading, we are not getting left eye AR reading. Right eye, minus 2.50 and minus 2 cylindrical, 180 degree. Lens correction, right eye, minus 3 with a correction of 6/9 and minus 2 cylindrical and 180 degree. Coming to Nidana Panchaka, Nidana may be Jatri Jagrana, Sushma Nirikshana, Kadu Amlahara, Abhigata, Purvaruba, Abhikta Lakshanam, Ruba, Guru Abilam, Vihyamanam, Rupe Sakriya Swakshi, that is blurring of vision, Adhisthana Padalam, Pradama Padalam, Mandala Krishna Mandalam, Tejo Jalam Mahapuram. Coming to the probable samprapti due to Ahara Viharaja Nidana, Siraju Saibe Urga Magatake, जायते नेत्रभागेषु रोगाः केत्स्थानसंश्रयन् प्रथमपटल अव्यक्तरूपदर्शनं blurring of vision व्यवच्छेदकनिदानं प्रथमपटलगततिमिर द्वितीयपटलगततिमिर keratoconus keratoglobus diagnosis prathamapadalagatatimira Ubashaya means for patients are wearing spectacles Anubashaya white staining rubbing of eye Ratri Jagana. So the treatment advice are Tarpana is given with Tripalagrida for 5 days, Nasya with Anutaila both eyes 6 drops for 7 days, tablets Saptamrita Loka given with honey and grita, Triphala Chulna 1 teaspoon with warm water, continue for 1 month. So these are the treatment timeline. And on 12/8/24, relief in discomfort while looking bright light was observed, reduced in discomfort, and 14 moderate relief in blurring of vision was found. Took internal medicine for 1 month. Coming to the result on 5/8/24, that is after the treatment, left eye is showing an improvement with spec 6/36, partial and without spec 6/60. And on 6/9/24, that is after 1 month, left eye is showing 6/18 partial and 6/24 partial. Coming to other findings like scissoring reflex was absent in right eye, Vox dry was absent in right eye, or oil droplet reflex reduced. AR reading, we are getting AR reading. With right eye is a -1 diopter radiation in the cylindral power is observed. Shimmer stress also improvement like left eye 15 and right eye 20. Cornea topography patient not willing to take. Mode of action of Tarpana when coming. Tarpana is the best procedure for nourishing of eye. So the grita can easily penetrate the cornea. So in keratoconus, there is a primary epithelial abnormality and release of proteolytic enzyme which degrade the stromal collagen and weaken the cornea. The vitamin A present in the grita help to maintain the integrity of corneal epithelium. Hence, by the epithelial abnormality can be prevented. Triphalacuna, with the chief ingredients which contain vitamin C, which plays a key role in collagen synthesis and strengthens the cornea by decreasing the distance between collagen fibers and enhances the collagen cross-linking in vitro. And also, it is a potent antioxidant. It has a potent antioxidant activity. Nasya is said to be having provide strength to the ocular tissues and improve vision. Anodila pacify all dosha and strengthen the sense organ. When coming to Saptamra Loka, it contains iron, which is required for the synthesis of collagen, indicated in Prathama Padalagata Roga, Timira, and Vadaja Timira. Patya, the Patya mentioned Ahara Sarda, Patya Ahara like fish, meat, eggs, nuts, which contain riboflavin, and banana orange which contain vitamin C. Mudga, Yava, Raktashali, Kulutta, Lashunas are mentioned. Vihara like Chatradharana, Padambyanga, wearing googles are advised. Apatya like Didi, Kadu, Ahara, Tishna, Vidahi, Ahara should be avoided. Ratri Jagarana, Krodha, Vegadharana, Dhuma, Nikshevana, etc. like Vihayas are avoided. Coming to discussion and conclusion, keratoconus is a progressive disease and its progression should be restricted to prevent complications arising out of it. The results are encouraging as there was improvement in visual acuity with reduction in symptoms and there is no progression of disease after treatment, which remains stable and showed slight improvement in the astigmatic correction. Thus, it can be concluded that drug employed in the treatment could promote the integrity of epithelium, increase collagen synthesis, helping collagen cross-linking and remodeling of collagen fiber, thereby strengthening the cornea. Hence, this simple and non-invasive treatment protocol can be adopted in future in successful management of keratoconus. These are the reference. Thank you.
Thank you, Dr. Anaga. Thank you for the wonderful session. Next, I would like to invite Dr. Guddi Gupta for the poster presentation.
Good evening to you all, respected sir and madam. So myself, Dr. Buddhi Gupta, MD Scholar Dravigun of Yashwan Ayurvedic College of Kodoli and Kolhapur. So today I will be presenting the topic of analysis of swarup of two species of Jayanthis sespeania, sespen and sespeania aculeata. So before starting the presentation, I will give this shortly introduction about Jayanthis sespeania, sespen and sespeania aculeata. So it's a Egyptian river hemp. It's a species of plant in the legume family. Both belongs to the family of Fabaceae. Both are having fast-growing species. Botanical name is like Sespeania egyptica. English name is like common Sespeania Egyptian rattlepod. Hindi name is Dunchi, Jayanti, Jati, and Raswan. Chemical constituents involve like glucose, fructose, sucrose, arbitol, and minoxidil were identified in bark and stem extract, and ambesterol and cholesterol. These are chemical components which are found in the leaf and pod, and cyanidine and delphinidine. These are chemical constituents which are found in the flowers of Jayanthis sespeania sespen. According to Ayurveda Sanskrit. So, Jayanthis sespeania, according to Rasa Virya Vipaka, like Tikta Katu Rasa, Katu Vipaka, Ushna Virya, this all found in Jayanti sespeania sespen, Lagu Ruksha Guna, and balances the kapha and pitta over the dosha. Root, bark, flowers, and seed. These all parts are used in Jayanti sespeania sespen, and 2 to 6 grams of powder of used in medicinal plants. An indication like a mutra puksha, visha, galaganda, bhutapa, and ointment. It's used in itching and hives. External use like eczema and psoriasis, etc. So need for the study, like the purpose is to find the differences between the two species of Jayanthis sespeania sespen and Sespeania aculeata of their characteristic feature, that is swarup. So the attempt is to study the whole plant of the two species in which both the species are different from one another in a view of characteristic features. From the ancient period of time, our traditional and cultures are using herbal treatments successful, including their versatile uses. Sesbenia sesben is one of them. This plant belongs to the family Fabaceae, Leguminaceae. It's a fast-growing, short-lived, and fixes atmospheric nitrogen. The plant used to shed the plantation of coffee, tea, and cocoa. Methods. The method is a systematic data processing approach by reviewing literature search, data extraction, and analysis, and writing the literature review of swarup of two species of Jayanthis sespeania sespen and Sespeania aculeata. Results on the basis of classical Ayurvedic textbooks, literature review, and from various websites. Results are as follows. Similar literature like both species are and fixing shrub suitable as a soil improver, fast growing and tropical annual legume shrub. Differences aculeata species has a thorn on stem. Discussion on the background of published data, collected data, and observed data. Discussion and sespen is widely distributed and cultivated throughout a semi-arid and sub-humid tropical regions. The prickly sespen, Van Jayanti, Sesbenia aculeata is a fast-growing tropical annual legume shrub used for fodder. The variations in active constituents of the plants depends upon the geographical conditions and soil. Thrown modification is to save plant from herbivorous animals, etc. Like references, those are references of Jayanti sesbenia sespen and Sesbenia aculeata, Kedu Nigantu, Prakash Nigantu, and Acharya Priyavat Sharma. Thank you so much.
Thank you, Doctor. Thank you for the wonderful presentation. Next, I would like to invite Dr. Vismita for the paper presentation.
Namaste everyone. I'm Dr. Vismita Kshar, third year PG scholar from Department of RSBK GMC Bangalore. I'm presenting on topic understanding the connection between diet, lifestyle and skin health. Contents are introduction, Ayurvedic principles in skincare, lifestyle practices in skincare, general management of skin disorders, future scope and conclusion. Introduction. In Ayurveda, the treatment is aimed at prevention of disease and cure of already manifested disease through judicious and logical use of ahara, vihara, and aushadha. Ayurveda has included skin diseases under the umbrella of Kushta and has pointed at its multifactorial etiology. Erroneous diet and lifestyle have been implicated as chief factors for onset and progression and recurrence of many skin diseases. Ayurvedic principles in skincare, one can approach towards Ayurvedic skincare based on dosha, agni, and diet. The diseases of skin often mirror in inequilibrium of dosha in the body, as skin represents the substratum upon which the quality of ahara rasa, which is obtained from ahara, is depicted upon. Vata skin type, based on dosha predominance, types of skin are Vata skin type, which has features like dry, thin, delicate, cool to touch, easily gets dehydrated, vulnerable to dry, windy weather, age faster, tends to dry, rough, flaky. Skincare includes diet like Ushna Snigdha Ahara, use of Madhura Amla Lavana Rasa, drink lukewarm water, plenty of fruit juices, use of healthy ghee, olive oil. Lifestyle like Abhyanga with lukewarm Tilataila, going to bed on time, and pranayama. Pitta skin type will be having features like fair, sensitive, soft skin and less tolerance to heat, more prone to freckles and moles. Imbalance can flare up in rashes, acne, and sunspot. Skincare of Pitta skin includes Madhura Tikta Kashaya Rasa Dravyas, and the consumption of gulkan and ghee and milk can help. Lifestyle includes Abhyanga with Chandana Taila or coconut oil. Avoid being exposed to sun, yoga, and pranayama. Kapha skin will have features like oily, thick, pale, soft, cool, more tolerant to sun. Kapha skin tends to age slower and forms less wrinkles, suffer from dull complexion, enlarged pore, excessive oil, blackheads, etc. Skincare includes Ushna Lagu and less oily food, avoid heavy food, and use of pepper, ginger in cooking, plenty of oil and food, vegetables, and lifestyle includes Abhyanga with warm oil and regular physical exercise. Dosha skin based on dosha predominance, Vata Pitta will have dry and sensitive skin, Kapha Pitta will have oily and sensitive skin, Vata Kapha will have dry and oily skin. Skincare includes, depending on dosha predominance, it should be done, and yoga and pranayama will help. Agni. Ayurveda defines healthy individual as Samadosha Samagnisha. So impaired Agni is the root cause for manifestation of all the disorders, and it is the responsible factor for Varna and Prabha. And it is of three types mainly: Jataragni, Bhutagni, and Dhatvagni. Jataragni, if Jataragni is vitiated, then it forms Apakva Anna Rasa in Amashaya, which forms Ama formation and accumulates all over the body and blocks the srotas, and which causes skin disease. If Bhutagni is impaired, 5 Bhutagni digest their own part of the element present in the food material. After the digestion of food by the Bhutagni, digested material containing the element and qualities similar to each Bhuta nourish their own specific Bhautika elements of the future. Normal Vaivagni, skin gets luster. If it is rearranged, then the discoloration of the skin will be there and disturbances in skin soft touch takes place. If Dhatvagni is improper, Sa-Amaja Dhatu formation and Malabhaga of the Dhatu increases in amount, and improper Dhatu formation will lead to Dhatu Pradoshaja Vikaras and manifest all over dietetics principles and lifestyle which should be followed by to maintain the Agni are Ashtavidha Ahara Vidhi Vishesha Ayatana and pranayama and yoga like Vajrasana, Gitondasana, Paschimottanasana, Mayurasana, etc. Diets can be included as per Pushta Patya, Apatya. Like Patya are like Taila, Sashapa Taila, Nimba, Mudga, Shali, Yava, Goduma, Kadira, Trifala, Chakramata, Tiktarasa, Pradana Dravya. Apatya, Adilavana, Atyamla, Virudahara, Guru Snigdha, Annapana, and Ati Dravapana. Lifestyle practices. Lifestyle is a characteristic bundle of behavior that makes sense to both others and oneself in a given time and place, including social relations, consumption, entertainment, and rest. Ayurvedic lifestyle practices for healthy skin can be explained under Dinacharya, Ritacharya, and Satvita. Dinacharya includes Abhyanga, Vyayama, Snana, Tambula Sevana, Udvartana, Utsadana, and Utkarshana. Ritucharya includes in each Ritu there will be specific dosha, prakopa, sanchaya, and shamana. Based on that, the rasa which is opposite to the prakupita dosha or the sanchita doshas, based on that opposite guna rasa should be used in food, and diets ahara and viharas which increases the particular dosha should be avoided, and same thing is explained in the next slide. And charya, different charyas are also explained for each ritu. Mukhalevas according to different seasons is explained in Ashtanga Hridaya. Sadvita, these are principles of right conduct and that are principles applicable to all people at all the time and places. They are examples like always speak the truth, do not lose your temper under any circumstances, do not harm anyone, be patient and observe cleanliness, etc. General management of skin disorders. In Ayurveda, skin disorders are treated with Shamshodhana and Shamshamana Chikitsa. Based on dosha predominance, treatments are selected. Then, along with Nidana Parivajana and Patya Apatya, Ahara Vihara, future scope integration with modern dermatology and cosmetology, research works on including diet and lifestyle as main treatment in skin disorders. Ahara and Vihara forms chief foundation upon which life of individual is founded, and Prajnaparada is a faulty lifestyle which leads to chronic skin disorders. Adopting lifestyle and regimen helps in prevention of the disease. And I conclude by healthy habits, happy skin. Thank you.
Thank you, Dr. Vismita. Thank you for the wonderful session. Next, I would like to invite Dr. Prajakta Vidyasagar Ogle for the paper presentation.
Welcome to Kriya Shari Department. Myself, Vaidya Prajakta Vidyasagar Ogle, BMS PG Scholar, Shari Kriya Department, Government Ayurvedic College, Dharaka. My today's paper presentation topic is physiological significance of Kshat Kriyakar for Ayurvedic Chikitsa. Kriyakar, there are two divisions of Kriyakar, Rutu Kriyakar and Vedic Kriyakar. Rutu Kriyakar means it explains about the normal physiological variations of doshas that take place under different ritus, along with their preventative medicine. And Vedic Kriyakar means it described by Achyranthes. It is the stage of the dosh vaishamyam or stages of the disease manifestation along with preventative measures. Kriyakar is divided into Kriya and Kal. Kriya means Chikitsa, Kal means chance or time. So Kriyakar means Chikitsa avasar, to timely diagnose, to timely treatment. Kshat Kriyakar. Kshat Kriyakar is the Sanchaya, Prakopacha Prasaram, Sthana Sanchaya, Vyakti Bhedam Sayokti Doshanam Bhavedabhisha. There are 6 Kshat Kriyakar. Number 1 is Sanchaya Kriyakal means stage of accumulation. Second is Prakop Kriyakal is the stage of provocation. Third is Prasar Kriyakal means stage of propagations or migration. Fourth one is Sthan Sanchaya means stage of localization. Fifth one is Vyakti Kriyakal, stage of manifestation, and Bhed Kriyakal, stage of complications. Sanchay Kriyakal means stage of accumulation. Definition: Sahitrihi Rupaha Vradhichaya. Gradually increase of dosha is known as Sanchay. Sanchit dosh lakshan is due to the sanchay of dosh lakshans are seen. What sanchay lakshan? Stabda koshtata. Stabda koshtata means constipation, hypoperistalsis. Purna koshtata means intestine filled with moles. Pitta sanchay lakshan, pitava bhasata means yellowness of body, and manda ushmata means slight increase in body temperature. Kaph sanchay lakshan is anganam gauravam means heaviness in the body, and alasam means laziness. Prokop kriyakal means stage of provocation. Vilayanam rupaha vradhi prakopaha. The increased accumulated doshas now tend to explain is called as prokop. Prokop means inclination. Unmarga gamita. Try to going other places, living at own places. Here sanchay prokop. Here Sanchay Prokop is a Yatha Prokopa Prashamam, Vayu Grishma Adishitrishu, Vardhashu, Pittatsu, Sleshvana, Shirirashu. Here explain this diagram explain the Dosh Sanchay, Prokop and Prasham. Dosh Prokop Lakshan. Vat Prokop Lakshan, Koshtotod means pricking sensation in abdomen, Sanchana means sound of flatulence in abdomen. Pitta Prokop Lakshan means Amlika. Amlika means acid belching. Pipasa means excessive thirst, and Paridaha means burning sensation. Kaph Prokop Lakshan. Radev. Radev means heaviness in chest. Annadvesh means aversion towards food, and Utkled means nausea. Prasar Avastha. Prasar Avastha means stage of propagation. The word prasar means to spread. Moving or spread of whited doshas to other part of body in prasar avastha as in fermentation and filling of water tank. Aggravated dosa moves all over the body and manifests disease wherever they stop. That is whole body, half proportion of the body, part of body like cloud rains in sky. Dosh prasar lakshan. Vat prasar lakshan vimarga gamana means Vat moving in opposite direction. Pitta prasar lakshana. Osh means sense of boiling, rise of body temperature. Chos means excessive thirst. Paridaha means burning sensation. Dhumayanani means feeling as it fumes coming out from the body. Kaph prasar lakshan arochak, anorexia, loss of the appetite. Avipak means indigestion. Angasad means lack of activity, weakness. And Chardi means vomiting. Stance and stage of localization. Prasar avastha dosh, wherever they get placed, this starts localization is called stansanshray. Whenever they settle down, they develop new diseases. Those dusha samuchana. It is the stage of start of disease. It represents the beginning of the disease. Acharya Shushrut explain about the those dusha samuchana and give certain example. Udar those dusha samuchana in Udar manifest following disease like the gulma, agnivikar, विबंध आनाह विसूचिका अतिसा प्रवाहिका आणि बस्तीगत प्रमेह मूत्राघात आणि अश्मरी आणि बुद्धगत भगंदर अर्श आणि मेदगत ग्रंथी अपची अर्बुद अलजी गलगंट. Vyakt Kriyakal, stage of manifestation. Now the disease is seen fully developed and clear-cut symptoms is called as Vyakt Kriyakal. In Vyakt Kriyakal, the Lakshana will be in Rupa. Shock means inflammation, Granthi tumor, Vidradhi means abscess, Visarpa means cellulitis. These inflammatory disorders are fully developed in fifth Kriyakal. Sixth and last Kriyakal is a Bhed Kriyakal, stage of complication. In this Kriyakal, inflammatory will be Bhed rupture will leading to complications and permanent scars. Pranabhav. Scars means pranabhav. It is a last chance, then the disease will be asadhya. For example, Jwar Atisar will be seen for Dirgha Kalanubandhik. After that, Nidanartak Rog, Vyadhi Sankar. Example, if the Pandu is there, it will be accompanied by the Kamla. Relation between the Nidan Panchaka and Kriyakal. Vikruti Janna Kriyakal and Nidan Panchak Rog Lakshanatmak Gnan. Sanchay Prokop Prasar, its Nidan Panchak is Nidan. Stan Sanshray, its Nidan Panchak is Purva Rupa. Vyakt Kriyakal, its Nidan Panchak is Root. And Bhed Kriyakal, its Nidan Panchak is Chir Karita Upadra Asat. Kriyakal Jnan Prayojan. The treatment becomes more easier if the disease are diagnosed in the earlier stage. Doshas can be controlled in the early stage only, and we can avoid the dosh to move to the later stages. By knowing the knowledge of the Kriyakal, we can treat the disease in earlier stages only and also prevent them to further development. Once the disease becomes different, it is very difficult to remove it, and moreover, the long-lasting disease become resistant to the medicine and nullify the power of the medicine. Hence, an Ayurvedic physician should have detailed knowledge of the Kriyakal to treat the disease in earliest stage as possible. Thank you.
Thank you, Dr. Prajakta. Thank you for the wonderful session. Next, I would like to invite Dr. Pooja Dai Balaji Viddu for the paper presentation.
Welcome to Dharak National Seminar. Myself, Dr. Pooja Balaji Baddu, BMS PG Scholar at GSC Dharashaw. My presentation topic name is Panchamahabhuta, the Adharbhut Siddhanta and their application in Chikitsa. Firstly, the introduction. The concept of Panchamahabhutas is the foundation of Ayurveda to understand its physiology, pathology, and pharmacokinetics. Ayurveda believes that everything in this universe is made up of Panchamahabhuta. Panchamahabhutas are Prithvi, Aap, Tej, Vayu, and Akash. Every matter contains all these Panchamahabhutas. A single cell of living organism has combination of 5 components. The earth or the Parthiv or Prithvi Mahabhut forms the major structure of the cell. The Aap Mahabhut or the water forms the cytoplasm of the cell. Various metabolisms of the body cells are governed by Agni Mahabhut. The space inside the cell is governed by Akash Mahabhut. And finally, the channel through which the waste material and nutrients gets transported in various parts of the body is given by Akash Mahabhut. Evolution of Panchamahabhut theory. It takes place in 3 levels. First level, evolution of Panchatanmatra. Second level, Bhutantara Anupravesh. And third level is Panchikaran Siddhanta. That formation of Panchamahabhuta from Avyakta to Mahat, and then Ahankar are of 3 types: Vaikarik, Tejas, and Bhutadi. Vaikarik and Tejas combine to form the 11 Indriyas and mind, and Bhutadi and Tejas Ahankar combine to form 5 Tanmatras. 11 Indriyas, that are 5 sense organs, that is Shabda, Sparsha, Roop, Rasa, Gandha, and 6 locomotory organs, that are Akash, Vayu, Agni, Jal, and Prithvi. Evolution of Panchamahabhutas, that is firstly formed Mahabhuta is Akash, then Vayu, then Agni, then Jal, and then lastly Prithvi. Then properties of Panchamahabhuta. Panchamahabhuta having firstly the Akash Mahabhuta having the Shabda Tanmatra, Karnendriya, and Guna is Apratighat Guna. Then Vayu Mahabhut having the Sparsha Tanmatra, Vaka Indriya, and Chalatva Gun. Agni Mahabhut having Rupa Tanmatra, Chakshu Indriya, and Ushnatva its gun. Jala Mahabhuta having Rasa Tanmatra, Jibha Indriya, and its guna is Dravatva. Then Prithvi Mahabhut having Gandha Tanmatra, and Indriya is Nasa Indriya, and guna is Kharatva. Pancha Tanmatra and Sthan Vishesh. Pancha Mahabhut and its Sthan Vishesh. That is firstly Akash Mahabhut. Sthan Vishesh is Urdhva Jatrugat Pradesh. Vayu Mahabhut above the Nabi up to the Jatru Pradesh. Agni Mahabhut surrounding to the Nabi Pradesh. And Jala Mahabhut below Nabi or Kati Pradesh. Then Prithvi Mahabhut is Adoshaka. Characteristics of Panchamahabhuta. Firstly, the Akash Mahabhut present in hollow cavities within the body and empty areas of the cosmos. Any diet, food, herbs with the similar properties will increase the Akash Mahabhut within the body. Then Vayu Mahabhut, light, dry, subtle, mobile, transparent, and rough are the properties of Vayu. And any diet, exercise, medicine which has such properties will increase the Vata Mahabhut in the body. Then Agni Mahabhut, it is hot, sharp, intense, dry, and light. It emits light and heat. Any food, diet, exercise, herbs which has similar properties will increase these elements in our body. Example, ginger, garlic, pepper will increase the pitta dosh. Then Jala Mahabut, water is moist, cohesive, sticky, cool, soft, and oily. Water is present in many foods, milk, herbs, as well as in our body. Excess water increase in above mentioned characteristics in our body and decrease the opposite. That is, water intake is useful in diseases caused by Agni or Pitta and Vayu or Vata. Prithvi Mahabut, it is a solid, dense, stable, heavy, hard, dull, and slow. Any food, exercise, herbs which have similar properties will provide nutrition, support, and cause the heaviness in the body. It also improves the strength and stability. Then clinical application of Pancha Mahabhuta. If any of these Mahabhuta get vitiated in the body and cause the disease, then that Mahabhuta can be normalized by giving the drug and food having Mahabhuta of the opposite properties than the vitiated one. As the Prithvi Mahabhut get vitiated, it can be treated by giving Vayu Agni, Akash Mahabhuta Pradhan Dravya, as they comprise the opposite properties of the Prithvi Mahabhut. As per Samanya Vishesh Siddhant, Samanya is the main cause of increase and Vishesh is the main cause of decrease. So opposite Chikisa of the Eva Mahabhut, as we discussed, can be like to this in shown in the table. Next table is that is Mahabhuta and its opposite Mahabhuta. Akash Mahabhuta, the opposite Mahabhutas that are Prithvi and Jal. Opposite Mahabhutas of Vayu that are Prithvi and Jal. Agni that is Prithvi and Jal, and opposite Mahabhutas of Jal that are Akash, Vayu, and Agni, and also the Prithvi Mahabhut having the opposite Mahabhutas that are Akash, Vayu, and Agni. Then Dhatu Samhita. Dhatu Samhita is the ultimate aim of our Ayurvedic science. According to Acharya Charak, principle of Samanya helps in increasing degraded similar dhatus in the body. When there is a dhatu vriddhi condition, we have to use the Vishesh Dravyas in the treatment. To fulfill this purpose, we must know the Panchabhuti composition of therapeutic substance. Then Tridosh Prakop and Prasham. According to great Acharya Charak Sushrut, Vata, Pitta, Kapha are the main factors for the initiation of all pathogenesis inside the body because of having their symptom and their subsidence. As the entire universe is Panchabhutik, the entire disorders present in the different forms do not exist without three doshas. Dravyas composed of Prithvi, Agni, and Jal Mahabhut help in elevation of Vat dosh. Dravyas having dominance in Prithvi, Jal, Vayu Mahabhut elevates the Pitta dosh, and Dravyas having predominance in Akash, Agni, and Vayu Mahabhut reduces the Kapha dosh. Then Dravyas which are rich in Akash and Vayu Mahabhut violates the Vata dosh. Agni Mahabhut predominant Dravyas create the Pitta Prakop, and Prithvi and Jal Mahabhut predominant Dravyas aggravate the Kapha dosh. In this way, all Dravyas having the different composition of Mahabhuta properties. So by seeking accurate knowledge of properties of Mahabhutas, one can apply this into Chikitsa. Thank you.
Thank you, Doctor. Next, I would like to invite Dr. Rohit Anil Kajale for the paper presentation. Dr. Rohit, are you there? Dr. Rohit Anil Kajale, are you there? Okay, next I invite Dr. Prajakta Gajanan for the poster presentation.
Yes,
Dr.
sir.
Prajakta, good
Yes,
evening,
sir.
Doctor.
Good evening, sir. Um, sir, I have to share the screen.
Sure, Doctor, just a moment, I will share for you.
Sorry.
Sure, Doctor, I will share for you, Doctor, just a moment.
Okay, sir.
Please start the session, doctor.
Yes. Can I start?
Yes, doctor. Please start the session, doctor.
Yes. Good evening to all. Myself, Dr. Prajakta Gajanan Pasbole. I am a PG scholar from Gramin Ayurved Mahavidyalaya, Patur. My today's poster topic is the Ayurved management of pilonidal sinus with Apamarga Kshar Pratisaran, a case study. Introduction: infection of a skin and a subcutaneous tissue at or near the upper part of a nettle cleft of the buttocks. The aim is to highlight the benefits of the Apamarga Kshar Pratisaran. I have described the case description, that is a 26-year male with the complaints of pain and a pus discharge from the nettle cleft region, difficulty in sitting, and he has an intermittent fever. By local examination, we see in the 3 sinuses and presence of a tuft of the hair seen with a discharge with smell, palpation, and tenderness. On Chikitsa, the complete excision of the sinus tract done under local anesthesia. The tuft of the hair were removed from the tract and wound was cleaned by the betadine solution. Kshar was wiped away with a nimbusvarus and then Zatyadigrut Pichu was applied over the wound. Same process repeated every third day for 1 week. The result is given below in the pictures. The conclusion is the use of the above drug, that is Apamarga Kshar Pratisaran, shows a significant result and completely healed the wound within 5 to 6 weeks. And the reference is from the Sushrut Chikitsa Sthan 17. Thank you.
Thank you, doctor. Thank you for the presentation.
Thank you, sir.
Next, I would like to invite Dr. Shukra Sheshrao Wankhade for the paper presentation.
Hello everyone, myself Shukra Shishra Wankhade, PG scholar in Kriya Sharir from Government Ayurvedic College, Dharaka. My guide is Dr. Dimdim sir and my topic is a study of Vedic Shamatva with special reference to Oja. So we will first discuss about Vedic Shamatva and how it is related to immunity in modern science. In Ayurveda, Acharya Chakrapani has previously described immunity in terms of Vedic Shamatva. It can be defined as natural ability of body to fight against pathogen or disease causing factor. A word Vedic Shamatva made up from Vadi and Kshamatva. Vadi means is the condition in which both the body and the mind experience suffering. Vadi means disease or lack of balance in physical entities. And Shamatva means to resist or tolerance or endurance. There are 2 types of Vedic Shamatva. First is Vadi Bala Virodhitva and second is Vadi Utpadak Pratibandhakatva. First, Vadi Bala Virodhitva means capacity to resist any disease. Second, Vadi Utpadak Pratibandhakatva means capacity to resist causes of disease. The main principle of Vedic Shamatva is crucial for maintaining human welfare on a daily basis as well as for disease recuperation and prevention. The etiological factors attempt to cause the disease when they come into interaction with the body. At the same time, body works to fight off the disease. And Vedic Shamatva is not simply regarded as immunity as it is in modern science, where it is considered as immunity against a specific agent or any disease. But in Ayurveda, Vedic Shamatva refers to a resistance to the loss of integrity, composition, and interconnectedness among the human body's doshas and dhatus. In short, Vedic Shamatva means balance of doshas and dhatus. Now we will focus on concept of Oja. Acharya Charaka's concept of Dasha Pranayatna, where Ojas has been mentioned as one of the prana. Ojas is defined as vital energy and sara, extract of all saptadhatus, which nourishes all tissue and is responsible for optimal functioning of our body, mind and spirit. According to Matra, that is quantity, and the location where they are located, Oja is of 2 types. Para Oja, and Aparoja. Paraoja having 8 drops matra located in heart. Aparoja having Ardhanjali located in whole body. Being located in Hridaya, that is heart, Oja mixed with Rasadhatu and circulates through the Rasavahini Dhamanya and provide potion, that is nutrition, to the entire body. The main function of Oj is to control and regulate all physiological activities and immunity power of the body. That is Vadikshamatva. It is useful to maintain good mental health and physical health. Some of the other functions of Oj are strengthen the mamsa, that is muscles and other dhatus, provide nourishment to all elements of the body, its ability to perform all activities. It brightens the complexion, clarity of voice, external and internal sense organ perform their own function. The main cause of decline immunity is Ojadushti. Etiological factors for Ojadushti are Abhigat, that is injury, Dhatuksha, that is destruction of tissue, Krodh, that is excessive anger, Shok, grief, Dhyan, worry, Parishram, excess physical work, Kshuda, hunger, etc. Because of metabolic and mental abnormalities leading to diminished production of ojas, which create physical and mental fatigue, acute and chronic diseases, there are 3 types of abnormalities seen in ojas, which is called ojas vapatti. That is, first is Winstrons, second is oja vapan, third is oja kshaya. Unlike other dhatus, oja vriddhi is not a dushti. Here, oja vriddhi, that is increase in oja, is good for our body to strengthen it for its normal function. Oja vriddhi promotes growth of the body, but oja kshaya can lead to many diseases in our body. Common signs of oja kshayas are, or weak immune systems are, high stress level, frequent cold, digestive problems, frequent infections, skin problem, constant fatigue, etc. Every other individual nowadays is experiencing these signs. We can prevent this by practicing Ayurveda measures on daily basis. The basic Ayurveda measures are Aharacharya, that is diet, Dinacharya, daily routine, Ritucharya, seasonal routine, given in Ayurvedic text. This healthy measure can lead to healthy Saptadhatu formation, which will lead to healthy Oja formation, and which ultimately lead to build up great immune power. That is Vadikshabhatva against pathogen. The main purpose and objective of Ayurveda is preservation of health in healthy individual and eradication of diseases which are curable. According to the concept of Oja and Vadikshamatva, the body's resistance is of tremendous importance in daily welfare of living beings, not only for disease prevention but also for rapid recovery after disease affliction. Ayurveda propounds that prevention is an equally important aspect of disease management as cure, and thus strengthening the immune system is a natural way to help the body fight against the disease causing pathogens. Acharyas promoted the use of Rasayana to enhance Oja and Vadikshamatva. So, for prevention of diseases and maintaining health, adhering to concepts like Dinacharya, that is diet, Ritucharya, that is seasonal routine, and Dinacharya, that is daily routine, will be useful. So, we all should adopt to this concept of healthy living to maintain our Oja, hence increase Vadikshamatva. This is the summary of my topic. Thank you.
Thank you, doctor. Thank you for the wonderful presentation. Next, I would like to invite Dr. Priyanka Ashok Talmale for the paper presentation on the topic Tudika Parichadya.
Good evening, everyone. I, Dr. Priyanka Ashok Talmale, PG Scholar, Prasuti Tantra Department, LKR Ayurvedic College, Gadinglash, Kolhapur. I am going to present a topic, Sutika Paricharya. So what is Sutika? Sutika is defined as the woman who just given a birth to a child followed by expulsion of placenta. Sutika Paricharya. Paricharya is a routine followed and a care taken of a woman during puerperium phase, comes under the heading Sutika Paricharya. So, according to different acharyas, Sutika Kal is given in Samhitas is different. So, Kashyapa has given a 6 months period after Prasuti. Shushruta, Ashtang Hridaya, Ashtang Sangraha, Bhavprakash, Yoga Ratnakar has given 1.5 months or till the next Raja Darshan. Charaka hasn't given any specific time period for Sutika Kal. Sutika Paricharya by Acharya Kashyapa. Now, Paricharya is divided in 2 parts basically, Ahara and Vihar. So, Ahara to be followed for 3 to 5 days or 5 to 7 days after Prasuti is Mandapan, Hita Bhojan, Snehapan, Snehayavagu with Pipali Nagar and Lavana Rahit. Ahara to be followed for 7 to 12 days is Snehayukta Yavagupan with Lavan. Again, Kashyapa has given from 12th day, Ahara to be followed Kulathayush, Jangal Mausaras, Grita Varjit Shak. And from 30th day, Snehan, lukewarm water for drinking. And Vihar to be followed by Kashyapa is Rakshaguna Dravya, Ashvasan Chikitsa, Abhyanga and Sarveshtan, Ushna Balatel, Apurit Charma Asan, Yonis Vedan with Priyangu, Ushnodak Snan, Vishranti, and Dhupan. Dhupan can be done with Gugulu. Sutika Paricharya by Acharya Shushrita. So, Ahara to be followed for 2 to 3 days after Prasuti is Vatahar Aushadakvat, Ushna Gurodak with Pippaladi Dravyas. Then Ahara to be followed for 3 or 4 to 6 days or for a week. Sneha Yavagu, Kshira Yavagu with Vidangadi Dravyas. And from 8th day onwards, Jangal Maunsaras with Yava, Kola, Kulatha and cooked shali rice. Now Vihar to be followed by Acharya Shushrita. Abhyanga using Balatel, Parishek with Vatahar Davya, Bhadradardavadi Kwat. Now Acharya Vagbhat in Ashtanga Sangraha, he has given Ahara to be followed for 3 or 5 or 7 days. Sneha Yogya Snehapan with Panchakol Churna with Sendo. Sneha Ayogya Vatahar Laghu Panchamulakvat. Kshira Yavagu with Vidari Gandhadi Dravyas. From 8th day to 12th day, Vagbhata has given Ahar to be followed in Ashtanga Sangraha. Laghu Annapan, Yava, Kola, Kulatha, Yush. And from 12th day onwards, Jangal Maunsaras, Jivaniya, Brihaniya, Madhur, Vatahar Dravya, Annapan. Vagbhata has given a Vihar to be followed by Prasut. Vagbhata in Ashtanga Sangraha has given a Vihar to be followed. Balatel Abhyanga, Thanik Udar Abhyanga with Grita Tela, Udarveshtan, Ushnodak Parishek, Udavartan Avgaha, and Sutika Snanotsav from 10th or 12th day. Now Vagbhata is given in Ashtanga Hridaya. Ahara to be followed is Sneha Yogya, Snehapan, Mahati Matra with Panchakol Churna for 2 to 3 days. Ushna Gudodak or water medicated with Vatahar Dravyas. Sneha Yogya only Panchakol or Vatahar drugs. Peya medicated with Panchakol. This is for 2 to 3 days. Then from 4 to 7 days, Sneha Kshira Yavagu medicated with Vidangadi Dravyas. From 8 to 12 days, Jivaniya, Brihaniya, Madhur Varga, Siddha, Vidya Annapan are to be followed from 12th day, she can have Mausaras. And Vihar to be followed is Yoni Abhyanga, Udarveshtan, Parishek, Avagaha, and Sutika Uthan. From 5 to 7 days, Snehapan with Panchakol Churnam, Sarpi, Tail, Vasa, and Majja. Yavagu with Pipalyati Dravya, Grita. And Appayan Chikitsa from 7th day. So Acharya Charaka has given Vihar is like Abhyanga, Parishek with hot water twice a day, and Udarveshtan. Udarveshtan is abdominal support after Prasuti. Nowadays, even we are giving abdominal belt to Sutika. Specific Paricharya on the basis of Desha. Anupadesha, if Sutika is staying in Anupadesha, Manda with Agni Bala Vardhak Dravya, Ushna Dravya Sevan, Jangal Desh, if she is staying in Jangal Desh, Snehopachar, Sadharan Desh, Sadharan Vidhi, specific Paricharya according to sex of child. If Sutika is having male child, then she has to take Telapan. If she is having female child, she can have Ritapan. After Prasuti, Sutika will have next periods, that is Rajodarshan. The factors responsible for appearance of menstruation after delivery are replenishment of dhatus, steadiness in body, accumulation of blood in yoni and uterus. Sutika follows all these ahara vihara. In Sutika Kal, she will regain her pre-pregnancy state. Thank you.
Thank you, doctor. Thank you for the wonderful session. Next is a poster presentation. I would like to invite Dr. Deepak Pandit for the paper presentation.
Hello everyone, myself Dr. Deepak Pandit, PG scholar from Government Ayurvedic College, Dharaka. My guide name is Dr. Dimdime, HOD and Professor of Kriya Shariri Department, Government Ayurvedic College, Dharaka. Today's my poster presentation topic name is Role of Ayurveda in Post-COVID Era. This poster topic is divided into following 5 parts and we will discuss according to these points. These points includes introduction, need of study, methodology, role of Ayurveda, and conclusion. Now, first part is introduction. As we know, COVID-19, the recent virus outbreak declared as pandemic by WHO and threatened the world by its fast-spreading nature and is yet creating an alarming situation throughout the world by post-COVID symptoms. COVID-19 pandemic is an ongoing pandemic of coronavirus disease 2019 caused by severe acute respiratory syndrome SARS. On 31st December 2019, a cluster of cases of pneumonia of unknown causes in the city of Wuhan in China was reported to the WHO. The most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients have aches and pains. The next part is need of study. Signs and symptoms that develop during or after an infection consistent with COVID-19 continue for more than 12 weeks and are not explained by an alternative diagnosis. It is usually present with cluster of symptoms often overlapping which can fluctuate and change over time. Following are the most common post-COVID symptoms found in the population. These are fatigue, headache, shortness of breath, abdominal discomfort, dry cough, weight loss, anxiety, PTSD, and insomnia. Now, the third part is methodology. Post-COVID manifestation can be understood as Agnimandi Avastha and Dhatukshay Avastha in individual. Hence, modalities like Agnivardak and Rasayan property meditations can be chosen. Rasayan therapy is the one which brings the normalcy in immune system by improving fundamental like Dhatu, Srotas, Agni, and ultimately fights against post-COVID symptoms. Now, next part of this poster is role of Ayurveda, which is divided into 4 parts or pillars. The first pillar is Vihar, also considered as Nidan Parivarjan. Here, we should consider COVID-appropriate behavior by which one can avoid the triggering factor from reinfection. This includes avoid crowding, maintain social distance, use mask always, and hand sanitization. The second pillar of role of Ayurveda is Chikitsa. Here, prescription of Aushadhi based on Bala of patient includes careful use of Shodhana like Vaman, Virachan, Basti, Nasya according to the Shvit Parikshan of individual. Also, use of Shaman Chikitsa like use of Samshivani Vati, Ashwagandha Vati, Lakshmi Vilas Ras, Brotwa Chintamani Ras, Amrutarishta, etc. Rasayan. Use of various Rasayan like Agasti Haritaki, Chaunprasha Avleha, Chitra Haritaki Avleha, Kushmandapak according to patient situation we can use. Most Rasayan produce their nourishing and rejuvenating effect by promoting Agnibala, Stotopasadan, resulting in improved nutritional status which results in good quality dhatu or body tissues. Patyahar. This includes Lavanadrak, Bhakshan, Yavagu, Saktu Sevan, spices like jeera, black pepper, garlic, coriander, ginger, ajwain should be used in cooking. Shadang Pani also used. The third pillar is Achar, which includes Dincharya, Rutucharya, Achar Rasayan, Yoga and Pranayam. Dincharya are ideal daily life routine instruction which is followed as lifestyle should prevent post-COVID related problems. This not only help in provision of physical health but also attain mental and social health. Ayurveda suggests to begin daily habit with awareness, early rising, avoid suppression of natural urges, and eliminate waste as per urge. Keep skin and teeth cleaned, regular use of massage, regular daily bathing, consume suitable and wholesome diet according to the appetite and metabolic needs. Also suggested avoiding late night sleep and eating stale food. Rutucharya. These are primarily set of instruction which, if ideally followed as per season, shall help individual to physically and biologically to a particular season as well as make him free of seasonal alignments. This includes dietetic instruction, clothing instruction, behavioral instruction, Shodhana instruction as per seasonal needs. Achar Rasayan or Sadurtha. Ayurveda offers some code of good conduct under heading of Achar Rasayan or Sadurtha Palan. These include personal, for example, early sleep and early wake up; social, for example, keep mercy on others; psychological and emotional, for example, try to be in steady mental state, avoid height of emotions. Fourth is yoga and pranayam. Sukshma Vayam, warm up, loosening exercise for all joints, yogasana in different posture like sitting, supine, prone position, use of shavasana. Then pranayam includes deep breathing, nadi shodhan pranayam for 10 minutes daily. Pranayam have good effect on lungs capacity. Now fourth pillar is vichar, which includes ashwasan, vignan, rehabilitative care, and meditation. Ashwasan reassures the patient in form of education and telling the patient about post-COVID manifestations and educating them to follow proper diet and personal conduct and increase the self-confidence to fight against the disease. Vigyan, self-awareness, awareness about disease condition and look forward for positive hope by avoiding myths and fake news. Third, rehabilitative care, correcting depressive thoughts and negative thoughts by friendly advice. Deep breathing exercise, which increases lung capacities in long term. Meditation. Meditation positively influences mental health and thus helpful in combating post-COVID symptoms. Now we are coming to last part of this poster is conclusion. According to Ayurveda concepts, there will be Dhatukshay and Agnimandi Avastha in post-COVID infection. Hence, Dhatu Poshan and Rasayan Sevan drugs for at least 45 days and to combat the residual effect of the virus on the body and the combat toxicity produced from antiviral drug therapy. Ayurveda has enormous potential and treatment options which are available for enhancing the immunity and systemic illness and positively influence mental health. Thus, helpful in combating post-COVID symptoms. Hence, Ayurveda should be used as main treatment modality for health restoration and prevention of recurrence rather than an adjuvant therapy in treating post-COVID symptoms. Thank you for listening my presentation. Thank you once again.
Thank you, Dr. Deepak Pandit. Thank you for the well explained poster presentation. Thank you so much, Doctor. Next, I would like to invite Dr. Aarti Devi for the paper presentation.
Good evening, all of you. Myself, Dr. Aarti Devi. I am the PG student of final year at Sharirishta Department of Government Ayurvedic College, Osmanabad. Today, I am going to present my topic on role of yoga and yogasana in physical and mental health. So, as we all know that Maharshi Patanjali is the propounder of the yoga philosophy. So yoga is very scientific philosophy. We can find its references in Vedas, Upanishads, Samritis, and Puranas, and it is now propagated throughout the world. As we know, healthy body and strong mind both are the subject of its study. So ये जो philosophy है that believes that a sound mind resides in a sound body only. Purity of mind makes the mental attitude choices. As per Ayurvedic scriptures, the practice of yoga nowadays leads to the union of individual consciousness with that of the universal consciousness, which is indicating a perfect harmony between the mind, body, man, and nature. Again, I am focused on the importance of the yoga. So yoga is a way life. Yoga is a today's life. This is an ancient Indian science which influences the functioning of the brain and rest of the body. So yoga is a form of physical exercise that involves different body poses, breathing techniques, and meditation. A regular practice of yoga nowadays may help to relieve the stress, which is a major factor of many diseases today. It lowers the anxiety level, it decreases the depression, it improves your sleep quality, it enhances quality of life. So yoga is thought to achieve following benefits to boost the physical and mental health in several ways. As an exercise, it naturally produces serotonin, sometimes called the happy hormone, because this contributes to feeling of well-being and happiness. Serotonin in the brain is a natural mood stabilizer and has been associated with helping anxiety and stress. Second thing is regular yoga practice teaches deeply focused and mindful breathing, two important elements in helping to relieve the depression. The participant can better focus on the present, clear their mind, and strengthen the many mind-body connection. As well as while we go through the mental condition, your mental health, so yoga impacts the mental endurance and physical stamina. While we doing the yoga, through holding the posture through extended breaths, this increased endurance, strength, and flexibility. It helps modulate the stress response, reduces the heart rate, lowering the blood pressure, and easing respiration. This may also help in managing pain tolerance. So, yoga is only in full effect when both mind and body are completely engaged. It offers a unique opportunity to make a powerful impact on mental health. Now, yoga have different impact on men and women. So while we go through the benefits of yoga in men, it enhances their athletic performance through improved flexibility, internal awareness, better respiratory capacity, better circulation and motion efficiently, and greater energy, preventing energy and speed up recovery through the healing of inflamed muscles, tissue, joints, and fascia, as well as the restoring of the connective tissue and increased body awareness, which lead to more cushion and less injuries, optimize their muscle tone by increased delivery of oxygen to the muscle. It lower the stress level through the movement, increasing their mental agility through the sharpening of the mind and improved cognitive functions that come with the meditative exercise of the yoga. So in the same way, there are some benefits of the yoga for the woman also. It helping the woman, which while through dealing with the hormonal changes during their menstrual cycle, their menopausal period, it's soothing the worry and anxiety which is caused by a healthy crisis or serious diagnosis. It's lessening the stress and reducing the severity and frequency of the anxiety and depression symptoms, improving women's posture, improving the appearance through standing taller, feeling more confident and more effective weight management. You can gain the weight or you can reduce the weight through the yoga. So moreover, yoga benefits in older adults with mental and physical health in the following ways. As we know, hypertension, diabetes is a common problem nowadays. So it firstly it lowers the blood pressure, reduces the respiratory rate, enhances the body flexibility, improve muscle strength and endurance, improve the balance, increase the joint motion, reduce the depressive states, reduce the problem behavior. So these are all diseases. Yeah, these are all symptoms which are faced by our old patients in nowadays. So while we go through all the conclusion, we can find that yoga makes you feel better and it increase the flexibility. It helps an individual to be more productive with time, gives more energy, and boosts metabolism. As we all know, nowadays everybody is busy in their life while they are doing work and something. And while we're doing the yoga, we can give much more energy to our work and we can keep our mind relaxed. So it helps through yoga, we can also help in focusing and become more mindful. Yoga improves the physical and the mental health as well. So thank you all of you.
Thank you, Dr. Aarti Devi. Thank you for the wonderful presentation related yoga. Next, we go to the another paper presentation. Next, I'd like to invite Dr. Rituja Balakrishna Mangore for the paper presentation.
Dr. Tuja Krishna Mangore. My topic is randomized control comparative study of Navakarshi Gutika and Yashtari Yoga in the management of Shita Pitta with special reference to urticaria. Introduction. Shita Pitta is a disease caused when patient is exposed to cold breeze. Due to this, there will be irritation of kapha and vata dosha. These two combines with pitta and circulates all over the body, producing signs and symptoms over the skin. The symptoms are seen like Varati Dhamsravata Stota, Kandu, Shula, Daha. Shita Pitta is having symptomology and causative factor to that modern view of urticaria. Need of study. According to Ayurveda, vitiated kapha and vata dosha combines with pitta, which leads to shita pitta. Hence, the proper understanding of samprati is Vigatana plays important role in shita pitta roga. Therefore, attempt will be made to work on Navakarshi Gutika. Navakarshi Gutika is mentioned in Bhavaprakash chapter number 8 by 9. It contains Amalika, Haritaki, Bibitaki, Gugul, Pipali. These all ingredients play important role in dosha shamak chikitsa. The content of Navakarshi Gutika are easily available, cheap and affordable. Review of literature. The literature will be taken from Ayurvedic classical granthas, modern literature, article or text or relevant research work concerned with the subject. The causative factor, pathogenesis, that is samprapti, types, classical signs and symptoms, purvarupa, avastha, pratyatmat lakshana has been mentioned. Detailed description of the various herbal formulation, yoga given in the management of Shita Pitta. Contemporary books, Davidson Principles and Practice of Medicine, K.D. Tripathi, Essential of Medical Pharmacology, Harsh Mohan, Textbook of Pathology, Harrison's Principle of Internal Medicines, API Textbook of Medicine. Disease review, Samprapti Lakshana, contemporary review, that is a modern review of the Shita Pitta. This urticaria is a common recurrent skin disorder of sudden onset characterized by sudden formation of reddish wheals accompanied by the intense itching, pricking sensation. It is classified into two types, acute and chronic urticaria. Acute episodes of urticaria last for 6 weeks or less. Acute urticaria is generally due to foods such as eggs, nuts, etc. In most of these cases, reason of urticaria is avoided. The house resolves if the patient continues to be exposed to the known trigger. The condition may become chronic. Control drug is Yashtadi Yoga. Objective primary question to study the efficacy of Navakarshi Gutika in the management of Shita Pitta with special reference to urticaria. Method of selection of criteria of study of subjects. Selection criteria, minimum 60 patients. Inclusion criteria, classical sign and symptoms of Shita Pitta. Patient above 18 age and below 60 years, irrespective of gender and socio-economic condition. Exclusive, below 18 and above 60, patient known case of hypertension, diabetes or any long-standing systematic illness. Withdrawal criteria, patient not regular follow during the course of trial. If any serious condition develops which requires urgent treatment such as objective were withdrawn and managed according to need. If patients themselves want to withdraw from the study, such a subject may be withdrawn from the trial and are considered as a dropouts. A rescue drug will be injection Avil 2cc IM IV. Data collection, primary data. The method used for the data collection is the observation method, and tools used to collect other data was structured case paper. Secondary data. The secondary data has been collected from the various sources like web search, modern books, as well as classical Ayurveda text, video, case study, journals. Clinical study assessment will be analyzed on the basis of improvement in the clinical feature. Assessment will be done on the basis of the subjective criteria and objective criteria. Subjective is Shotha, Kandu, to the frequency of attack. Objective criteria, absolute eosinophil count. Observation and result. Detailed clinical observation will be made after a month of assessment of the result. It is analyzed by the appropriate statistical test. The final data will be divided into 4 groups as per gradation of the relief of the symptoms. research methodology, ethical clearance, consent, statistical analysis, statistical tools and measures, discussion, conclusion and summary. Thank you.
Thank you, Doctor. Thank you for the wonderful presentation. Next, I would like to invite Dr. Divyani Dilip Botre for the paper presentation.
Good evening, sir. Good evening, madam. My name is Dr. Divyani Dilip Botre, MD Pediatric, Comarbhutta Department, 3rd year. I am here to present my paper on comparative clinical trial to evaluate the clinical efficacy of Tilasaptak Churna and Murvade Churna in the management of the Pandu with a special reference to the iron deficiency anemia introduction. In Ayurveda, Pandu Roga is one of the major diseases described in the Sahita like Dhunatri, Kshar Tail, Bhaishya Ratnavali, Yoga Ratnakar. Pandu is a Rasapadosha, Pitta Pradana, Tridosha Javadi, Rakta gets mediated by the dosha, mainly by the Pitta dosha, as Rakta is a Pitta Vargiya, and it leads to the common condition like a Pandu. This disease is termed as a Pandu, is considered a Panduta as a predominant sign. It is characterized by the clinical features such as a Panduta, Darvalya, Angasada, Annadresha, Shrama, Brahma, Gatra Shola, Aruchi, Hatanaha, Akshishota, Shitoha. Iron deficiency anemia is currently most common and widespread nutritional disorder in the world. According to the WHO global data, iron deficiency anemia affects approximately 37% of the school-going children. Defective absorption of iron and inappropriate deficiency dietary intake of food are the main cause of the iron deficiency anemia. Need of study. Pandu Roga is one of the most common disorders in the developing countries. According to the 3rd National Family Health Survey, 70% of the children are having anemia. In today's changing world, lifestyle, diet, habits have changed very rapidly. School-going children are more indulged in the junk food consumption. Hence, the intake of the iron-rich food is less, which make it difficult to attain the adequate iron consumption. Ayurvedic Chikitsa concentrate on the proper function of Agni, which is very important for the proper digestion, absorption, assimilation of the nutrients to meet the demand of the body, instead of having importance to the only iron therapy and iron loading. Ayurveda has a great heritage. Murvade Churna is one of the polyherbal formulation mentioned in the Bhaishya Ratnavali Ratnakar for the management of Pandu. These formulation contain Tila, Chitraka, Trikuta, Vidanga, Patya, Murva, Bala. Chitraka is a deeper Pachan drug and improves the Agni Mandya. Trikuta and the Vidanga improves the quality of a blood. Hence, this formulation having indication in the Pandu Roga is selected to evaluate its efficacy in the importance of HB and the red blood cells indices in the Roga. Research question. Is the Tilasaptak Churna is more effective than the Murvade Churna in the management of the Pandu Roga? Hypothesis. Null hypothesis. Tilasaptak Churna is less effective than the Murvade Churna in the management of Pandu Roga. Alternative hypothesis. Tilasaptak Churna is more effective than the Murvade Churna in the management of Pandu Roga. Literature from Ayurvedic Sahita, Charak Sahita, Chikitsa Adhyay 16, 11, 16. Sushrut Sahita, Uttar Tantra, Ashtang Hriday, Adhyay 13, 3, 8. Drug review. Tilasaptak Churna. Til Agnika Yosha Vidanga Patya Churna Gudinata Jayat Saman. दुर्नामका पांडु गदान कास अग्नि साद ज्वर गुल्म रोगान भारत भेषज रत्नाकर योग रत्नाकर मुरवादय चूर्ण मुरवा बलावंती बलान्वित चूर्ण त्रिकस्योष्ण वारिना पांडुरोग विषानाशाय प्रातरुत्थान संप्रेषित भाष्य रत्न भारत भेषज रत्नाकर. Aim and objective. To study the effect of Tilasaptak Churna and Murvade Churna in the management of Pandu. Primary objective to compare the effect of Tilasaptak Churna and Murvade Churna in the importance of HB percent and RBC index in the Pandu Roga. To compare the effect of Tilasaptak Churna and Murvade Churna in the improvement of the Pandu Roga Lakshana. Methodology. Randomized comparative study. Assessment for the eligibility. Inclusive criteria. Randomization. Group A. Group B. Conclusion and result. Study design, open label randomized comparative study. Study setting, OPD and IPD of the Balrog department. Study population, patient diagnosed with the Panduroga in the OPD and IPD of the Balrog department. Duration of study, 18 months will be study duration. Sample size, 30 patients per group. Method of selection of the study subject. Inclusive criteria are patient of the age group from 5 to 12 years, either sex, suffering from the Pandu. Subject with the mild to moderate anemia, age with 7 to 11 gram per day. Real subject fulfilling at least one or greater than one subjective criteria, that is Panduta, Aruchi, Daurbalya, Pindiko-Dveshtana. Parents willing for the clinical trial. Exclusive criteria, patient below 5 years and above 12 years of the age group. Patient other than the iron deficiency, anemia. Congenital disorders related with the hemopoietic system like sickle cell anemia, leukemia, and thalassemia. Subjects with any infection disease, subject with the bleeding disorder such as the hemorrhoids features. Withdrawal criteria, parents of the subject refuse to continue the treatment. Non-cooperative patient, if any, subject with no follow-up. Operational definitions. Churna, it is the fine powder of a completely dry drug or drug which is filtered through the clothes. Iron deficiency anemia occurs when there is a decrease in the total iron body content severe enough to diminish erythropoiesis and causes the anemia. Mild anemia is HB% greater than 10 milligram per dl having a muscular pallor. Moderate anemia, HB% 10 to 10 milligram per dl having a skin pallor. Study instruments, stethoscope, semi-automated hematology analyzer, data collection and tool, case record form. Assessment parameter. Assessment parameter are subjective parameters, that is nakha, netra, toka, jiva, hasta, talapanduta, and aruchi, durbalya, pindukadoshtana. Objective criteria are HB% and the MCV. Treatment details. Parameters, Group A and Group B. Number of the patient, having 30 patients in each group be treated with the Jiyatila Saptak Churna, 30 patient, and Murade Churna, 30 patient. Route of admission are orally, time once a day. Anupan for the Tila Saptak Churna is a good pani and Murade Churna is also a good pani. Kala, Pratakali, before breakfast. Duration is 30 days. Follow up on the 0 day, 15th day and 13th day of the treatment. Dose will be calculated according to the Dilling formula. Dilling formula is age in year divided by 20 into adult dose. Age in year is 5 to 12 years. Dose is 40 to 80 mg per day. Assessment of the clinical result. Observation of the for the subjective criteria as the symptoms are nakha, netra, toka, jiva, hastatala, aruchi, daurbalya, and the pindicodostan on day 0, day 15, and day 13. Observations for the objective criteria is the HB%, MCV, MCH, MCHCA, RDW before and the after treatment. Thank you.
Thank you, doctor. Thank you for the wonderful presentation. Next, we go to the final paper presentation. Sorry. Next, we go to the final poster presentation. I would like to invite Dr. Khule Sujay Sudhakar for the poster presentation.
Good evening. मेरा नाम डॉक्टर सुजय सुधाकर गुले है। मैं रिव्यू ऑफ लिटरेचर उसका पोस्टर वैकुंठम चिकित्सा के अंडर कर रहा हूँ अंडर गाइडेंस ऑफ द मार्गदर्शक मेरे वैद्य वीके कास्ले सहायक प्राध्यापक विभाग व संस्थान शल्यतंत्र विभाग शासकीय आयुर्वेद महाविद्यालय व रुग्णालय धाराशिव। परिचय। आतो विप्लापनम कुर्यादम द्वितीयम अवसेचनम द्वितीयम उपना है चतुर्थी पाठनम पंचनम शोधनम कुर्यातम षष्ठरोपणम इष्यते एते क्रमा गणयुक्ता तत्वं वैकुंठम। अर्थ गण के रोपण हो जाने पर वन वस्तु सामान्य करने के लिए वैकुंठम का अवलंब किया जाता है। उत्साधन सूखे हुए अल्प मांस वाले तथा गहरे वनों में उत्साधन करे। उसके लिए अपामार, अश्वगंधा, मुसली, सुवरचला, का कोल्याधिकन इनका घृत सेवन करे और आलेप करे और मांस सेवन करे। द्वितीय, अवसादन, उभरे हुए मांस वाले अंगों को अवसादन करे। इसमें कास्तीसाठी द्रव्य कास्ती जैसे कास्ती तैंद मनशिला कुकुटांड कपाल सुमधलोपलानी शीर्ष और करंज के फल धातुचे ये सभी उसके साथ मिलाकर प्रयुक्त किए जाते हैं। तीसरा क्रम पांडुरंग, भली बातें न बढ़ने के कारण जो वन पश्चात तरजन्य काले हो गए हैं उसमें पांडु कर्म करें। इसके लिए रोहिणी फल को 7 दिन बकरी के दूध में रखें, तत्पश्चात बारीक पीस कर लेप करें। द्वितीय कपालिका चूर्ण, वैतूल, सर्जरस, कास्तिस, मुलेठी के चूर्ण में मधु मिलाकर उसका प्रलेप करें। कृष्ण भली बाती न बढ़ने के कारण जो अनपश्चात जिनमें श्वेत हो गए हैं उनमें कृष्ण कर्म किया जाता है। इसके लिए फलदाता को 7 दिन भावना देकर देने पश्चात उससे तेल निकाल तत्पश्चात ग्राम्य पशुओं के खुरों को जलाकर उनका वस्तु बना ले और फलदाता तेल के साथ लेप करे। अभी पंचम कठिन अल्पमास वाले एवं वात से दूषित वनों में रुजु कर्म करे। इसके लिए वातर औषधियों से सिद्ध का पानी एवं सेक करे और रक्त मोक्षण करे। गाढ़ बंद करे। दारू दारू कर्म के लिए दारू कर्म करे। इसके लिए श्रियम अशोक रोहिणी पर त्रिफला धात्य रौद्र सर्जरस चूर्ण लगाए। सातवां रोम संजन इस प्रणों में भरने के पश्चात रोमापरण स्थान पे रोम संजनन करे। उसके लिए संजन चूर्ण को बकरी के दूध के साथ मिलाकर लेप करे। 4 पैरों वाले पशुओं की त्वचा, बाल, सिंग और हड्डी की वस्तु को तेल में मिलाकर लेप करें। तीसरा उपाय कास्ती करंट पर पवित्र में मिलाकर लेप करें। 8वां और आखिरी उपाय रोमापरण, अतिरिक्त बालों के कारण जो रन भली बाती न भरता हो उस स्थान पर रोम अपहरण करें। उसके लिए शंख चूर्ण 2 भाग, हरका चूर्ण 1 भाग, कांजी में लेप करें।
Thank you, Dr. Kule Suji Sudhagar. We have come up to the end of today's session. As we come up to the end of day 2 of the Dharaka National Seminar, I would like to take this opportunity to express my heartfelt gratitude to all the participants. Your presentations were insightful, well prepared, and truly enriched the seminar. Each of you contributed significantly to the success of today's sessions, and I applaud your dedication and effort. I would also like to extend a special thanks to the panel members who have been with us throughout this seminar. Your guidance, expertise, and unwavering support have been invaluable. We deeply appreciate the time and effort you have invested in making this seminar a success. Furthermore, I want to acknowledge and thank the professors from various colleges who have helped us organize this event. Without your encouragement and assistance, conducting a program of this scale would not have been possible. Your commitment for fostering academic growth and collaboration is truly commendable. Finally, I would like to thank everyone for their active participation and engagement over these past 2 days. It has been a wonderful experience, and we look forward to the continued success of the seminar. Thank you and have a great evening. Thank you so much.